Hello, people. We're getting there.
Recording in progress.
Hello, Supervisor.
Hello there, Rhonda. One third. All right, I see a Vice President, Supervisor Lee, Supervisor Chavez, and I saw Supervisor Sumerian is there. Wonderful. Jess, can you please take roll?
Supervisor Lee,
Present.
Supervisor Chavez. Here. Supervisor Sumerian,
Here.
Vice President Ellenberg,
I'm here.
President Wasserman.
Here as well. Thank you very much, Jess. And board members, we're going to head to 18 and then 8, and then kind of back in order, 9 and 10. All right. So 18, if I just flip over my binder, Supervisor Ellenberg.
Thank you. Thank you so much. It was really important to me today to partner on 2 separate referrals. The first declaring no confidence in the sheriff, which our board passed unanimously about 30 minutes ago, and another one that essentially declares no confidence or insufficient confidence in continuing to operate our practices of pretrial incarceration and reentry in the same way, and expecting that we can improve outcomes for individuals who come into contact with the criminal legal system in Santa Clara County. This referral outlines 2 paths, both of which I believe need to be pursued with equal fervor. First, the Reentry Network and the Office of Pretrial must work with the district attorney, the courts, and our other partners to continue to reduce the number of people that are confined to custody while awaiting court dates. About 80% of the folks in our county jail on any given day have not been convicted of a crime. We do know that any time in custody directly contributes to additional trauma and doesn't necessarily keep the community safer. We also know that about 75% of people show up for their assigned court dates. So I think that there is a strong argument to demonstrate that we can demonstrate greater confidence in keeping people in community where they can continue on with their lives, not be separated from their families, and receive whatever sources, resources, or services that are needed to prevent future run-ins with our law enforcement system. We must also ensure that they aren't jailed within their homes through an expansion of electronic monitoring that functions as a virtual expansion of incarceration, but rather authentically recognizing that as they've not yet been convicted of a crime, shouldn't be mistreated or mistrusted or treated as criminals. I also want to be clear, though, that keeping people out of jail doesn't mean abdicating our expectation that they be held accountable for whatever action was deemed to be contrary to law. We can and we must use community-based solutions in partnership with county services to redesign what accountability looks like and how it can be immediately paired with rehabilitation and restorative efforts. I look forward to exploring methods of restorative and transformative justice in collaboration with community groups. And second, and this goes to a lot of what Sheriff Smith talked about earlier today, for those whom the courts or the district attorney does not allow pretrial release, we must find mechanisms to ensure the safety of those individuals while they are in county custody. 67% of the total population and 80% of women who are booked into custody are diagnosed with some mental health illness. It has been made tragically clear time and again that people with mental illness are not safe in our jail. One mentally ill person in our custody was killed by correctional officers. At least 2 others suffered irreparable grievous harm while under the supervision of correctional officers and/or deputy sheriffs. Incarceration itself is traumatizing to the people who are experiencing it and to the families of those who are incarcerated. We also know from people who have had the experience of being incarcerated that it creates lasting mental health illnesses that can impact an individual for the rest of their lives. We must ensure that the people who are incarcerated in the county jails are met with the sufficient mental health supports and resources during the duration of their time in county custody and long after then released, rather than being met with further trauma. I support as well a lot of the comments that were made previously regarding the overall inappropriateness of holding individuals who are suffering from significant mental illness in our carceral system altogether, and look forward to having an option that allows us to remove them from custody as quickly as possible. We need to explore ways in which working with our unique structure of board authority over the Department of Corrections to shift as much responsibility away from the sheriff as possible and ensure that the jail is staffed with people who are properly trained and skilled to meet the very high needs of this population. The sheriff did acknowledge that her correctional officers and deputy sheriffs are not sufficiently trained, and it is true that they are not therapists. They are responsible for the basic life and safety, but we need to have other services in the jail. And one of the current challenges really is access. And something that the sheriff also noted in talking about the need for additional services and partners rang very strongly with me, because the sheriff's office still controls the access to the jail. And in working to expand access for more community partners to be able to come in, we can do a much better job meeting those needs. Again, in the short term, and in the longer term, we need to think about alternative infrastructure that removes people with serious mental illness beyond the confines of the jail and the purview of the sheriff's office altogether. I want to thank Supervisor Chavez for partnering with me in this system redesign work, and really express to all of my colleagues gratitude for your understanding that we really are dealing with multiple issues here. We addressed the issue around a particular individual in our previous item, and now we really need to talk about system reform and what, in fact, the Board of Supervisors does have the power to do, and how we are able to reshape and redesign our systems for better outcomes for all county residents. And I will make a motion to approve the referral and look to Supervisor Chavez for additional comments and hopefully a second.
Let me turn to Supervisor Chavez, see if anything's left.
Yeah, I'll make the second.
And then
Brian Welch, you're not on mute.
you can help kind of put together.
Brian.
I
Brian,
don't have a
there you go.
name.
He's muted.
I know he keeps unmuting himself. So I really appreciate the work, Supervisor Ellenberg, of you and your team on this. And I think what I'm most looking forward to is having this come back to the reentry network as a sounding board, in part because we have such a diverse group of leaders that sit on that. And one of the things I'll just highlight for my colleagues that I'll be bringing forward in the next couple of weeks is that we want to add another lived experience position, because we think that that's really going to help. And I also think we need to, consider adding a victim advocate as well, because I think we want the robust, full discussions about how we're approaching public safety. And then the last thing I want to add is that I do really want to emphasize that our goal has to be overall public safety with this balance of civil rights and of safe community, because ultimately the reason that we're being so assertive here is that we recognize that there are lots of reasons that people dial 911, and not all of them mean that the person they're calling 911 needs to go to jail. And so there are so many components of the system that really need to be remedied. And I just want to say, one of the things that I'm concerned about is that the system is diluted with people who need to be in mental health facilities, and we do have people that are unsafe for the community that really need to be incarcerated. And I think by being able to be more, doing more prevention, looking at our alternatives and options, that we're going to be able to get people in the appropriate placement instead of now where we have so many people going to a place that they really shouldn't be going. So anyway, Supervisor Ellenberg, thank you for all the work that you did on this.
Thank you. And before we hear from any other supervisors, and I've got a comment as well, Jess, let's go to public comment. Looks like we have one speaker. We'll give them 2 minutes.
Thank you. We have additional speakers for now.
Already.
Take with 2 minutes. Our first speaker will be Pancho Guevara. I've unmuted you. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, supervisors. My name is Poncho Guevara. I'm the Executive Director of Sacred Heart Community Service and co-convener of the Race Equity Action Leadership Coalition. I just wanted to express my sincere gratitude for this referral from Supervisors Ellenberg and Chavez to really talk about one of the most fundamental and vexing challenges of our days is the overinvestment in our carceral state and these solutions, and looking for things that could actually look for redirecting and providing proper resources to keep our community safer, especially through the focus on finding more effective, efficient, and equitable ways that we could actually deliver resources to those that need a different form of service. So particularly looking at community-based solutions, not incarcerating people to create more challenges in their lives of re-traumatizing our communities, and to the point that these are folks that have not yet been convicted, but also be really thinking about how community partners like organizations in the community are really best equipped to be able to make sure that people are heard and the resources are delivered to them. And we can ultimately not just save money, but really find better ways of making sure that we're getting at the root causes of these issues. So we're excited about this referral and other things we'll be talking about later, and a part of a larger equity agenda about how we think about some resources, both how we're doing things right now, but how can we use creative resources in the future. Thank you.
Thank you, Pancho.
Our next speaker is Tina Brown. I've unmuted you. You'll have 2 minutes to speak. Please go ahead.
Hi, this is Tina Brown again. I'm calling to show my support for item number 18. This referral only validates again the call that the community and myself have been very vocal about with regards to the fact that we do not need a new jail. COVID has shown that there are indeed alternatives that can be used, and when used, they have significantly decreased the population and saved many of our community members from being sick during the pandemic. This only solidifies that being caged up in our county jails does not have to happen, that there are alternatives that can be used and be provided before incarceration occurs, even when there is not a pandemic. Thank you for your time.
Thank you.
Our next speaker is Melissa. I've unmuted you. You'll have 2 minutes. Please go ahead.
Hi, my name is Melissa. I am an impacted family member. I am with DBUG in support of the Care First Jail Last Coalition. We support number 18 to decrease the jail population and increase alternatives to incarceration. Thank you.
Thank you.
Our next speaker is Janet Pocus. I've unmuted you. Please go ahead.
Hello, my name is Janet Pocus. I'm a county employee working at the district attorney's office. I worked for 4 months as a disaster service worker down in Gilroy. I would like our Board of Supervisors to rethink the vaccine mandate. Supervisor Simidian, if you're on the call, you had great memories of Jerry Doyle this morning. You spoke of how he thought of the individual and helped the individual become the best they could be with as many opportunities as possible. I'm not sure how our county can do that since we are mandating that each and every individual must take a vaccine no matter what they think or want or what their current health allows them to do. Supervisor Chavez, you said that our county is very proud of our religious diversity. How can you present a proclamation to a religious group when our county is mandating every single person to get injected with something that does not prevent the recipient from getting the virus and is against many religious beliefs? It seems that you might be speaking out of both sides of your mouth. Supervisor Lee, you declared a proclamation to the Assyrian Americans. You spoke of how they were exiled from their land and there was a genocide to try to cleanse their race from this world. How is that different from exiling vaccine hesitant county employees if they don't choose to allow their bodies to be injected with a concoction that does not align with their beliefs? These vaccine hesitant people will be denied the right to attend college, be employed in the county, support their families, travel, eat in restaurants, all in the name of the health of the community. However, this vaccine does not prevent the COVID virus. You, the Board of Supervisors, are denying your constituents the right to choose what goes into their bodies. Please rethink this mandate. Thank you.
Our next speaker is Kuyen Bong. I've unmuted you. Apologies, they've dropped off the call. Our next speaker is Jose Valle. You'll have 2 minutes, please go ahead.
Hi, this is Jose from Silicon Valley Debug, Care First Jail Last Coalition. I'm in support of item number 18 to decrease the jail population and increase alternatives to incarceration, and that there should be a complete stop to the construction of a new jail. Thank you.
Thank you.
Our next speaker is Catherine Hedges. Catherine, I've unmuted you. You'll have 2 minutes to speak. Please go ahead.
Hi, my name is Catherine Hedges. I'm not speaking for any other group right now. I'm disabled. I need county services. I have many friends who have disabilities. They make them immune suppressed, and I work with some of them, and I would need to quarantine after receiving services at county facilities if I have to assume that I'm dealing with people who are unvaccinated and carrying COVID. It is absolutely ridiculous for people, people act like there are all these major religions that, don't allow vaccination. There's only a few small ones, and it's not, they act like it's a major tenet of their beliefs, and I'm sorry, I'm not being very coherent about this, but all the major religions are encouraging people to get vaccinated to limit the spread of the pandemic. It's not perfect, but it's the best thing we have. Thank you.
Thank you.
Our next speaker is Charisse Domingo. You'll have 2 minutes. Please go ahead.
My name is Charisse Domingo with Silicon Valley Debug and the Care First Jail Last Coalition, and we support this referral as well. And what I just want to point out is that this is exactly why the community process around the jail and alternatives to incarceration is so important, because we've seen people turn out to the Zoom and in-person sessions, including the last one last Friday that was pretty poorly organized by the county, but yet people still turned out with their families, folks who were formerly incarcerated, families who have loved ones in the jails, behavioral health service providers, all with a lot of ideas that people have been talking about for years around alternatives to incarceration. So we just want to emphasize that that process should be in tune with this referral as well. Thank you.
Thank you.
Our next speaker is HG. I've unmuted you. You'll have 2 minutes. Please go ahead.
Yeah, your public health officer, Sarah Cody, recently mandated masks for 2-year-olds. I contacted my pediatrician with this exceptionally ignorant mandate came out, and their office was speechless. They did not recommend this treatment for 2-year-olds, and in fact, they believe that it would be dangerous to her. Your public health officer is putting toddlers in a position where they are in daycare and will be required to cover their noses and mouths with cloth material while they take their naps. Do any of you have any idea, just based on common sense, how incredibly ridiculous and medically contraindicated this medical advice is? Do any of you have toddlers at home? Do any of you want to make sure that they keep breathing? Are any of you aware that the risks of this madness far and away exceed any claimed benefit? Have even one of you checked this out with a few pediatricians in order to find out how crazy Sarah Cody's ideas are? I want you to know that if anything happens to my children because you want to deny them fresh air, I will hold you accountable in a court of law. Thank you.
Thank you. And Jess, before we go on to any others, I think there's a bit of confusion here. There seem to be people talking about COVID and masks and public health. That's our item number 9 that's coming up in a few. This is item 18. This is the item brought forth by Supervisors Ellenberg and Staben, that's my chief, and Chavez, regarding alternatives to incarceration. So anyone wishing to speak about COVID, please wait your turn. You'll be on in a couple of items. Anybody else still wishing to speak about item 18, please do so. Go ahead, Jess.
Our next speaker is Victor Vasquez. I've unmuted you. You'll have 2 minutes. Please go ahead.
Good afternoon. My name is Victor Vasquez, and I work at Somos Mayfair. I'm in support of item 18 because I know that many of our parents in our school district have fought to make sure that punitive measures are not used as the solution to address our society ills. From our school-based organizers, we have advocated to end the school to prison pipeline and to advocate for more resources for our communities. Ultimately, this leads us to also think about the role of punitive measures and the carceral problem that we face today. We know that racism and economic injustice works together to create the violent conditions, poverty, and also the fake solutions that criminalize people of color and leads us to incarceration. This history, these prisons are connected to the legacy of slavery, anti-Mexican and indigenous persecution, and criminalizes poor people for trying to survive. Our students in our schools and our families deserve to have solutions and resources. We must build the systems that create these solutions, that create opportunities for jobs, that create opportunities for home ownership, that create opportunities for their own development, and decrease any kind of system that is creating punishment and incarceration and destroys the lives of thousands of families. Ultimately, as we look at solutions that try to create thriving communities, we know that incarceration and criminalization are not the solutions that we need. In fact, they're against the lives of our communities and do not lead us to the kind of county that we want to have, a county that promotes families and children and their well-being, a county that knows that these are solutions that must be instituted so that justice can prevail. Thank you.
Our next speaker is Elisa Koth-Ginsburg. Please go ahead.
Good afternoon. I'm Elisa Koth-Ginsburg with the Behavioral Health Contractors Association. Thank you, Supervisors Ellenberg and Chavez, for this referral. BHCA members support this important effort to ensure that those who can receive behavioral health services outside of jail have options and are steered that way, as well as maximizing opportunities for those with behavioral health and other rehab experience to have the ability to shape what services are offered for those who are incarcerated. Behavioral Health Contractors Association members look forward to providing resources and supporting these efforts. Thank you.
Thank you.
Our next speaker is Ruben. I've unmuted you. Please go ahead.
Yes, I just want to thank you because you guys have given us a great lesson in civics. I have to refer back to item 19 regarding the no declaration of confidence on the sheriff. First of all, you cannot arbitrarily just add things to the agenda without giving the public time to review. I mean, you violated you violated the Brown Act, you violated the constitutional rights of the sheriff. I'm just sitting here watching and I'm just appalled how you guys operate. I mean, I may not be an attorney like Mr. Lee is, but you know what? I do know a little bit about the Constitution. And just on a brief review here, I can tell you a few violations you did. You know, for Miss Smith, you violated her Sixth Amendment. You know, you accuse her of things and she doesn't get any representation, okay? In addition to that, you violated the Ninth Amendment, okay? You're violating the public's right, okay? You know, these are written in the Constitution that you're supposed to uphold, okay? Then you also, you know, with this vaccine mandate, you're violating the First Amendment. You know, you're subscribing to a religion of the pharmaceutical industry, pumping junk into everyone. And, you know, and just to finish, okay, for those who have no religious beliefs out there, let me tell you something about what your creator said, okay? According to the Bible, it says, do you not know that you are the temple of God and that the Spirit of God dwells in you? If anyone defiles the temple of God, God will destroy him. For the temple of God is holy. Which temple are you? So if you try to destroy people's temple, you're going to suffer the wrath of God. And that's all I have to say. Thank you.
Our next speaker is Nick Kawada. I've unmuted you. Please go ahead.
Thank you, everybody, and thank you to the Board of Supervisors. SVCN just wanted to express its support for this item as it aligns with our equity investment agenda for recovery. Thank you very much.
Thank you.
Our next speaker is Rebecca Amendaris. I've unmuted you. Please go ahead.
Good afternoon, honorable board members. Rebecca Armendariz, I'm calling from Gilroy, and I support item 18. I believe we need greater investment in the health and wellness of those of our community who are most wounded and most needy. They're greatly underserved and most often the victims of further criminalization and punishment, a system that we have learned is far from the best practice and instead should focus on their health. Thank you.
Thank you.
Our next speaker is Raj Jayadev. I've unmuted you. Please go ahead.
Hey, Raj.
Raj from Debug and the Care First Your Last Coalition. I was calling to support this referral for the depopulation of the jails. And I did want to acknowledge that even though these items, by the nature of these meetings, are siloed, item 19, item 18, the conversation around what to do instead of a jail, they're really continuing of the same conversation of our historical opportunity to move boldly towards a decarceral plan for Santa Clara County that could lead a model for the rest of the country of how to address systemic racism, mental health needs, substance abuse, houselessness, which runs rampant in this community, and say that jail isn't the repository for all those social ills and that we could create alternatives. This is the moment right now. These are not independent conversations. We certainly want accountability for the sheriff, and the removal of the sheriff is a necessary step, but is really step one. Step two is also having a systemic response that says we will not return back to the entrenched system of incarceration. We actually have the models here in Santa Clara County. We've been doing it at Debug. We actually have a pretrial release model that is being replicated nationally that I think we could expand here. And I will acknowledge that despite the new attention towards systemic racism locally and nationally, we've actually seen racial disproportionality of Black and Brown people in our county facilities increase in the last 3 years. So this is not only about ending the harm of systemic trauma and racism, but it's also about creating an opportunity where we're challenging the injustice of the system and creating opportunity for people in Santa Clara County. And I will say that this opportunity can't stop with the removal of the sheriff. It can't stop with one referral. It has to start with the preventing of the construction of a new jail and creating new opportunities for new pathways forward.
Our next speaker is Lauren Renaud. I've unmuted you. Please go ahead.
Hi, my name is Lauren Renaud with Surge and the Care First Coalition. I just want to say I support this item, and I'm excited that the county wants to explore alternatives to incarceration, and alternatives being plural. We might not have all the answers just yet, and there were really great ideas that came out of some of the community input sessions. Particularly, we had a conversation in my group about valuing lived experiences and employing people with lived experiences to be part of whatever we build next, and not just relying on the same credentialing of folks with graduate degrees and things like that. But carrying this conversation, this is such an opportunity to really explore what alternatives might be, and that there may be more than one, and we can figure out what that is as a county, as long as we kind of keep all those doors open and don't just keep seeing jails as the answer to every problem. Thank you.
Thank you.
That concludes our requests.
Thank you, Jess. Appreciate that. I've got a couple of comments for the motion makers, Ellenberg and Chavez. Supervisors Lee are submitting. I don't see your hand. Supervisor Lee, your hand is up. Go right ahead.
Thank you, President Wasserman. First of all, I would like to thank my colleague, Supervisor Ellenberg, for authoring this really important and impactful referral, and for Supervisor Chavez to join in. As we have said so many times, that jail is not a mental health facility. It is absolutely inhumane and uncivilized for our mental health patients to have to receive services only when they get into an carceral setting. It's not appropriate for even our sheriff deputy and our correctional officers having to deal with mental health patients when that's not where the training is. So it is so crucial that we need to refocus our efforts and our resources to make sure that the mental health needs of many of those incarcerated is being met, and that those who have mental health needs shouldn't have to be arrested in order to get those services. And I certainly strongly support this referral, and I urge my colleagues to support as well. Thank you.
Well, thank you for that support. Supervisor Smitty, your hand is not up, so I'm going to address my couple of questions quickly to the two motion makers. Actions C and D, I'll be supporting. I see them as services and redesign, certainly critical. I think they're well stated. And I know you say, and other relevant county departments, and I would suggest that that includes obviously DA and probation as well, which I'm sure was your intent as well. On item A, I saw that the referral was directed to county council, as we so often do. And I thought, why wasn't that directed to the DA, the public defender, probation, the court systems, et cetera? So I would just suggest that while it's going to county council, I imagine he's going to come back and suggest where it goes for options for consideration. It just seemed to me in this instance that this particular referral going out to, like I said, DA, public defender, the court system, probation, et cetera, would be of great help. And item B is the only one I really had a question about. B as in Baker. And I saw a referral to administration report back on the operations, including staffing, supplies, et cetera, for the last 10 years. And what I wanted to ask, whichever supervisor is more appropriate, towards what end? And after we have a 10-year of going up or down or up, or whatever the analysis may show, up, down, up, down, up, down, 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 then what do we do with that? Do we compare that then to the 10-year budget of the county? Do we compare it to the 10-year budget of VMC? Do we compare it to the 10-year budget of other enforcement, law enforcement, public defender, district attorney budgets to see if they parallel? I just wanted to know, what was the purpose of B as in Baker?
The purpose, Supervisor Wasserman, is not necessarily to compare it to another department, but to have a sense overall of how much money we spend so that we can think if we are diverting funding or adjusting it in some way, we have a fairly consistent ballpark of what amount of money has been consumed and utilized through this single department, and how might we make that more broad. And I'm happy to say more or invite Supervisor Chavez in if that wasn't clear, but I also wanted to note that my understanding of our practice as a Board of Supervisors is to always direct referrals to administration and or county council and leave it to them. to determine where it goes from there, but we don't give direction or assignments directly to any other department, which is why it's going to county council, and I trust that they will engage all of the appropriate partners.
I'm sure that they will, and you just said administration or county council. I could see administration going. I just couldn't see what James would come back with, but he always surprises me, so I look forward to whatever he comes back with. If I could get further clarification on B, looking at something, the 10 years of something that's already happened for whatever reason, bust and boom and COVID or whatever it was. I was just trying to understand the purpose of that, but I don't want this meeting to go on longer. I would just leave that with you so that when the information comes back, or I guess I'm leaving this with administration, when you, through the motion makers, when you bring back B, if you show me a 10-year chart of the expenses in the sheriff's department and nothing else, I don't know what to do with that information, but I look forward to learning. So I too will be in support of the motion.
Thank you.
Thank you. If there's no other hands, I don't see any. Jess, will you please take the roll? We have motion by Ellenberg, second by Chavez. Oops, 1 minute. We have a hand raised by Supervisor Simidian.
Thank you, Mr. Chair. Forgive me if I was slow on the uptake there. There we go. I just want to ask that when this item comes back, we have answers to some questions that I think really are going to be essential to informing our thinking about what we can do and how we can do it. And I feel like there is I'll speak only for myself. I have had a sense of frustration about the circular nature of these conversations. I sense that there is some frustration not only among other board members, but out in the community. And so I really do want to ask County Council, and I'll share these in writing at some point later with County Council and the rest of the board. But, you know, is there a legal mechanism for abolishing our current jail? That's a kind of a threshold question. And then if so, how might such a thing be done? And if not, what is it as a matter of law that precludes us from doing that? And I think the answer to these questions will need to be not just in a confidential legal memorandum for our board, but in a document that can be shared with the public so that the public is fully informed about the opportunities and or constraints that we are working with as a county. Are there other jurisdictions in the country without something like a jail? And if so, you know, what distinguishes them and what functions do they perform or not perform? And what do they do for the kinds of services that might otherwise be performed by what we would conventionally refer to as a jail? Which leads me to the next question, which is there a definition of the word jail in state law? You know, and if so, what is the definition? Again, we talk about this colloquially, but I think in order to make sure there's a meaningful response to this referral, and I think it's important that there be a meaningful response to the referral, we kind of have to get down into some very basic questions like that. So I hope we'll have that information in a form that is, to the greatest degree possible, shareable with the broader public, because I think we can't have the kind of policy discussion we need to have until and unless we have some common understanding of what legally is and isn't permissible. Thank you, Mr. Chair, and thank you, colleagues.
Thank you. Jess, a vote, please.
Supervisor Lee?
Supervisor Lee.
Oh, yes, sorry.
Supervisor Chavez?
Yes.
Supervisor Simidian?
Aye.
Vice President Ellenberg?
Yes.
President Wasserman?
Yes. Thank you very much. That passes unanimously. We're now moving on to item number 8. Supervisor Simidian.
Thank you, Mr. Chairman. This one is, in my way of thinking, intriguing at this point because there's not an awful lot of clarity that I've been able to discern about where we're headed with what I think is a very positive development at the state level. As the referral indicates, we have heard from the state that there's been a significant commitment of funds to mental health infrastructure in concert with or in partnership with our public schools. If you were to just think about that in terms of Santa Clara County's pro rata share of such funding, ballpark 20 million seems like a likely number since we are 5% of the state's population, but not clear yet how these funds may be used. I gather they may not be used for direct treatment. And so what I've asked for is two things, a sort of a status report just orally today from our behavioral health folks, and then a more formal report in writing at our September 14th meeting. So I'm happy to move the recommended action, but I'm looking forward to a brief presentation from staff just to update us on what the possibilities and the potentialities are associated with this action at the state.
Thank you, Supervisor Chavez.
Thank you. I'm also looking forward to that. I think it's been there's a bundle of activity at the state level, so understanding what that expresses at a local level or how that's expressed at a local level would be helpful. You know, one thing when this comes back that I'd be really interested in a better understanding from staff is what money is available that doesn't require Medi-Cal eligibility. Because I think one of the challenges with the way mental health is structured is so payment driven that it can be very complex to apply resources at a local level. So I'd be very interested in understanding flexibility and funding. Thank you.
Thank you. And you seconded the motion, is that correct?
Yes.
Thank you very much. Supervisor Ellenberg, you had a comment, and we'll one member from the public, and then we'll take a vote.
Absolutely, thanks. And Supervisor Smitty, thanks so much. I appreciate your engagement on this issue and look forward to the September 14th update, helping us move along some discussions that are already underway at CFSC. Last week's report from the Behavioral Health Services Department was a good start for us on expanding mental and behavioral health services across all of our school districts, but a robust strategy for long-term support to the schools and students is still needed. We're coming up on 2 years since my referral to expand services to all of our districts was approved by our board. These state resources are really critically needed and can cement the partnerships with public and private stakeholders to dramatically improve access for all kids. So I am really glad to have your support in this work to help push for progress on increasing our investment and coordination to expand school-based behavioral health services.
Thank you, Supervisor Lee.
Yes, thank you, President Wasserman. First, I want to thank Supervisor Simidian for putting forth this much-needed behavioral health services for students from K to 12. While the administration is considering the idea for the written response for your guiding questions, would like to see if there's a question offer this type of idea regarding having schools hiring the clinicians and therapists directly. And they could serve the students on campus, in that case, without worrying about whether insurance status or not. The schools that have their own clinicians certainly don't have to worry about the insurance plans, eligibility criteria, reimbursement rules that others would have to under the Medi-Cal or private insurance. And students and parents also have sometimes a difficult time building trust with people who aren't at the school as school staff. And if the clinicians are actually part of a school staff on site, it makes it so much easier. And then the coordination and documenting services will also be easier with clinicians who are able to use the school's information system, such as the Infinite Campus or Power School. So just want to throw in as an idea to look at what administration can explore these options to also help fund schools to hire the clinicians to serve the students directly. Thank you.
Thank you. And before we go to our first speaker, again, this referral includes referral to administration to report to the board on August 31st, which is today. So for all the people contacting me, as soon as this item is over, we will have our normal COVID report. Dr. Smith or whoever is presenting, please.
Perry has a short PowerPoint for the board.
Thank you. Then we'll go to Jess and the two speakers. Sherry, go right ahead.
Great. Good afternoon, President Wasserman, members of the Board of Supervisors. I'm going to ask Moretta to share her screen and we'll just give a brief presentation.
Great. Go ahead, Moretta.
Thank you. Are you able to?
No.
No, not yet. Sorry. How about that?
There we go.
Okay, thank you. Thank you. You can go ahead and advance the slide. Okay. Okay, so we wanted to basically share an update. The Children Youth Behavioral Health Initiative Budget Act of 2021 authorizes $4.4 billion over a 5-year period to transform California's behavioral health system to ensure all children and youth aged 25 and younger, regardless of payer, are screened, supported, and served for emerging and existing behavioral health needs. So I'm going to briefly go over the different areas of funding that will be available across the Budget Act. Next slide, Moretta. The first area that will be funded is something referred to as Behavioral Health Virtual Platform. The purpose of this is the Department of Healthcare Services will select and oversee a vendor to establish and maintain a behavioral health services and supports virtual platform that integrates behavioral health screening, application-based supports, and direct behavioral health services to children and youth 25 years of age and younger, regardless of payer. And the appropriation for this particular area is $600 million and allocates an additional $10 million of general fund to support initial planning for implementation of a behavioral health services and support platform. Next slide. The next area of funding is something referred to as school-linked incentive program funds. The purpose of this body of funding is to build partnerships, capacity, and infrastructure supporting ongoing school-linked behavioral health services for children and youth 25 years of age and younger. It expands access to a variety of different practitioners to be able to deliver those services. It builds a statewide community-based organization provider network for behavioral health prevention and treatment services. It enhances coordination and partnerships with respect to behavioral health prevention and treatment services via appropriate data sharing systems. And for this particular area, $550 million will be issued over 2 years, with most funds allocated in fiscal year 23. $100 million will become available in fiscal year 22 to support school-linked partnership capacity and infrastructure grants to qualified entities. And of that amount, 70 million will be dedicated to grants focused on preschool through secondary educational institutions, with $30 million available for grants focused on individuals and institutions of higher education. And this particular area of funding will be administered through competitive grants. The next area is something referred to as Mental Health Student Services Act augmented funding. The MHSSA will fund grants to school and county behavioral health partnerships that support the mental health and emotional needs of children and youth as they return to school and everyday life. The MHSSA is established for the purpose of establishing mental health partnerships between a county's mental health or behavioral health departments and school districts, charter schools, and the County Office of Education. And this particular appropriation will be $205 million. And you can see the further breakdown of the source of that money being partially coronavirus fiscal recovery fund and $105 million of MHSA funding. And all counties will receive this funding via a non-competitive grant, meaning that all 58 counties will receive some source of funding out of this particular area. Next slide. The next area is Medi-Cal Managed Care Incentive Program. In this area, the Department of Healthcare Services will make incentive payments to qualifying Medi-Cal managed care plans that meet predefined goals and metrics associated with targeted interventions that increase access to prevention, early intervention, and behavioral health services by school-affiliated behavioral health providers for K-12 children in schools. And the appropriation in this particular area is $400 million, with $200 million in federal match for the incentive program. What's important to note here is the predefined goals and metrics will be developed by the Department of Healthcare Services, along with the State Department of Education, Medi-Cal managed care plans, county behavioral health departments, local education agencies, and other stakeholders. And the higher incentive payments may be made for activities that increase Medi-Cal reimbursable services to reduce health equity gaps, as well as services provided to youth living in transition, homeless, or involved in the child welfare system. Next slide, Moretta. The next area of funding that's available is Medi-Cal plan reimbursement for schools and school-based services. And so commencing on January 1st in 2024, each Medi-Cal managed care plan and Medi-Cal behavioral health delivery system, as applicable, will be able to reimburse providers of medically necessary outpatient mental health or substance use disorder treatment provided at school sites to a student 25 years of age or younger who is an enrollee of the plan or delivery system, but only to the extent the Medi-Cal managed care plan or Medi-Cal delivery system is financially responsible for those school sites under its approved managed care contract with the department. And it's important to note with respect to this Medi-Cal plan reimbursement, it will be implemented only to the extent that the Department of Healthcare Services obtains any necessary federal approvals and federal financial participation under the Medi-Cal program is available and not otherwise jeopardized. It's also important to note that this particular section does not relieve the local education agency or institution of higher education from the requirements to accommodate or provide educationally related mental health services to students as required by state and federal law. Next slide, Moretta.
Sherry, how many more slides?
There are just 4 more. I'll go really quick, Supervisor.
Thank you.
Sure. This next section is evidence-based practices and community-defined promising practices. This area of funding will be focused on helping to identify a selection of evidence-based practices and community-defined promising practices to improve outcomes for children and youth with or at high risk for behavioral health conditions. And you can see the appropriation there, $429 million. Next slide, Moretta. This next area is really critical to our systems. It's the behavioral health workforce capacity, including the development of behavioral health coaches and counselors. So this area will include investments for workforce education and training to foster broad behavioral health capacity in support of the initiative, including a multi-year plan to launch and implement a statewide school behavioral health counselor system. There's $426.8 million over 5 years. And again, it adds this new behavioral health coach position as a new category of behavioral health provider trained specifically to help address unmet mental health and substance use needs of children and youth. Next slide. This particular area will invest $310 million in enhancing and expanding mobile crisis support teams with a specific focus on youth ages 25 and younger. It's important to note that our county has already applied for these funds. There was funding allocated specifically through a non-competitive grant for each of the counties, as well as funding available for a competitive portion as well. And our county has already applied for these funds. Next slide. The last area of funding is related to Dyadic Services. This is a really important benefit. For many years as providers, we have served the child as the client, and the parent has received what we call collateral or ancillary support services. This new mode of service allows for the family and caregiver to be the focus of care, and it's referred to as Dyadic Services. There will be an appropriation of $200 million annually beginning in fiscal year 23 to add Dyadic Services as a Medi-Cal benefit beginning in fiscal year 23. And that concludes my summary of the availability of statewide funding for student mental health services.
Thank you very much. We're now going to turn to our three public speakers. And let's go 2 minutes each. If the speakers need that much time, you're entitled to it.
Our first speaker is Nick Kawada. I've unmuted you. You'll have 2 minutes to speak. Please go ahead.
Thank you, President Wasserman and Board of Supervisors, Behavioral Health Services staff. I'm Nick Kawada, Policy Director for SVCN. We would like to applaud the work on this item as it's our goal to improve the lives and health of low-income students, BIPOC students, and LGBTQ students, as outlined in the item. These are the very people our equity, investment, gender recovery proposals are trying to reach. Thank you very much for your work and look forward to the forward conversation.
Thank you, Nick.
Our next speaker is Elisa Koff-Ginsburg. Please go ahead.
Good afternoon, Elisa Koff-Ginsburg with the Behavioral Health Contractors Association. Thank you, Supervisors Committee, for making this referral. It will be great to learn more about the exciting opportunities from the state. Thank you also to Supervisors Ellenberg and Chavez for your leadership regarding school-based behavioral health needs and services. BHCA is working with the Santa Clara County Office of Education and the Healthier Kids Foundation to bring together providers and schools to focus on needs and the resources existing in our community that can be used. Thank you.
Our next speaker is Sharon Luna. I've unmuted you. Please go ahead.
Good afternoon, President Wasserman and members of the Board of Supervisors. I read with great detail on this information, and I only wish that there was more in-depth information in regard to drug prevention. I'm going to share with you as a mother what I have been through with my child for the last 15 years. My child we were our middle-class family, and he got involved in drugs, and he was in the school system. We couldn't get any help. We struggled financially to try and get him the assistance that he needed. He was in and out of the jail system, couldn't afford the fines, so it was just in and out, in and out. I'm proud to say that he has eventually got himself off the drugs and is doing very well. But I'm saying this because we were a middle-class family. We are a minority family, but we could not get any services for our child. And I'm saying this because it is a personal matter. And I'm thinking that drugs has been running rampant within our country, not just within Santa Clara County. And I think that what we need to do is take a look at what the real problem is within this area of behavioral health. It's looking at what the problem is. And like I said, drugs are running rampant. My son was 15 years old when he started, and he graduated up to methamphetamines, which meant that he had to steal. And like I said, was going into the prison system. I would like you to recognize what the real problem is, drugs.
Next speaker is Christy Connors. Christy, I've unmuted you. Please go ahead.
Yeah, hi, thanks. I just want to remind everyone that I didn't hear a lot of information in relation to how we're going to dialogue with parents. Ultimately, parents should be in charge of their child's education and in charge of their child's mental health and really directing the healthcare of their child. We need to be in dialogue with mom and dad or with their whoever is legally in charge of the child. And the school can't be providing services without getting permission from the parents to administer any type of healthcare. It's not appropriate for the school or the state or the county to step in and act as the role of mom and dad. So let's please open up dialogue with parents, and especially parents who want help. Until a child is 18, they're not legally allowed to make their own decisions. We need to keep that in mind and make sure parents are included in the dialogue, and make sure parents are signing off and allowing their child to be spoken with by a mental health counselor before this is done. Thank you. I yield the rest of my time.
Thank you.
Our next speaker is Mary Gloner. I've unmuted you. Please go ahead.
Good afternoon. Thank you, President Wasserman, for the opportunity to speak. My name is Mary Gloner. My pronouns are she and her. I am the CEO of Project Safety Net. It's a community coalition based in North County dedicated to youth well-being and suicide prevention. I want to also point I reside in Vice President Ellenberg's district. I want to thank Supervisor Simitian, as well as the full Board of Supervisors, for continuing to be a champion, an ally, and using your platform to elevate the importance of youth well-being and suicide prevention. Today is the eve of Suicide Prevention Awareness Month, so it's very timely, and thank you for doing that, and look forward to September 14th to hear more about it and to continue to serve as a partner for this important work. Thank you.
Our next speaker is Victor Vasquez. I'm unmuted you. Please go ahead.
Good afternoon, Victor Vasquez at Somos Mayfair as well. Thank you so much for this presentation, also for being a champion in terms of providing health services for our community. We know that COVID has hit East San Jose really hard. And yesterday when I was looking at some of the testing sites, I see the need for us to think about in an innovative way. Is there opportunities to establish some kind of satellite clinics throughout our school districts, right? Growing up in Oakland, California, that was a service that we had where people, families could have access to medical services, mental health at their school sites. School sites became a place where people could also feel the trust, but also walk to those services as well. So in this process, I urge you also to, yes, do think about parent involvement, but also the young people who might benefit, some of the teenagers that might have a need to have access to these resources. Speaking to our youth group at Somos Mayfair and to the parents, they both identify as mental health resources and the mental health crisis as one of the #1 priorities that they're looking at. So I do ask you to think about how do we engage community in this process? And again, thank you for your leadership.
Yes.
That concludes our requests.
Okay. Thank you very much. And this is item number 8, which was Supervisor Simitian. I see Supervisor Chavez's hand is raised.
Just real quickly, I was hoping the staff could resend the slides to the board would be great. Thank you.
Thank you. And Supervisor Simitian, I learned something from you every couple of months, and today was one of those. I see that we have a referral possible action A, which is to receive a report, and I think we just did that. I don't believe we need to vote on A. Is that correct, Supervisor? You're muted, perhaps.
Thank you. No, I'm just pausing because we struggled in working with the clerk's office to identify the appropriate way to get a brief oral report today and then a more fulsome written report at a subsequent meeting, and the protocols for proceeding in that way are established by the clerk's office. So we followed the direction of the clerk's office. Thank you again to them for helping us. What I will say is I do have follow-up questions about the piece of the program that prompted this referral, but I'll do that offline, Mr. Chair. But I would like to have the item come back pursuant to B, for the written report on the subject matter that we actually did not get to talk about today. So thank you for that.
Thank you. So under what you just explained, per clerk's guidelines, do we need to, is the motion then to approve A and
I'm gonna let the motion stand to do both, and then we can congratulate ourselves that we did A already.
I like it. Okay, so motion by Simitian, I believe it was Supervisor Chavez that seconded. Is that correct?
Yes.
Wonderful. Roll call, please vote. Yes.
Supervisor Lee?
Aye.
Supervisor Chavez?
Yes.
Supervisor Simitian?
Aye.
Vice President Ellenberg?
Yes.
President Wasserman?
Yes. Thank you. We're now moving on to item number 9. And board members, we've got 9. 10 is also COVID related, but during consent, the motion was to include 27 and 28 with 10. I don't remember who made that motion, but is that still the will of the board?
I asked for 28 with 10. I don't know if someone else asked for 27.
I did, Cindy.
Okay.
Okay, so we'll hear 27 and 28 with 10, and 10 is a quarterly update from the county exec relating to COVID. But we're going to do item 9 now with public health. Just seemed to me like 9 and 10 were very related. So Dr. Smith, Dr. Cody, start us off.
Good afternoon, President Wasserman and members of the board. This is Dr. Sarah Cody, and I'm joined by Dr. Kamal. The two of us will provide a brief update on the local situation with the COVID pandemic. The first slide shows you, as always, the epidemic curve, and I would say that in the fourth wave, it looks like cases may be flattening. We are starting to get resolution of the Kaiser data issue. We're not fully there yet, but we hope to see that cases indeed are flattening. The next slide is an important slide, and it zooms in on the epidemic over June, July, and August and breaks the case rates out by vaccination status. So this is the 7-day average case rate by vaccination status. First, I want to draw your attention to that green line in the middle, which is the overall case rate in our whole population. And then look at that top blue line. That is the case rate among people 12 years and older who are eligible to be vaccinated, but have not yet been vaccinated. And you can see there that the COVID case rate is quite a bit higher among this group. And in fact, it's driving the overall case rate up. The orange line is the case rate among kids 11 and below, who are, of course, not yet eligible to be vaccinated. And finally, that purple line at the very bottom is the case rate among those who are eligible to be vaccinated and who have been fully vaccinated. And it's risen a little bit, but not nearly the way the case rate has risen among those who are eligible but not vaccinated. In the next slide, this is the COVID deaths by week. And remember, the current surge we're in started in late June, so we would have expected to see the deaths beginning to uptick by mid-July, but we've not seen that. And I think that this can be attributed to the protective effect of, I'm not sure what that was, the protective effect of the vaccination in the population at large. So we'll keep monitoring this, of course, but so far our deaths really have been blunted, I think, from the very high vaccination rates. The next slide shows you, I think, what you know, which is that the surge right now is Delta, Delta, Delta. This shows our data, our local data on variants. And the Delta variant there is shown in orange. And you can see the data are not that up to date because there's a lag in identifying the variants. But the trend is that Delta is dominant. It outcompetes all the other variants at the moment. The next slide gives you the bottom line on our vaccination. We're now up to 81.5% of our residents 12 and older having completed vaccination, which is extraordinary. So we continue to march up inch by inch in getting our population as protected as possible from COVID. You can see on the next slide the trends in vaccination. And I just want you to see that blue line, which is the first dose of vaccine or initiating vaccination. And of course, it peaked in mid-April. Then we had another little bump when the 12 to 15-year-olds became eligible. And then since early July, that blue line is mostly flat and maybe very slightly trending down in the last couple of weeks. So who's vaccinating? The next slide shows you that for the most part, it was the county health system, those blue lines for the first 6 months of the year and of the vaccination campaign. But now, over the last couple of months, a number, sort of cumulatively, the retail pharmacies have been vaccinating the majority of people getting vaccinated over the last few months. I'm now just going to turn things over to Dr. Kamal for an update on testing and the situation with our hospitals.
Good afternoon, Board of Supervisors. Thank you. So over here, we see our testing remains robust with an increase of about 6,000 tests per day since the end of July. We continue to see an increased demand for testing. We also have a positivity rate that's holding quite steady at around 3%. Next slide. This slide shows the average turnaround time, which we're keeping a very close eye on given the risk of increased turnaround times when the volume increases. However, we are currently still at 1.3 days average turnaround, which is in line with our target. Next slide. We continue to have adequate capacity for testing within the county's health system with hundreds of unused appointments every day. We are open 7 days per week with appointments up to 8 p.m. on some days to accommodate working individuals. We are also planning to re-expand our city sites to include North County communities as well. The key factor in all of this is, of course, staffing, and I'm going to sound a bit like a broken record because that is a key factor in many of our challenges right now. We are onboarding additional staff and cross-training them to allow deployment between vaccination and testing based on need. Next slide.
Please, if you can go back just one slide. Thank you. You said up to 8 p.m. on Sundays, and it says Tuesdays and Wednesdays on the slide. Is it Sundays or is it 3 days or
I meant some days, S-O-M-E. Sorry, Tuesdays and Wednesdays. Sorry.
Got it. Thank you very much.
In terms of hospitalizations, we are seeing a tightening in ICU capacity and keeping a close eye on that. And once again, the key limitation is not physical beds or ventilators, it's actually staffing of these ICU beds. In line with increasing COVID cases, we are also seeing non-COVID admissions somewhat higher than usual for this time of year. Fortunately, our number of pediatric hospitalizations throughout the county remains quite low, around 5, and the hospitalizations of breakthrough cases remain relatively rare. Once again, as Dr. Cody said, predominantly a pandemic of the unvaccinated. Next slide. This slide shows the number of COVID positive hospitalizations. As you can see, we have had a stark increase since earlier in the summer, still not anywhere near our December peak, however. Next slide, please. In terms of COVID positive hospitalizations, we are also seeing an increase, once again exceeding the previous peak, except for the December peak, which was much higher. Next slide. Available beds are also something we're keeping a very close eye on. As you can see, we have seen a bit of a decline, not nearly as bad as last winter. However, the volatility in this is quite high, once again having to do with staffing, that hospitals feel that given staffing challenges on particular shifts, there may be issues with ICU beds coming up intermittently. Next slide. And finally, in terms of non-COVID hospitalizations, we're keeping a very close eye on that as well, given winter is coming and generally hospitals do get busier anyway this time of year. We want to make sure that overall capacity remains quite acceptable. And finally, Supervisor Chavez had asked for a bit of an update on treatment. And I will say that we do have a Regeneron treatment available at several sites throughout the county. And our CICT team is actively working on connecting appropriate patients for those treatments when they are appropriate. And with that, I will end and turn it back to Dr. Cody or the supervisor for questions.
Thank you, Doctor.
We're happy to entertain any questions that you might have.
Thank you. If you'll just stay on hold, we'll hear from 4 members of the public, and then we'll turn to supervisors, and then we'll move on. Jess.
2 minutes?
Yes.
Thank you. Our first speaker will be Alex. I've unmuted you. You'll have 2 minutes to speak. The timer will start when you begin speaking.
I would like to thank again the board for hearing all the diverse voices of the community. I would like to underscore something that was stated earlier as it regards to COVID and teleworking from our behavioral health, both SEIU and SEMA, and how there's a lopsided implementation of the policy. Of known departments, behavioral health and probation are particularly hit. This does not mean that it is isolated only to them. Overall, as an employee who is fully vaccinated, I've been perplexed by the rush to have the majority of employees back in the offices, given the CDC has reinstituted the mask mandate regardless of vaccination status, indicating that those who are vaccinated can both acquire and transmit the COVID Delta variant. And they've also stated that this variant of Delta, which we just heard about, is magnitudes greater in its transmissibility. If safety is the goal, there should be a county as an employer facilitating tests for the vaccinated employees who have symptomology, which is currently not doing. Transparency needs to be, there needs to be transparency in communicating the reporting of positive cases of employees, and there needs to be a proportionally represented set of data and test results for vaccinated and unvaccinated. This means, what I mean by that is, are we testing vaccinated people? And what is that proportion to the positive and negative cases of COVID? Because Donald Trump did say, stop testing and the numbers will go down, right? We don't want to do that. We want to know. Thank you so much for your time.
Our next speaker is frustrated. I've unmuted you. Please accept the unmute. You'll have 2 minutes to speak.
I am tired with the narrative that the vaccine is the best thing we have. There is so much we are not talking about, and that is dangerous negligence. We are being bombarded with the same misleading, inaccurate, and biased data over and over. Absolute risk is the gold standard for vaccines. However, that is not the standard we are getting with this COVID vaccine. We are dealing with relative risk reduction, and there's a very big difference. Truths that are deemed inconvenient to the vaccination rollout are silenced and brushed over. This is not informed consent, and we must always have the right to question. Purposely misleading data to instill fear and mass compliance is shameful, and coming from people in your positions, I believe, is criminal. Resign or be recalled. Recall santaclara.com. We're taking matters into our own hands. Don't underestimate this movement. I do thank you, however, for empowering the people. Thank you.
Our next speaker is Christy Connors. Christy, I've unmuted you. Please go ahead.
Yes, hi. Thank you so much for hearing my thoughts. I really want to know what is the end game of vaccination. We're at 85% has received their first vaccine. 80% of the county is vaccinated. Yet we still have a county mask mandate in place. At what point are you guys going to get rid of the restrictions, or are we just living like this forever? I mean, really, we have the highest vaccination rates in the county. And if that's your end goal, we are there. And according to the CDC, we are at herd immunity, yet we still have some of the strictest restrictions in place in the entire nation. You guys, it doesn't make sense. Either the vaccine works or it doesn't. And that's what's really frustrating, I think, to a lot of people. And that's another reason why you guys are getting recalled. Yes, recall SantaClaraCounty.org. It's on the move. Also, if you look at data that was just presented, I know you guys like to say it's a pandemic of the unvaccinated, but one of the biggest issues with hospital capacity is staffing. And you guys are about to let go of a whole bunch of staff for all hospitals, county hospitals, because of the COVID vaccine mandate. Some of the most vaccine hesitant people work in healthcare. The number one most vaccine hesitant population is people who have their PhD and work in science. This has been documented over and over again. These people who are in science and in medicine, they don't want to take the vaccine. Why are you forcing them to choose between the vaccine and their jobs when we already have a shortage of healthcare workers, which was just talked about by Dr. Smith? Let people do what they want to do here. Don't force things on them. The more you force, the more people will resist. That's the bottom line. Thank you.
Our next speaker is Tino. I've unmuted you. Please go ahead.
July 2020, over a year ago, Fauci said in an online interview that too many cycle thresholds applied to PCR tests was becoming the standard. A month later, the CDC recommended we only test people with symptoms. Major backlash took place. Coincidentally, that's the only time I remember Dr. Cody objecting to CDC recommendations. Stop testing healthy people. I do not trust her execution or the statistics shared with the public, and that's only been amplified after she spoke about testing a few days ago. Anybody following PCR testing issues know too many cycles and false positives have been a massive issue throughout. Sanger sequencing is the gold standard, not PCR tests. The CDC, Fauci, and Dr. Cody have all confirmed huge problems with the testing methods and strategies over the last 2 months. Could that December peak also include the flu, considering most tests can't differentiate between the viruses and flus? Santa Clara County over and misreported 22% of the COVID-19 deaths. Has the board asked for a full audit yet? Alameda County used a car accident as an example of their errors. Sacramento Bee reported that comorbidities on death certificates on the Cal-Reedy system has been a nightmare. These issues have led to the ongoing abuse of emergency powers. Upfront reporting on the types of tests used and the methods is needed. We also need full audits on death certificates and tests. The shots are losing effectiveness. They don't stop transmission. Natural immunity is proving to have better protection against variants, and we don't have safety data on boosters. We're still telling people, get injected or use flawed testing. Pause the injections and testing immediately to reassess everything. By the way, Cal OSHA and the PDEH said on June 9th, masks don't work against aerosol transmission, which is the primary method. Improper mask usage happening everywhere can cause cross-contamination and even transmit the virus more. End the mask mandates immediately. Expecting kids to wear masks like medical professionals has been an unscientific joke.
Our next speaker is Joseph Nedemeyer. I've unmuted you. Please go ahead.
Hi, thank you for letting me speak. I was just curious as to some of the information that you're getting when it's showing the Delta variant as being the most prevalent in the tests being shown. How are they differentiating, and where can we find that type of information? I'm kind of interested in just being able to look at the data myself. I do respect the doctor for saying that much of the issues that the ICU beds are having is due to staffing. With the mandates going into effect that you require vaccination and nurses and other medical.
We lost him.
Joseph, we've lost your audio.
Let's go to the next person. Maybe we'll get Joseph back.
Okay. Our next speaker is Janet Pocus. I've unmuted you. You'll have 2 minutes to speak. Please go ahead.
Hello. Thank you for taking my call. Hold on 1 second. I apologize. This is new for me while I'm here at work. I'm hoping that you can hear me. Can you hear me?
Yes, we can.
Okay. So in slide number 3, Dr. Cody says that the high case rate driven by the non-vaccinated is high. Does that unvaccinated include those who have received 1 of 2 vaccines? Does it also include those that are not 14 days beyond their last vaccination? Slide number 4 says deaths have not increased substantially during the current surge. Then why are you mandating the rest of Santa Clara County to be vaccinated? Slide number 5 says the Delta has spread. Is the current vaccination not working on the variant? If not, why are you mandating it? Testing. When did you mandate testing for unvaccinated employees? I'd like you to look at the date and see if the testing times or the testing amount has gone up. If all unvaccinated county employees are mandated to test 1 or 2 times a week, wouldn't you expect there to be a higher amount of unvaccinated positive cases? Slide number 11. The 7-day average positive rate is 3.0. That means that out of all the tests to which most are unvaccinated, we can assume that 97% are negative. Why are you mandating the vaccine then? Slide number 14. It looks like there are or can be some breakthrough cases, even in vaccinated people. Why then are you mandating the vaccine? I'd like you to really think about all these issues and all these points that Dr. Cody has made and look and see, do you need to mandate something to lose county employees when they have to choose between what they honestly believe about their own?
Our next speaker is Kian Vong. I've unmuted you. Please go ahead.
Hi, my name is Quinn Vong, Executive Director of ICANN. We work with Vietnamese children and families, and I would like to thank the board of supervisors for your leadership and Dr. Cody and the team for steering our county through this tough time. We are the gateway to Asia, and for us to have this, of course, you know, one extra death or one extra patient infected with COVID is not wanted. However, given that our situation compared to New York, I am so grateful. And mask is extremely important because we saw that during the December, November period. The Vietnamese people let our guards down and we got hit really hard. And the toughest challenge that we are facing is that it is not a static target, it is a moving target. The virus continues to transform, to mutate. And because of that, things that we thought would be good may no longer be good. So chasing after that moving target is an extremely difficult situation and task to do. So I really, really appreciate the guidelines, careful, cautious guidelines that the county and Dr. Cody has given out, and I will try my best to get my community member to follow. Thank you.
Thank you.
Looks like we have Joseph back. Would you like to
Give Joseph another minute?
1 minute? Joseph, I've unmuted you.
Thank you very much. Yeah, I was just want to follow up on obviously finding out how you differentiate between the different variants and that information. I was also curious with the vaccination status being required by county workers and our medical staff. If we're going to be firing and laying people off for not getting vaccinated, would you be changing up your positions on how you calculate ICU usage instead of being able to use nursing staffing? Because if you're already having a staffing issue and then you fire more people, then you're going to have an increase. And so then you're going to use that as a claim to say, look, we don't have the beds, we don't have the numbers, and we're overrepresented. So I feel like people need to kind of take that into consideration. Those are called Cobra bites in economic terms. And so these are unintended consequences that you're maybe not seeing. So I just appreciate you guys kind of looking at that and realizing that if this is a pandemic, why are we firing very privileged and experienced staff? Thank you.
We have 2 more requests to speak. Shall we go back to 2 minutes?
No, yeah, let's go back to 2 minutes. And after this item is over, just a heads up to everyone, we're going to do 1 minute each for public speaking. Go right ahead.
Our next speaker is Ruben. You'll have 2 minutes to speak. Please go ahead.
Hi, I just want to ask a few questions. You talk and provide data on the percentage of people vaccinated and the number of COVID positive cases. What we also want to know in the public is data of hospitalizations due to the side effect of vaccines. There's a lot of people getting side effects and we're not getting good information on that. Please provide that information. Number 2, if 85% of the people are vaccinated, when do you reach herd immunity? Do we need 100% vaccination? I don't think so. Look at the science on that. Number 3, when would you dispense information on how to treat people with COVID-19? Vaccines are not the only solution. Why don't you look into Dr. Peter McCulloch, MD? He has a guide on how to treat people with COVID. Let's help them get healthy while they're still alive and not kill them with a vaccine. Number 4, mandating PCR tests is unable to differentiate between COVID-19 or the Delta. Why do you encourage its use? Look it up. It's on the FDA website. They reported back in last year. You can just look it up. I'll name you the report right now. It's called CDC 2019 Novel Coronavirus real-time RT PCR diagnostic panel. It explains to you that, these tests are really not functional. So in conclusion, you all need to really stop creating the crisis, okay? Why don't you let people get back to work? Why don't you let people get back to normalcy? Stop creating crises. Thank you.
Our next speaker is Melissa. Please go ahead.
This will be our last speaker, Jess.
Thank you.
Hello, this is Melissa, and I'm just calling to say that it's not right that if people are not vaccinated, that their jobs are on the line. It's really sad because I feel like the people who don't want to be vaccinated should have that right and that choice to say they don't want that in their body or for their families. Everybody who I'm in contact with, my immediate family and friends are not vaccinated, and we seem to be okay, and we are healthy. No one's gotten sick where we needed to be hospitalized. I know people who have passed away, but again, they were obese, and I've heard that before in these comments another time. And so I feel like those people should really take care of themselves, and we all should try to just really be healthy and look into those solutions just to be healthy and eat right and take care of our bodies. And our bodies are intended to get sick and get better. That's how we build immunity anyways. I guess that's all I have to say, but please do not take away our jobs for not being vaccinated. Thank you.
That concludes public comment.
Thank you. That's item 9. It was receive only, no action is required. If there's not any comments, we will move on to 10, 27, and 28. Supervisor Ellenberg, I see your hand raised.
Yes, thanks. I do have a couple of questions, President Wasserman. The last board meeting was our first briefing since surpassing the goal of 85% vaccination in the county among those over 12 years old, at least for the first dose. In prior waves of the pandemic, specific goals were set to scale up testing, contact tracing, and other key response infrastructures, all of which, by the way, we met or exceeded. While we've seen far too many deaths among our residents, our community really has fared better than most. And this is in large part due to the preparation, investment, and very hard work of all of our response staff and the buy-in and commitment of our residents to those goals. But now that we're in the 4th wave and with a different situation on our hands due both to the emergence of Delta and also very high vaccination coverage, Dr. Cody, I'm wondering if you can share what are the key goals that we should be focused on as a county, and what are the most important strategies or indicators of success that we need to be oriented around? That's my only question.
That was a question.
Thanks for your question.
Dr.
Yeah, thanks for your question. I think we're, we are in a new chapter of the pandemic where we're learning how to live with COVID. We are not going to vanquish COVID. And we also know that we've learned from the last 18 months and now have an additional very important tool in our arsenal, and that's vaccination. So we now have vaccination as well as masking, testing, distancing, et cetera. And as we all know, we are, the only thing we really have left as a mandate countywide is indoor masking, and all other activities have resumed, including children are now back in school for in-person learning. So what I would say is, as the environment shifts around us, we are going to keep doing what we know works, which is inching up our vaccination rate, so that Delta and whatever next variant comes along, that will be better protected. We're never going to be fully protected, but we're going to be better protected. And I think that, some goals like enabling kids to stay in school is a very important one. And masking is something that not only, has been very effective in damping down COVID transmission, but we also had virtually no influenza last winter when we had widespread masking. So there were other important benefits from universal masking. And then the third final comment that I would make is that we have our indoor masking mandate alongside other counties in the region. And as you know, since the beginning of the pandemic, to the greatest extent possible, we've sought to move as a region. So we would be in consultation with our regional partners in thinking about, when to make, a strategic change.
Right, thanks. I appreciate the comment about the flu. Of course, last year, not only were we masked, but kids weren't at school. A lot of folks weren't at work. So we really had some additional protection there. To folks that are asking us, at what point will the masks come off? They're comparing to, we looked at numbers for zones. We looked at percent to be in different color tiers. We looked at hospitalization rates. We looked at all sorts of data. What do you recommend that we tell people who are asking, at what point do the masks come off? If we're going to be living with this, as you say, for quite a while, are masks indefinitely in our future?
Well, I would say the question, so we do not have a set metric for, we reach a particular metric and the indoor mask requirement comes off. I would say that we would need to see our hospitals settle down, our cases low and flat, and some stability before we would recommend taking away this very important prevention measure. And the other thing I would say is that probably for many, even without a requirement, people will continue to mask indoors. It's part of many cultures, and it may well become part of our culture, at least in some segments as well.
Sure, if people are choosing it, that's not an issue. It's those who don't choose. So what I heard though is that we're looking for, you said, settle down. Our case rates are dropping, our hospitalization numbers are manageable. Does that not, I know I'm pressing you on something that you're unlikely to give me, but it's really important to all of us to be able to maintain public trust. And I'm very concerned that without an end game or a goal, that trust becomes more and more frayed. And I think we have done remarkable work. This community has pulled together in phenomenal ways, but there's also a lot of fatigue setting in. And I really recommend, if there's not an answer right now, that the public health officers from the region coalesce around this issue, have something, talk to us with some more certainty about where we're going in terms of mandates and requirements, not in terms of culture. If people want to wear masks for 10 years, God bless them.
Sure, we can certainly take that back to our group. And I just wanted to say again, at this point, as far as requirements, really the only requirement that we have is for indoor masking, and the rest are recommendations and guidelines.
Right, got it. And do you anticipate, sorry, I thought it was done. Do you anticipate, Dr. Cody, acting stricter than the state in any way?
I think that's pretty much impossible to say. I would say, as I said from the beginning, that my job is to think about protecting the public's health and to do so in the most nimble and holistic way. And that's what I'll continue to do.
Great. And I would urge it to also be in the very least restrictive way possible. Thank you.
Supervisor Chavez, your hand went down. Supervisor Lee. Yep. Supervisor Lee.
Thank you, President Wasserman. First of all, thank you, Dr. Cody, for always giving these very informative reports. I would like to first acknowledge the collective efforts of our county, and especially your effort and those on the administration, to be able to get our percentage of residents 12 and older with at least one dose, close to 87%, and those with a complete vaccination to 81.5%, which is one of the highest certainly in most of the county in California and around the country. This is certainly a huge accomplishment that's worth noting. Since the Pfizer vaccine now being fully FDA approved a couple of weeks ago, have we seen any type of additional people starting to finally get the first vaccine, or have you seen it to be pretty normal, nothing new in terms of the increase of vaccinations?
Yeah, there's a slide I had in the slide set that shows the trends in first doses, total doses, and second doses, and we really did not see a bump with the Pfizer announcement. We did not see a bump in our first doses or people initiating vaccination.
Okay. And I mean, the news is everywhere. I mean, I've seen it, so I would imagine it's not like a lack of us getting the word out to people. But I'm just surprised that, it seems like a lot of people were hesitating because they thought that this is not fully approved. So I thought that by having a fully approval should result in some additional people getting vaccinated. Now, the second question I have, I think I've talked about before, is since we are expecting there's some type of the EUA approval for Pfizer for children from 5 to 11 years old, I just want to double check with you on the plans being in place or getting ready so that when that were to happen, that our county is ready to have the sufficient vaccine for them, and also coordinating with the school districts as well.
Yes, we are certainly doing both of those things, preparing for when it's announced regarding third dose recommendations or booster dose recommendations, as well as approval for younger children. We're preparing for both.
Great. Some folks I met with last week was concerned that the vaccine might be expiring very soon. Just want to check in with you, and obviously we don't want to waste any vaccine, but since the desire the demand has dropped so much, have we really wasted a lot of vaccines at all, or was some of these expiration dates were able to get extended?
We've not had any issues with inventory management and vaccine wastage. So our pharmacists, pay attention to that quite closely. And for some vaccines, I believe they extended the expiration date. I can't give you the details on that, but anyway, it's not been an issue. We've had pretty careful inventory management.
Great. And we also see that retail pharmacies now seems to be a majority sites for people getting the vaccines than previously, when we actually have the mass vaccination site at the Levi Stadium, for example. Do you foresee that basically from here onwards that the pharmacies will be taking most of that load, or do you think we might have to potentially reopen any of those sites with the kits who are being approved?
I think that we do anticipate that we'll have an increase in demand, both when it's approved for younger children as well as for booster doses. Mm-hmm. And we will have county vaccination sites to be able to serve those seeking vaccination. And we also hope that in collaboration with healthcare partners, they will also be able to take on part of the surge and serve their patients.
Great, thank you. And the last question I think I discussed previously, HXC, is if possible in the future, we could track the hospitalizations and the death rates of those that has been fully vaccinated and not being vaccinated. I think that could be informative as well. Thank you very much, Dr. Odie.
Thank you.
Thank you.
Thank you. Thank you for the report. And Dr. Kamal, a question for you is, under what circumstances do you use those more advanced treatments?
Thanks for the question, Supervisor. So currently, those treatments are predominantly used for individuals who do not have severe disease, are not hospitalized, but are at risk for progression. So this would include people who have comorbidities, other illnesses, pre-existing lung disease, heart disease, diabetes, as well as those who are of older age. And so that's how our CICT group identifies people and gets them plugged in with the treatment. In addition, there is emerging data that these treatments might be useful for post-exposure prophylaxis, meaning that if someone gets exposed to COVID, giving them treatment may help prevent them from getting sick. And that's something that will be coming down the line very soon as well.
And Dr. Kamal, is the approach that we're taking with our healthcare system, is that a shared approach in our region and nationally?
Absolutely. So, I mean, we have just about every provider, PAMP, Kaiser, Stanford, having treatments available for individuals who do qualify for it. So it is definitely a shared effort.
Great, thank you. And then I have two, well, actually 3 requests. One is I'm very interested in understanding the logistics of some of what Supervisor Lee was asking about, and I would like, when we have our next report out, to understand the logistics of everything from the booster shots to next phases of vaccination and by age group. And I know that these will all require different touches, and I really am interested in the readiness of our healthcare partners to support those efforts in frankly in much more rigor and detail. So I'd appreciate that for the next meeting. And then the other is that I would be very interested in getting either an off-agenda report or a closed session update on the meet and confer process. And I understand this is a meet and confer on impacts. And so if that can't be in a public memo, I would like to have it agendized for our next closed session. Thank you. And thanks for the report and the good work. Congratulations, everyone.
Thank you, Supervisor. I'll just ask a quick question. I received earlier today, and I'm looking at it right now, a notice from a restaurant owner who tested positive for COVID. He quarantined for 10 days. And earlier today, he got a notice from I guess it's California Connect ED CDPH, yeah, .ca.gov. He just got a notice today that said he has tested positive for COVID. It's very contagious, and he needs to quarantine from other people for at least 10 days. He's been back to work for 4 days now after having quarantined for 10 days prior to that. Dr. Cody, is this something that if we've, I know this is state, not county. Is there something we can do with this information, or is there a way we can improve this system?
Well, it sounds like he got a late notification, but thankfully he took the right action, and that's the most important thing. So he took the right action to protect those around him. So I can't speak to why the notification came late. I don't know. Okay, so in general, you're not seeing issues from people regarding the state. Okay. I've not heard it. Doesn't mean it's not happening, but it's not come to my attention.
Gotcha. I can attest firsthand how great the county's communication system is. Thank you very much. That'll conclude.
Wasserman? I'm sorry. Just one.
Yes, Supervisor Chavez.
I apologize. Just one other issue that I wanted to reinforce. I am very interested in us staying as aligned with the state as we can to not cause confusion at a local level in terms of health orders. And so if there are any emerging health orders, I'd like the board to be alerted to that so that we have an opportunity to at least understand that, because the more confusion, I think we just have to understand the level of, strain and stress on our communities, which I know you appreciate, Dr. Cody. I know you are very mindful of that. Thank you.
Super. Thank you very much. We'll consider item number 9 received. We're now moving on to item 10, which we're going to hear along with 27 and 28. And members, just an FYI, we've got 15 items left. So we'll get to each of these as quickly and efficiently as we can. Okay, item number 10 from the county exec, Dr. Smith.
Thank you. This is Deputy County Executive Martha Lipinski. I'm going to go ahead and share my screen. Hello. Are you able to see that?
No, ma'am.
And how about now?
Yes.
Thank you very much.
Supervisor Chavez has a question. One sec, Martha. Supervisor Chavez, what's your question?
Sorry about that. Thank you.
Oh, no question. Go right ahead, Martha.
Sure. With me today is Margaret Olaya, the interim director of the Finance Agency, as well as Jasneet Sharma, the director of the Office of Sustainability. This is the quarterly report on COVID-19 recovery efforts.
Thank you.
So with that, just a brief overview of what we're going to be talking about today. We'll talk about the structure and activities of the Disaster Recovery Management Team. Then on the second bullet, the focus of this particular quarterly session will be on the Economic Recovery Support Function and the work being done by Margaret Olaya and her team there. This will be an example of how the public engagement is happening. Finally, we reported in May to FGOC on recommendations from stakeholders, which Jasneet will be covering, and then I'll finish the presentation out with answering questions about what the county has done during COVID that should be continued in the future. So with that, I'm going to talk about the structure and activities of the Disaster Recovery Management Team. As you can see here is the org chart, along with the responsible party for each of these support functions. I want to provide some clarity based on past meetings. This is the Emergency Operations Center's Disaster Recovery Management. It's a specific term of art for disaster activations of all kinds. It's integrated with state and federal processes and allows recovery work to occur after the EOC is deactivated at the conclusion of whatever emergency they're facing at the time. This is separate and distinct from the reconstitution of county operations, which is the process for resuming normal operations following changes in the state and local public health orders that allow resumption of services. And finally, we do have a term, just a general term of recovery, which has to do with the community getting back to normal, or most especially better than before. So the recovery support functions within this management team include, as you can see, health services, social services, housing, economic, and natural and cultural resources. As I mentioned before, the focus of this quarterly session will be on the economic recovery support function. That's the bottom middle box you see there under Margaret. So with that, I'm going to turn this over to Margaret. Her economic recovery support function is comprised of a cross-section of cities, private sector, nonprofit representatives, as well as designated county employees. And they started meeting back in May of 2020. So with that, I'm going to turn it over to Margaret.
Thank you, Martha. Good afternoon. I just wanted to share a little bit about what we've been doing since May 2020 with the board and the public. The purpose of this group essentially is to support individuals, cities, nonprofits, the private sector businesses within the county. And we do this by facilitating problem solving across the businesses, improving access to information countywide, as well as serving as a conduit between the county and the community. So there has been a lot of information that we've been thankful to receive from the businesses in the community, and we've been able to pass that and funnel that through the county channels to resolve some of the issues that have been raised through this support function. We have focused by way of objectives on residents and businesses within the county to provide information, like I mentioned. And we do that with a lot of assistance on operations during remaining operations during the pandemic. We were supposed to be the recovery support that was going to stand up after the EOC deactivated. We have been working concurrently since, and we haven't stopped. So the rescue as well as recovery has more or less blended together. Martha had mentioned to you the complement of task force members that we have, and very specifically, I'm going to talk about, well, I'm going to just mention some of them. We have 3 city managers involved from the City Managers Association. We've got representation from the St. Clair County Farm Bureau. We have representation from Joint Venture Silicon Valley. We have economic directors in the cities that are part of this, as well as the Chamber of Commerce, Silicon Valley Council of Nonprofits, Nova Workforce, and like Martha mentioned, a variety of key departments within the county. So you can tell from the way the task force leads are compositioned, we are spread out very widely across the businesses and the types of operations within the County of Santa Clara. Some of the current initiatives that we're working on right now, I think my biggest one before the board today is just to let the group wants you to know how grateful they are for the commitment of the board to the business community through the provision of loans and grants to small businesses. The guidance that the businesses have received, particularly from EOC, has been very instrumental and very supportive of businesses on being able to open safely. The food cap delivery ordinance was one that the business also greatly appreciated because it reduced some of the gouging that was going on. Moratorium on evictions, the device fee waivers, the vaccination drives within the farming community, to mention a few, are some of the very great initiatives that the board has helped to make the business continue to thrive as we go through the pandemic. So another great offshoot that has happened is that through this group, we have another subcommittee called the Reconnecting Silicon Valley Task Force, and they have been focused on business and travel industry to support that sector within the within Santa Clara County. We all know that Santa Clara County is a business destination as opposed to a vacation destination, and we have seen a lot of impact in that area, enough for a group to be facilitated and to be operational now, providing guidance and support to hotel business owners and also within the travel industry. So we have seen a lot of growth from that perspective, and everybody's looking at best ways to increase the county's reopening. Our future initiatives for now is really the group wants to make sure that we would like to see the county's Emergency Operations Center continue its leadership role in providing information and resources to the business community. It has been very instrumental because you can see all those signs across businesses and stores that you go into. They would like the county to continue in that leadership role, also to continue to support the business community through the business owner space, where information and training are provided to support businesses. The group will also like to continue to provide training and information and support to residents and businesses in the County of Santa Clara. The one area that we are also hoping to build on is on the individuals within the county. So opportunities for individuals to retrain, get a new certification. So if there is a lag in the current business space, that they will have the opportunity to train and gain expertise in a different area. And with that, I'll pass it on to Martha.
Thank you, Margaret.
Thank you.
Great. And with that, we'll go ahead and move on to Jasneet, please.
Thank you, Martha. Can I have the next slide? Thank you. And good afternoon, Board of Supervisors. I'm Jasneet Sharma, the Director for the Office of Sustainability. And I've been engaging with the recovery effort through the Resilience Committee, the flow chart that Martha had showed a little bit earlier. So I wanted to start by having you all look at some prioritized stakeholder recommendations. All these are important and they are presented in no particular order today. I'll just briefly go over these in the next few slides. At the board's request, these recommendations come from the recovery task forces and roundtables related to COVID-19 response and recovery efforts. Community engagement and outreach and partnerships with community-based organizations were enhanced during COVID-19 outreach efforts to residents and businesses in the county, especially in areas disproportionately impacted by COVID-19. Food access and availability has also been a priority for the county throughout the pandemic, and many agencies and food providers stepped up to collaborate and coordinate meal and food access throughout the county's region. Understanding ongoing food needs and areas of high need will be important for us. Support to businesses, especially minority businesses and small business development programs, such as the loan program for local small businesses, wherein the funds are loaned to small businesses through the California Rebuilding Program. And the board approved $6 million for this effort, and the recommended budget has $19 million in additional funds or one-time funds for this initiative moving forward. Next slide, please. Thank you. We also heard about wealth building strategies, which are going to be extremely important and would be made possible through employment or job training pipelines. One example is the social services agencies work with Bridge to Recovery, and this employment and training initiative can be continued during the community's recovery. Another is the Universal Basic Income Pilot expansion that the board also approved today. The board has taken numerous actions relating to temporary moratorium on evictions for certain residential and commercial tenants resulting from COVID-19. And the county has federal funding for emergency rental assistance and recently applied for a second pot of funding as well. Before and during COVID-19, the county has maintained its housing priorities and to increase the scope and breadth of supportive housing. And we will continue this as part of the recovery process for some years to come. We will also continue the need to address mental health, substance abuse, and other behavioral health needs. Next slide, thank you. The Board of Supervisors approved $7.1 million to the Santa Clara County Office of Education to help bridge the digital divide by assisting with the purchase of laptops, tablets, and Wi-Fi hotspots for students to continue to learn from home during the pandemic. Economic recovery requires local coordination and information sharing, pretty much what we heard Martha say towards the end. And the return of, we heard Margaret's share towards the end, and the return of economic and business activities to a state of health. The existing coordination and collaboration established with the community will continue into the recovery. In May of 2021, the Board of Supervisors approved an award to build on the existing public health infrastructure needed to rapidly identify, mitigate, and prevent disease and injury, including responding to future pandemics. This also will continue into the future. And lastly, the Parks and Natural Resources played a critical part in supporting community health and well-being, especially during the COVID-19 shelter-in-place orders. We should continue to support the community well-being during this recovery period by providing technical assistance and leveraging of resources for the restoration of arts and cultural venues, as well as parks and sports and entertainment venues. And I'll hand it back to Martha. Thank you.
Thank you very much, Margaret and Jasneet. I'm going to quickly cover the last two slides we have here. The next two slides answer a couple of questions. The question here for this slide is, what has the county done differently during COVID that should continue into the future? And these questions were asked of county leaders as well as the disaster recovery management team. So the details are in the report, but the broad categories you see on the slide are community outreach. This is the robust, for example, the robust social media and translation services that were provided to the public, health equity and primary care, something like telehealth, county operations and digital solutions, would also something we've done differently. An example of this would be the remote call centers to increase staff availability. An example of housing would be increasing capacity at hotels and shelters. Business recovery, a lot of the feedback had to do around the work of the Chibet team, and workforce development like social services, Bridge to Recovery. And on this final slide, the question posed here was, what community needs have been made more acute by the pandemic? There's no surprise that there's a lot of overlap between the answers here and what you saw earlier in the slides that Jasneet talked about around the prioritized stakeholder recommendations. There's more details in the report, but broad categories here include medical and mental health, safety net services, housing, jobs, outdoor recreation, and the arts. So again, we had a particular focus of the economic RSF in this quarterly report. Our next quarterly report, we plan to spotlight another function of the management team, the Access and Functional Needs Group, as well as the Recovery Communications Plan. So that concludes our presentation, and we're happy to take questions.
Thank you, Martha. And we're hearing 10, 27, and 28 all together, all receiving reports. I assume you've also got 27 and 28?
I've got 28, sir.
28. Okay, Dr. Smith on 27.
Hi, this is Brian. To present Brian Darrow to present. Just quickly, this is a report back on the referral that the board put forward at the June 22nd meeting. Per the board's direction, we have pivoted to incorporate more recovery-oriented resources into our community health and business outreach team efforts. Specifically, we've incorporated rental assistance and CalFresh outreach. And that work is going well so far. We're continuing to talk about vaccines as sort of a third program in that outreach, but we found that it's actually fairly helpful to lead with CalFresh and with the rental assistance to actually assist with the vaccine conversation, as we're offering resources that some residents aren't aware of that the county provides. And then we're able at the end to sort of offer vaccine scheduling assistance if the resident and household needs that. To Supervisor Simitian's note earlier about geographic distribution, we are really trying to be mindful to make sure we're reaching all pockets of need in the county. We've spent a great deal of time in East San Jose and in Gilroy, because those are the parts of the community that were hardest hit by the pandemic and also had some of the census tracts with lower vaccination rates. But we've also been in Mountain View, Sunnyvale, Milpitas, Alviso, Morgan Hill, parts of West San Jose, Cadillac, Winchester area, and a lot of other parts of the community. So we've really been trying to get good geographic coverage, again, because we know that there's a lot of areas of need across the county. And we have checked in with each board office as we're pivoting to this more recovery-oriented programming. We've checked in with each board office just to get a better sense in your experience where the areas of need are in your district. So thank you for the feedback from each of your offices. And with that, I'm here for any questions.
Thank you, Brian. And if I can speak for myself, you're certainly hitting the areas in my district, which are certainly very diverse. With that, we'll move on to 28. Martha, I think that's back to you.
I believe the county executive had some opening comments.
Dr. Smith.
Yeah, I was going to start this, if you don't mind.
Go right ahead.
Mr. President. We have a relatively short presentation for you here regarding the proposals for the Hurricane Rescue Plan funding.
Great.
When we talked before the recess about plans for this funding, we were hopeful that the feds will have a final rule in place by now. Indeed, they do not. So I need to add the caveat here that what we're suggesting here are general categories for recommendations that administration is making to the board as focus points for spending the one-time funds that are the American Rescue Plan. In terms of what we're asking for you today, from you today, is general direction. This will not be an allocation time because, as I said, the final details of the rule are not in place. However, we tried to focus on areas of interest that the board has already talked about, the community's already talked about, that other counties and other entities have already talked about, and give you an idea of the magnitude of impact that we can have. I would say in general, what we're focused on in our recommendation is the county's ability to continue the COVID response, which we know will go on for some time, as was discussed earlier. We want to make sure that we reward our employees for their heroic work during the pandemic. And we also want to build the community structure in order to help with recovery and ongoing medical, mental health, and community services. So I'll turn it back over to Martha, who will take you through a PowerPoint, and then we'll have questions.
Super.
Martha?
Thank you, Martha. Thank you, Jeff.
Here I go. Take the mute button off. All right. Again, Martha Lipinski, Deputy County Executive. Also here today as part of the discussion is Greg Aturia, the County Budget Director, as well as Margaret Alaya, the Interim Finance Agency Director. So we're here today to present a strategic vision to address the challenges outlined on the slide with regard to systemic public health and economic inequities and the region's safety net is the responsibility of the county. And then there's the obvious challenge of the continued pandemic response. This is a table of COVID funding that we've received or plan to receive in the near future. It does not include the 374.4 in American Rescue Plan funds yet. We're providing you with the existing landscape so you can see how the ARP funds would layer on top of these existing revenues. All of the revenues are restricted to certain uses such as supportive housing or vaccination. As you can see, we have received or expecting to receive at the bottom there, 505.8 million. And you'll see a row for FEMA towards the bottom. That amount is to be determined. Just to let you know, we are vigorously pursuing FEMA reimbursement and we've been submitting claims, but it's not known at this time how much or which ones FEMA will approve. Moving on, I talked about the revenues. Now let me talk about the expenses. This chart shows our pandemic-related expenses from the beginning of the pandemic to August 18th. As you can see, we've spent $728 million so far, and the expenses continue to grow. The top two categories are COVID-related payroll at 34.4% on the right there, as well as in specific services at 14.2% in the orange. We do expect the spending to continue to address the current potential future responses to the surge and impacts of the variants. So let me talk for a minute then about how are we paying for the $728 million in COVID expenses. This slide combines the last two slides with revenues and expenses to show how we're paying for the 728. As you can see, the existing revenues for that same time period reimburses a little over half our expenses, and then we've had to temporarily use county funds to fill that gap. I want to note there in the bottom right hand of the slide that part of the temporary uses includes the temporary use of county reserves, which do need to be replenished when the COVID-19 reimbursements are received. We've already talked about the $728 million spent to date on the county's COVID response. With the county's continued response into the future, we wanted to provide you a projection of future spending for your consideration. As you can see on the slide, we'd be looking at an additional $572 million over the next 2 years for total spend of $1.3 billion through June 2023. Here we wanted to provide the projected funding gap. Over at the top right, you'll see we talked about the expected revenue of $505.8 million. That's shown in the first row. The FEMA reimbursement, as we discussed, is still to be determined. And the third row shows that the ARP funds have not yet been allocated. When we take the projected spend from the last slide I showed you in the amount of $1.3 billion, we're looking at a projected funding gap of $794.2 million. And as you can see in the footnote, this is the projected gap with the FEMA reimbursement, which is unknown at the time. So let's go ahead and talk.
Martha, without, right?
Without, yes, excuse me, the mask. So let's go ahead and talk about FEMA on the next slide. So this slide brings the projected funding gap of $794.2 million from the last slide and layers on the possible FEMA reimbursement. To date, we have claimed $100 million in FEMA funds. We have not received any yet. There are a lot of factors, too many factors that are unknown at this time, but you can see there is an estimate of 416.5 to 520.7 in FEMA reimbursement, which means there's still an estimated funding gap of 173.6 to $277.7 million. I do need to call the notes out on this slide that we may not receive all that we've claimed from FEMA. and that just some of you already know that reimbursements have been historically slow. And there's also no guarantee of the 100% reimbursement past December 31st of this year. So now that we've talked about the revenues and expenses as well as the funding gaps, let's move on to the American Rescue Plan funding. You've seen something like this slide before, but I want to just reiterate the timeline. We've received about half the funding and expect the other half next May. So we don't have all the funds yet. And as the county executive mentioned earlier, we don't have the final rule, has not been published yet, so we don't know what the finalized regulations would be. And our final slide here, the ARP strategy is focused on 3 areas, and each of the 3 areas has 2 phases based on the timing of the funding that I just covered on the last slide. The first area focuses $244.7 million in 2 phases for past and future county COVID response expenses that are not covered by existing federal and state revenues. The second focus area is to support the system of coordinated care with medical, behavioral health, and community clinics for continued outreach and engagement for the underserved groups. And that'll be $65.2 million in 2 phases. The third focus group has to do with the continuity of operations during the pandemic response for $645.5 in the first phase. And this would be premium pay to county employees and IHSS workers. And I know I went through that pretty quickly, but that concludes my remarks, and we'll go ahead and take questions.
Thank you, Martha. I know what a detailed job your team does after going through a couple of other FEMA requests with fires and floods during my 11 years. With that, let's turn to our public speakers. They'll get a minute each. Jess, if you can start them off.
Thank you. And this is all together for 10, 27, and 28.
Yes, it is.
Our first speaker is Pancho Guevara. I'm unmuting you. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you, members of the Board of Supervisors. My name is Poncho Guevara. I'm the Executive Director of Stakeholder Community Service, and again, representing myself as co-convener of the Race Equity Action Leadership Coalition. The Real Coalition was formed last year with an eye towards overcoming racial injustices persistent in our society, our justice system, and local government. We have a broad coalition of nonprofits who are dedicated to this work and to achieving racial equity in Santa Clara County. On May 1st, we sent you our letter outlining principles for an investment agenda for recovery. And on June 9th, we provided you with our 12-page proposal signed by 92 organizations for investment in our communities. These letters outline our proposals about how the $140 million in the county's American Rescue Plan Act allocation could and should be spent. These proposals represent our collective thinking about how to center equity and community voice in our community and further racial justice and equity in allocating these important funds. We sincerely appreciate how board members have responded to these priorities under consideration today, such as promoting alternatives to incarceration, CDC development, and basic income expansion. We look forward to partnering with you to build on these concrete ideas. Thank you.
Thank you, Punch.
Our next speaker is Nick Kawada. I've unmuted you. Please go ahead.
Thank you, President Wasserman and distinguished members of the Board of Supervisors, Dr. Smith and county staff. Again, I am Nick Kawada, Policy Director for Silicon Valley Council of Nonprofits and co-convener of the Real Coalition. We appreciate the critically important work done by the county during the pandemic, including funding and launching programs that protect the health, housing stability, and financial well-being of vulnerable members of our community. We also appreciate that so many county employees have put their lives on the line, respond to the emergency side by side with nonprofit essential workers. And we acknowledge that many of the priorities reflected in our letter are already being invested in by the county. That said, we do ask for your commitment to create additional spaces for public engagement about how to support the communities who have been most harmed by the pandemic in the recovery context. And we also want the values of cross-sector collaboration, transparency to be reflected in the ARPA strategic plan. And we are somewhat concerned that the recovery report in item 10 does not mention equity or racial justice, even the board adopted the GARE framework. So just looking into that and moving forward. Thank you so much. We know you're doing much with very little.
Thank you.
Our next speaker is Leif Erickson. I've unmuted you. Please go ahead.
Thank you. This is Leif Erickson, retired Executive Director of Youth Community Service, a youth development nonprofit in District 5, an active member of the Real Coalition for Racial Equity. Speaking to item 28, thank you for your leadership addressing the impacts of the COVID crisis on our county. I'm calling to support recommendations by over 80 county nonprofits who signed the Real Coalition letter for use of American Rescue Plan funding to prioritize the needs of those who have been most harmed by COVID and its impacts. There are many ways that county budget can be reframed to address the impacts of this crisis, but ARP funds present a unique opportunity to address the impacts of systemic racism now exposed anew by the pandemic. I encourage supervisors to consider adopting the 6 priority areas of an equity investment agenda for recovery, particularly alternatives to incarceration. When we allow our young people of color to be underserved and mistreated.
Our next speaker is Richard Conda. I'm unmuting you. You'll have 1 minute to speak. Please go ahead.
Good afternoon, President Wasserman and members of the Board of Supervisors. I'm Richard Conda, Executive Director of Asian Law Alliance and a member of the REAL Coalition. I support the REAL proposals on the investment for the ARPA funds because the REAL proposals further racial justice and equity and reflect the values of coordination, centering community voices and transparency. Our proposals call on the county to spend its ARPA funds on the communities and people most harmed by the pandemic. Thank you very much.
Thank you.
Our next speaker is Josh Salo, apologies. I've unmuted you. Please go ahead.
Good afternoon, supervisors, Dr. Smith and county staff. I'm Josh Salo, the Executive Director of West Valley Community Services. We're a Cupertino-based nonprofit that's been serving individuals and families facing food and housing insecurity for the past 48 years. Our organization joined the REAL Coalition and signed on to the May 4th letter in the spirit of our agency's core values and to be part of addressing systemic racism, raising our collective voices to build an equitable and just community. I'm here today to ask for your leadership and how ARPA funds are distributed. Even though these are one-time funds, we have the resources. We believe the resources can be deployed to have a positive impact on folks that have been most harmed by the pandemic and further our collective commitment to racial justice and equity. Your leadership and track records indicate to me that our visions are aligned, and I'm hopeful we can work with you and the county and staff to invest these funds in a way that centers racial equity, furthers racial justice, and helps support our recovery. Thank you very much.
Thank you.
Our next speaker is Gisela Boucher. I've unmuted you. Please go ahead. Gisela has lowered her hand. Our next speaker is Bill Lee. I've unmuted you. You'll have 1 minute to speak. Please go ahead.
This is Bill Lee. I'm the Executive Director of Martha's Kitchen. And Martha's Kitchen and Loaves and Fishes together serve the meals to about 90% of the homeless in Santa Clara County. And what we wanted you to hear us on today is, we have received some funding through the pandemic, but since last year it was cut 45%. And I know that there's, potential for continued funding, but it's critical. You got a lot of needy people in this community, and we keep getting this patchwork of funding and don't know if we're going to have continued funding, and the effects of this pandemic are going to be with us for years to come. And we really hope that the county will work together with us so that we know that we can have the staff and the meals in place to ensure that our unhoused neighbors don't go unfed and don't go hungry here in this community. Thank you.
Thank you.
Our next speaker is Samina Usman. I've unmuted you. Please go ahead.
Hello, my name is Samina Usman.
Samina, we lost your audio.
Public Relations. I am calling in strong support of the REAL Coalition's proposal. Can you hear me now? Hello, hello? Can you hear me?
Yes.
Okay, hi. Sorry, I have a mask on right now. My name is Samina Usman. I'm the Senior Government Relations Coordinator for the Council on American Islamic Relations, and our organization is in strong support for the REAL Coalition's proposed recommendations for use of the ARPA funds. We must, most affected by the pandemic, we must take into consideration that there are going to be different needs based on those who have different racial or religious inequities and that are severely harmed by the pandemic. And so we must take that into account when it comes to the funding. And so I strongly urge you to consider the REAL Coalition's proposals. Thank you so much.
Our next speaker is Quinn Vong. I've unmuted you. Please go ahead.
Hi, my name is Quinn Vong, Executive Director of ICANN. We work with Vietnamese children and families. And We are also a member of the Real Coalition. I would urge the Board of Supervisors to adopt the 6 priorities proposed by the Real Coalition, as these represent our collective wisdom and insights from scores of CBOs. I particularly urge the Board of Supervisors to engage CBOs in the dialogue about how to use the ARPA fund and have a lens of racial equity in all of the resource allocation decisions, especially look into the gaps of services so that marginalized communities are not left out and systemic racism barriers can be erased. Thank you.
Our next speaker is Sean Girth. I've unmuted you. You'll have 1 minute to speak. Please go ahead.
Hi, everyone. My name is Shawn Girth. I'm a Real Coalition member, the ED of Educare California Silicon Valley in the Santee neighborhood of D1, and a resident of D4. As an organization that serves children birth through 5, we represent children who do not yet get the obvious avenues to advocate for themselves. They don't get to vote, and obviously they're not ready to understand this kind of conversation. Being a part of the Real Coalition and signing on to these priorities is a way to advocate for our children. We all know that our children and their families live in a complex intersection of need: housing, mental health, food, everything we've heard in the presentations so far to date. As we continue to live through this pandemic, we need to prioritize those most impacted. I stand in support of the Real Coalition's proposal that calls on the county and other local governments to spend ARPA funds on communities most impacted. Thank you.
Our next speaker is Tracy Weatherby. Please go ahead. Tracy.
Okay, thank you. This is Tracy Weatherby, Vice President of Strategy and Advocacy for Second Harvest Silicon Valley. We really appreciate the attention to the needs of our vulnerable communities and support the Real Coalition's focus on equity and recovery. As you all know, food insecurity has skyrocketed during the pandemic, and we don't expect need to decline anytime soon. Second Harvest and our 300 partners are serving over 450,000 people each month. And we still believe that about 1/3 of the people struggle to live in this area. And so there's always a risk of food insecurity for those folks. They struggled pre-pandemic, they found our resources during the pandemic, and they'll continue to need our services. 57% of our clients have less than $100 in savings. We're grateful for the efforts being taken by the County Exec's Office to bring the City of San Jose and the county together to plan for this ongoing and future need in our community. And we hope it'll support groceries, meals, and walk-in meals. Thank you.
Our next speaker is Jen Meyer. Please go ahead.
Hi, my name is Jen Meyer. I am a community organizer with Sacred Heart Community Service and a local voter in District 2. The board adopted the GARE framework and directed staff to conduct its budgeting with a racial justice lens, and we should see that more strongly reflected in the recovery report and strategic planning. Federal resources for recovery offer us an opportunity to spark real transformation, and racial equity should be at the center of recovery planning. I stand in support of the Real Coalition's proposal that calls on the county and other local governments to spend its ARPA funds on the communities and people most harmed by the pandemic in a way that furthers racial justice and equity and centers community voices. Thank you.
Our next speaker is Valerie Valtierra. I've unmuted you. You'll have 1 minute.
Hello, can you hear me?
Yes.
My name is Valerie Valtierra, and I am a social worker with DFCS. I'm calling in support of the premium pay outlined in this agenda item. Many of us county workers have continued to tirelessly work at the front lines of this pandemic, putting our own health and safety at risk. We have rearranged our work schedules, our family lives, in order to support the safety and needs of our community. Compassion fatigue has led many to terminate their employment with the county. In many ways, county management has taken this opportunity to misuse and abuse their staff, which was supported by labor relations in many cases. The FCS is currently facing a lot of vacancy positions in social worker 1s, causing social worker 2s and 3s to have to stretch themselves far thinner than they had to before. When making your decision for voting on this item, just know that the gesture can help boost morale in the county by showing appreciation. Vote yes for this premium pay. Thank you.
Our next speaker is Marianne Waddell. I've unmuted you. Please go ahead.
Can you hear me?
Yes.
Great, thank you. Hi, my name is Marianne Waddell, and I'm a social worker at DFCS and the vice chair for the Social Services Unit. On behalf of the SEIU 521 Social Services Unit, we want to urge the board to approve Agenda Item 28. This recognition of our essential work above and beyond during the pandemic means so much to thousands of SEIU 521 essential frontline workers who work directly or indirectly to serve the public and maintain the county services and infrastructure during the pandemic, while also trying to protect themselves and their families. We implore you to please support us at this time. Thank you.
Our next speaker is Santiago Gaitan. Santiago, please go ahead.
Okay, hello?
Yes.
Hi, I'm from the Santa Clara Probation Department. I just want to let you guys know that throughout the 18 months of COVID, my peers and I showed up to work every day for 16 hours straight with our PPE. Sometimes we would have to use the same mask for a week if we were only given one. I lost my dad to COVID this year because of COVID, and I still showed up to work. I had my daughter during COVID, still showed up to work. I did not have the privilege to work at home as some of the other people did. So I'm asking that this gets passed and that you guys consider all the workers that are at the James Ranch facility and provide them with something that would help with the morale and get us through this COVID. So thank you very much to the Board of Supervisors.
Our next speaker is Jason Dorsey. I've unmuted you. You'll have 1 minute to speak.
Good afternoon. My name is Jason Dorsey. I'm one of the chapter vice presidents for SEIU 521. Santa Clara County and its essential workforce have endured to date over 530 days of uncharted activity through multiple fires, unprecedented deployments, chronic homelessness, around-the-clock COVID operations, shelter in place, protests, workplace violence. That's just to mention the major incidents. We believe that everyone has only made it through this far by its continued effort to work together to attempt on controlling this pandemic. And I thank you for your leadership.
Thank you.
Our next speaker is Janet Diaz Perez. Please go ahead.
Good afternoon. My name is Janet Diaz. I am the president of SEIU 521. The American Rescue Plan has made funding available for the use of essential worker pay that recognizes the daily operations of the essential worker during the pandemic. We support a motion to approve the premium essential worker pay for county employees and in-home support services. Support service providers. SEIU 521 understands the importance to never lose sight of our combined goal of serving and protecting our community. Board of Supervisors, thank you so much for your leadership. And yes, that was my doggy Cujo, actually my grand doggy Cujo and my granddaughter. So I'm sorry about that.
Good job, Janet. Thank you.
Next speaker is Kathy Cordova. I've unmuted you. You'll have 1 minute to speak.
Thank you, members of the board, for this opportunity to speak on number 28. I'm Kathy Cordova, Executive Director of Recovery Cafe San Jose, located in District 2. I'm a resident of District 4 and an active member of the Real Coalition. Recovery Cafe, our staff and volunteers remained working throughout the pandemic as essential workers to feed and provide crisis counseling to some of Santa Clara County's most vulnerable, those struggling with being unhoused, traumatized by mental health issues and substance abuse. Today is Overdose Awareness Day, and we are seeing an increase since the pandemic in fentanyl deaths, especially in our unhoused population. The pandemic disproportionately impacted our most vulnerable. Our neighbors have lost lives not just to COVID, but to resulting mental health and substance abuse crises. I urge you to center the American Rescue Plan funding with equity and community voice. Please support the Real Coalition's principles as you make these critical funding decisions. Thank you.
Our next speaker is Lucia Ojeda. I've unmuted you. Please go ahead.
Hi, my name is Lucia Ojeda. I'm an extra help probation counselor at James Ranch facility. I've been with the department for the last 3 years. I support the premium pay outline in this agenda. Many of us have continued to tirelessly at the front line work during this pandemic. You know, in my own life, I was impacted by this pandemic. We had to work 16-hour shifts. We had the fires, we evacuated, we went to juvenile hall. Unfortunately, we didn't have a lot of PPEs in the beginning. We still maintained, and you know, we're a family, we stayed together. We took care of our community, our youth, and we continue to do it now. I urge you to vote yes for the premium pay and help boost morale at work. Thank you for your time.
Janice, I'm sorry. I think my connection is weak today. Janet Bustos, please go ahead.
Hello, good afternoon. My name is Janet Bustos. I'm a probation counselor in the Santa Clara Probation Department. I support the premium pay outlined in the agenda because I believe that myself and 60 other of my peers pushed through this pandemic with bravery. We did not have the privilege to work from home. We showed up for 16-hour shifts every 2 days for over a year. Each shift came with plenty of risk for our health and the health of our families. We made 100% sure we supported the safety needs of our community while still maintaining our health. As frontline workers, we had to be brave, and we had one goal: to complete our job duties and return to our families safe and COVID-free. Thank you.
Our next speaker is Liz Gonzalez. I've unmuted you. Please go ahead. Liz Gonzalez, please accept the.
Hi, can you hear me?
Yes.
Okay, thank you. Liz Gonzalez with Silicon Valley Debug and the newly formed South Bay Community Land Trust, whose mission is to take land and property off the speculative market to provide housing that is permanently affordable for generations. We signed on to the letter from the Real Coalition on ARP funds and encourage you to adopt the 6 points presented because we have a great opportunity to concretely improve the lives of our communities most marginalized and those deliberately excluded from decision-making, and to not repeat the harms our current system has caused. We encourage the county to continue with sincere conversations around alternatives to incarceration. We also encourage the county to invest in community solutions that build and keep community wealth, especially our people in our local communities. Thank you, and we look forward to working together, moving forward in a just recovery.
Our next speaker is Carrie. Carrie, I've unmuted you. Please go ahead.
Hello, my name is Carrie, and I've been with the food service worker with probation department for almost a year. As a food service worker and many of the other blue collar workers, we have been working hard in the probation department. Do not have the luxury of working from home during this pandemic. This has put my family at a greater risk of exposure to COVID-19 virus until this has led through a higher stress and anxiety for both me and my family members that have stepped up to help during the distance learning as I continue to work during school hours, resulting in more people being put at risk because of my need to be working in person. I know we have worked hard tirelessly through this together. Thank you.
Thank you.
Our next speaker is Darcy Green. I've unmuted you. Please go ahead.
Hi, Darcy.
Hi, this is Darcy Green. I'm the Executive Director of Latinas Contra Cancer. We serve the low-income Latino community and the medically vulnerable in our county. Our organization signed on to the May 4th Real Coalition letter for the same reason we continue to be active members of the coalition, because we are deeply committed to achieving race equity and social justice in this county and view this effort as imperative to the public's health. We stand in support of the Real Coalition's proposal that calls on the county and other local governments to spend its ARPA funds on the communities and people most harmed by the pandemic, and in a way that furthers racial justice and equity and reflects the values of coordination, centering community voices, and transparency, and in a way that engages local CBOs. Thank you for all the hard work that you've put out into our community, and thank you for the opportunity to give input.
Thank you.
Our next speaker is John Pedigo. Please go ahead.
Hi, my name, can you hear me?
Yes. Yes.
Hi, my name is Father John Pedigo. I'm with Catholic Charities. I'm the Director for Advocacy and Community Engagement. I'm an active member and participant in the Real Conversations. The agency and the work that we do in the community, we have served 18 million meals since the beginning of the pandemic, and presently we're doing numerous one-to-ones throughout neighborhoods in the hardest hit areas in Gilroy and in San Jose 95116, 127, 122, 111. We're in support of the real proposal. We feel that we need to include the concerns and have the direct voice of those who are closest to the pain to be part of the conversation and lift it up, because that's the only way that we're going to understand the solution. So we do see that we do it. Thank you for the work that you're doing. We just hope that we continue to include those voices that are of the marginalized to be at the center of our conversations. Thank you.
Thank you. Thank you.
Our next speaker is Rosalinda Nunez. Please go ahead. Turn your microphone on. We will come back. Our next speaker, I believe it's supposed to say state law. I've unmuted you. Please go ahead.
Hi, my name is Star Law. I've been with the probation department for 17 years. I support the premium pay outlined in agenda item 28. My own life was impacted by COVID and being an essential worker on the front line. My family was scared. We were scared for the youth in our care. And early on, with an early exposure, I lost all my COVID hours. We had to work 16-hour shifts and our schedule changed. So we also were evacuated many times to juvenile hall, which added a 50-mile to 100-mile commute for some of our workers. We had to wear hazard gear for 16 hours, sweating in gowns, gloves, and 3 masks that we had to reuse daily. We were in fear for our youth who could not see their families and had much compassion fatigue. We were not offered telework when we were quarantining. Our self-care and our fears, and we had so many fears, and we had been pushed to the limits as essential workers. When making a decision on item 28, vote yes for the premium pay. This gesture will show appreciation to the staff on the front line who are charged with the care of our county's most vulnerable residents.
Our next speaker is Jacqueline. I've unmuted you. You'll have 1 minute to speak. Please go ahead.
Hello, Board of Supervisors. I'm Jacqueline Wenino-Sapat, and I'm a member of the Board of Directors of Sacred Heart Community Service. Recovery funds must be focused in the hardest hit communities and families, which have been our BIPOC communities. With systemic racism, when emergencies happen, this is often the case. You have significant opportunity here to make an intentional shift from treating symptoms to healing root causes. I support the Real Coalition proposal that calls on both the county and other local gov to spend its art funds that furthers racial justice and equity and transparency, centers the voices of those of us with lived experience of the harshest impacts of the pandemic, and encourages us to work together across silos. I really want to emphasize also making big investments in alternative to policing, incarceration, and community crises. And I appreciate the item today that I saw on community development corporations, which I believe is going in the right direction. Thank you so much for what you do for the community.
Thank you.
Our next speaker is Quincy Phillips. I've unmuted you.
Yes, this is Quincy Phillips. I'm calling as the Executive Director for Building Back Better. Want to show appreciation and say what's up to the President and the board. Appreciate all of your time and your energy to this. I'm calling to support the Real Coalition, realizing that this is arguably one of the first times that we'll have the runway and support and resources needed for change. and more than likely seen in other areas with those that are more privileged. So I really, really strongly urge you all to consider the Real Coalition's desires, and that this conversation is just the beginning and there's more to come. Thank you for your time.
Our next speaker is Roberto Gil. Please go ahead. Roberto, there you are.
About that. Hello, first of all, my name is Roberto Gil and I'm here with Sacred Heart Community Service. And I'm here in support of the Real Coalition proposal to the county on how to spend or like to prioritize ARPA money for racial justice work in our county or racial equity work. This is really important work as the county has done a really valiant effort to protect our community during this time. So have so many in our community, you know, as essential workers, as frontline workers, we see the damage that the pandemic has caused on our community. But this is nothing new. This is historical. These are many community members that have been marginalized and impacted for many years, for generations. So this is an opportunity to really change that. So I encourage our county to really invest in racial justice and racial equity work. Thank you.
Our next speaker is Tino. I've unmuted you. Please go ahead.
Yeah, at this point, my concern is...
Apologies, Tino. Please accept the unmute one more time.
Yes, at this point, I have to be concerned about the funding, and not only for this, but also for all other programs moving forward. Will the board commit to making these types of funding efforts available to everybody, regardless of vaccination status? Because at some point, people are going to start pushing. A certain amount of your employees have to be vaccinated in order to get these funds. A certain amount of your clientele has to be vaccinated, or your patients, or whatever the case may be. So proactively, I am asking the board to put in language right now, moving forward, as we see a two-tiered society being developed and division being created, put in language into everything where you will include these rights, these funds, these services to everybody, regardless of vaccination status. Do not discriminate. You know it's coming. You know it's true. Be proactive.
Our next speaker is Yvette Diaz. Please go ahead.
Good day. My name is Yvette.
Jess, that's not going to work.
I've been a probation counselor in the probation department for the last 13 years. I work with incarcerated youth at the James Ranch Rehabilitation Facility. I support the premium pay outline in this agenda. Hello?
Yes, we have you, Yvette. Go ahead.
Okay. Myself and countless other of my coworkers have continued to work the front lines during the pandemic. We were not allowed to telework from home. It is a 24-hour correctional rehabilitation facility. We had to rearrange our schedules and our own families' lives in order to support the safety needs of our community. In my own life, I was impacted as a single mother of 2 little girls. I worked on Christmas Day last year and was exposed to COVID by one of the youth who was COVID positive. I was told I needed to quarantine for over 2 weeks, and I did not have any personal or vacation hours, then thus had to take no pay. This caused financial issues and stress. Also, I had the risk of...
Our next speaker is Alkamara at rnpa.net. Please go ahead.
Good afternoon, Board of Supervisors. This is Alan Kamara, the president of RMPA. On behalf of all our nurses, we want to first acknowledge and thank all the Board of Supervisors for all your hard work. And we want to ask that you support this agenda item and support the pass the premium pay for all healthcare workers. We also want to echo the sentiment of all the speakers. It has been a long year for all of us. We ask that you invest in those who invest in the community. We thank you for all your work, and on behalf of our members, we thank you again.
Thank you, Alan.
Our next speaker is Laura R. I've unmuted you. Please go ahead.
Hi, my name is Laura Rios, and I'm a Santa Clara County worker from Valley Health Plan. I would like to ask the board to approve the essential worker pay to the thousands of Santa Clara County workers who are SEIU 521 members that serve and protect our community daily, regardless of worker is serving in person or remotely. In advance, we appreciate the board taking this step towards acknowledging us essential workers. And on a personal note, I have just wanted to let you know I am an Alameda County resident. I am so grateful that I work for Santa Clara County. I am so proud of all of the work that you have done to protect the community, to protect the hospitals, protect everybody in there. I just want you to know that none of the work that you have done has gone unnoticed. Thank you so much.
Thank you.
Our next speaker is Trina. Trina, please go ahead.
Hi, good afternoon. My name is Trina Moring and I work in the DA's office. I'm a member of SEIU Local 521, and I'm trying to pull this up so I can read it on my phone. I'm having a little bit of trouble. I'm gonna have to ad-lib it. Asking you to support item number 28, the essential worker pay. This has been a long year and a half. We've had many people out for disaster service work. That in fact has impacted the work in the office. I myself, for example, I had to help cover 2 other desks because we were sort of short-staffed. I also was a contact tracer for a short amount of time. So all of us here, we're asking for your support in this premium worker pay. Thank you.
Our next speaker is Melissa Ortiz. Please go ahead.
Hi, my name is Melissa Ortiz, and I've been a park maintenance worker with County Parks for 4 years. I support the premium pay outlined in agenda item 28. During the whole of this pandemic, our county parks have remained open, and my coworkers and I have risked our health and our safety to show up every day to provide clean and safe parks and facilities for everyone. The county would not be able to provide this essential service without us and other essential workers. Know that your support for the premium pay outlined in agenda item 28 would be a huge boost in morale for a very stressed workforce with many vacancies, and a way for the county to show up for essential workers who have been tirelessly showing up for you. Thank you.
Our next speaker is Gisela Boucher. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, everyone. My name is Gisela Boucher. I'm the CEO of Loaves and Fishes Family Kitchen. When my partner organization, Martha's Kitchen, and I joined forces early in the pandemic to secure funding for the increase in services, when we first applied, our numbers had already doubled. By the time we'd actually submitted our application, the number had tripled. And unfortunately for both of our organizations, this has not changed. Our numbers continue to go up, unfortunately, while funding has gone down. Further funding declines or actual removal of funding in support of our work would really have catastrophic impact on the folks that we serve. We serve the most vulnerable in our community who don't have anywhere else to turn for access to healthy, nutritious food. And food is that great leveler. We all need it. We all have to find ways to secure it. And we're here to help those who need it the most. Thank you.
Our next speaker is Gabriel Hernandez. You'll have 1 minute to speak. Please go ahead. Gabriel, you'll have to accept the unmute to turn your microphone on. We'll come back to Gabriel. Our next speaker is Jocelyn Cardona. Please accept the unmute. You'll have 1 minute to speak.
Hello, my name is Jocelyn Cardona, and I'm here with Sacred Heart Community Service. Thank you for the opportunity to speak. Throughout the pandemic, I have heard so many stories from our low-income members on our call line and community members of color being affected by the pandemic as they experience housing instability, increase in mental health issues, food insecurity, and trying to survive ongoing crises. The need is still here, very much so. It is heartbreaking to witness how many times our communities of color and low-income residents must advocate for themselves when instead our funds should prioritize their voice and invest in them. This is why I stand in support of the Real Coalition's proposal that calls on the county and other local governments to spend in its ARPA funds on funds to support those most harmed by the pandemic in a way that furthers racial justice and equity and reflects the values in centering community voices and transparency. Thank you for all the hard work that you do and the opportunity to provide this statement.
Our next speaker is B. Beekman. I've unmuted you. Please go ahead.
Hi, Blair Beekman here. Thank you for the ideas of looking into benefits for employers of county government or employees of a county government. San Jose has been looking into this work. VTAs, East Bay cities like Oakland and Berkeley are as well. It's about time, and thank you for these efforts. The subsidy process, you guys are very fearful to how to talk about, a whole new future that's been opened up about the future of subsidies. We have to be responsible with these practices, and it can be a shared learning process for both government and community. We both need to learn how to ask better questions about a lot of new subsidies that are happening at this time. Good luck in these efforts. And finally, I hope this can be a time that we start talking more about COVID vaccine issues with all the vaccine passport questions. Let's learn how to talk about it again and make it open and trustful and honest. Thanks.
Our next speaker is Rosalinda Nunez. Rosalinda, I've unmuted you. You'll have to accept the unmute, and then you'll have 1 minute to speak. Rosalinda, will you turn on your microphone? Rosario, will you try instructions in Spanish just to be sure? And it looks like it's a connection issue.
Sure. Sorry, can you hear me?
Yes.
Yes, can you repeat the name, Rosalinda? Sorry.
Núñez.
Okay. Hold on, please. Rosalinda Núñez, ¿puede activar su micrófono? ¿Puede aceptar la invitación para poder hablar?
I think she lost her microphone, so I think we will call that done.
Okay.
Thank you, Rosario. That concludes public comment.
Thank you very much, Jess. I appreciate that. Board members, that was items 10, 27, and 28. We appreciate all the comments by the approximately 35 speakers that we had. There is no action necessary on any of these. Supervisor Lee, I see you have your hand raised.
Yes, thank you, President Wasserman. I do have a few follow-up questions on the various items, so let's go with 10 first.
Okay.
With 10, how is the county approaching the long-term planning for the vulnerable population in collaboration with the City of San Jose and food partners from across the county? And is the county exploring the potential ongoing funding for food for vulnerable populations by either ARP or any other type of funds?
Martha, it sounds like for you.
Yes. Can you hear me okay?
Yes.
Okay. Yeah, the around the food initiatives, those are continuing through social services. The social services continue to take the lead on the countywide food issues, notwithstanding anything to do with the American Rescue Plan funds.
Okay, thank you. And the second one is relating to 27. First of all, I just want to give my deepest thanks to the Shabbat, the Community Health and Business Engagement Team, for their excellent work in the community, and many of them are door to door. As far as the outreach, how about the outreaching to the homeless individuals and families? Is that something that the Shabbat group does as well, or is it all on, like, say, VHP and other areas?
Thank you for the question, Supervisor Lee. This is Brian again. We've had a little bit of interaction in the field with individuals who are unhoused and actually signed up a couple of folks for appointments, but that has not been a big part of the strategy. It's really, we've left that kind of outreach, particularly as it relates to vaccine work, to our Valley Homeless Healthcare Program, who have done a lot of work, I think, as you're aware of, going to encampments and shelters and doing some vaccine clinics. More recently, the MOVAX team has actually done some of that work in shelters as well, but no, it's been much more door to door and business. It's small business focused.
Great. Now, according to the report, the CHW staff member contacts the target population in the field takes about 25 minutes or so, right? If more staff is required, do you see that we could maybe shift some of the folks like from the CalFresh staff to join the Chibet teams, or it's completely separate?
At this point, I think it's a pretty different model, but we're in close conversation with the Social Services Agency on this program. And so we're trying to kind of learn as we go. It's, I was just looking at it's been about 10 days since we started actually assisting folks with the applications in the field. And we have about 87 applications submitted so far. So we kind of want to get a little bit more time to get a sense for how much volume could be achieved with our current staffing. But we do continue those conversations with SSA.
Okay, thank you. Then the last bunch of questions I have is relating more to the ARP 28 here. So the ARP, the American Rescue Plan, right, was passed with the intent to deliver immediate relief to American workers, building the bridge to an equitable economic recovery and immediate reduction of child poverty. It is an opportunity to build back better. And while I appreciate the administration's strategic vision for the ARP funds, this proposed use, past and future county COVID-19 response expenses, system of coordinated care with medical, behavior, and health services and community clinics, continuity of operations during pandemic response. It does somewhat feel like it's more of a continuation of what the county has already been doing during the pandemic. So I would like to ask or challenge the county to think potentially even bigger, as in how can we use this one-time resource to be better than before and to support those who have been most impacted by the pandemic.
Did you want a response from me, or
was that statement or question?
It doesn't have to be a rhetorical question, but I'm just like throwing it out as a question that Dr. Smith, you might think there might be areas we could think better, think bigger in this case.
Yeah, we are trying to think big, and we tried to mimic what was captured in the Real Coalition's recommendations. I think you'll see from looking through their letter and through our proposals that there's really nothing inconsistent with them. The only thing that we have in our recommendation that's not in the Real Coalition's recommendation is the hero pay. They also have some issues in their letter concerning policing and community development corporations. We will have to wait and see if those are allowed by the final rule. There's some debate about whether those kinds of investments will be able to be done. But our first page of the transmittal focuses on equity and expansion of services to the communities who were most damaged by COVID. And I think the board knows that in our community, those were communities of color, in particular locations across the county. So we wanted to mimic that and give you something that we could ask for your direction with.
Thank you.
Sure. And thanks, Dr. Smith, for that. And you know, when I look at ARP allocation plan, one thing I try to do is let's see if we can learn from other counties, especially larger ones that's more comparable to us. So I was able to dig in a little bit regarding Los Angeles County and San Diego counties, right? And then LA County, it's clear that they did put equity front and center, right? For example, on the first tranche of the ARP funding, they come up with a program like a guaranteed basic income pilot, housing and support services for the homeless, legal assistance for immigrants, grants for businesses, nonprofits and arts organizations, and programs to address trauma and violence, and even ethnic media and advertising as well. So I would just like to request administration to be able to see providing a more detailed breakdown of our county's proposed ARP allocations and display the information similar to, say, LA County's presentation and chart, and I'll be happy to provide that to you, Dr. Smith, to look at. Currently, the administration is also proposing a $64.5 million to give premium pay for county employees and IHSS providers. So I think it's great that we include the IHSS providers, because even though they're not necessarily frontline and outside, they certainly are providing extremely important function. So the question I have is this: is that premium pay currently as envisioned for every single county employees, or are we talking about a subset? So for example, in Los Angeles County, they gave out $65 million for disaster service worker program. Now, San Diego County gave out $36 million for what they call county essential workers. So I just wanted to see if we have any type of delineation this time, or is this still work in progress?
I can give you our intent, but I also have to add the caveat that there's some debate about what the final rule will say. The final rule is likely to have some delineation of whether or not people are eligible for hero pay based on whether they teleworked or not. But our intention from a staff perspective would be $2,500 per FTE. So, you know, prorated for every working individual that is a county employee, based on their position hours, or in the case of extra help, based on how many hours they worked during the 2-year period. And then $500 per IHSS worker to augment what the state is doing. And we would use the state's same allocation process. They're contributing $500 per person, so we'd make it a total 1,000. And we just use the 64 million as our best estimate of that, based on what we know at this point in terms of the final rule. But you know, that's going to be a flexible number depending on exact details in the rule.
Sure, and certainly for those who are disaster service workers in the front line having to go to work, I think definitely those are folks that absolutely must be qualified for it. And I certainly asked to look at the other counties' program just to see where it makes sense, right, for us as well. Now, during yes, sorry.
Go ahead.
From an administrative perspective, our stance is that all of our employees are disaster workers. And we think that whether you worked from home or worked on the lines, you were contributing to keeping the community safe. So at least from an administrative perspective, we weren't planning on, you know, making different categories of employees. Obviously, if the feds tell us we have to, then we need to deal with that. But
right. And of course, we don't want to have any potential clawback either. That would be horrible. Now, during the June budget hearing, I requested the administration to report back to the board with the options of developing a dashboard that outlines our expenditures charged to the federal funding sources like CARES Act, FEMA, and ARP. And I would like to add to the request that if the administration also add information to that dashboard about the eligible expenses for each source of these type of funding. I certainly think that we should leave no stone unturned and make sure that we are maximizing opportunities for getting more reimbursements to limit the financial liability to the county. Given the numbers we propose for FEMA, which is like 100 million, given the scale of it, it looks like it's a very small ask. And it looks like there's certainly more opportunity that we could probably do it. And I know we have already hired FEMA experts, consultants to help us on this project, correct?
Yes, Supervisor, the dashboard you referred to as a work in progress.
we'll have that information. And in terms of the requests so far, the 100 million, that just refers to what's been completed so far. We expect many, many more requests to come from us.
Right, exactly. Yeah, that to make sense. So thanks for doing that, and we certainly need to be very aggressive on that effort. Um, the proposed use of ARP funds suggests that pandemic-related county work will be reimbursed, but how about the pandemic-related work of our CBOs? So how is the county actually tracking COVID-related expenses that are billed by the county CBO partners? So just to make sure that we will be able to submit the claims on a timely manner for the reimbursements as well.
For the CBO partners who are doing work with under a county contract, participating in Chebet or clinic services or behavioral health services or some other service that we've contracted with them, we have records of all of that. We will claim all of that. For many of the community partners who have been providing services during the pandemic that weren't specifically contracted for, we'll rely upon them to keep track of their own expenditures, and they'll have to apply for FEMA reimbursement on their own. But as we tried to make clear in our proposal regarding ARP, I think that a significant portion of the ARP funding will be recommended to go to the community partners who didn't necessarily have a contract with us, but who provide the backbone of services in our community, in whether it's clinics, behavioral health, food banks, faith-based services, whatever, trying to build up the backbone to be able to respond in the future to a disaster like the pandemic.
Thank you, Dr. Smith. And you mentioned that the FEMA reimbursement by some CBOs seem to have to do it themselves, since we know the FEMA rules are pretty complicated. Is this something that we might be able to lend some of our expertise that we have acquired to help us on these small CBOs?
Yes, we're working with them.
Okay, very good. All right, and that's all the questions I have. Thank you, Dr. Smith.
Thank you. Seeing no other hands raised. Oh, Vice President Ellenberg. Vice President, unmute. Vice President, did you wish to speak? Your hand is raised. Your finger is raised.
I didn't realize I was still muted.
No worries at all.
Thank you.
Did you have a question?
I do. I want to just first, of course, start by thanking Dr. Smith for organizing the report. I want to be clear that my May 4th referral really directs the board to have a thoughtful conversation around prioritization. And the report has some good general direction, but I'm not sure it has all of the information that we need to really have the conversation. And maybe my questions can be answered in real time. First, I don't fully understand the premise that we need to pay ourselves back with ARPA funds. The budget was balanced in June, so the concept that county funds spent on COVID response performed prior to the end of the fiscal year need to be paid back isn't clear to me. The budget didn't include any funding gaps. We didn't hear about it in the budget hearing, and we know specifically that ARPA wasn't allocated in the June budget. I know Martha mentioned a portion of the spent funds was from the reserve, but that amount isn't delineated. And my understanding is that our June budget already included fully funding our reserve.
Dr. Smith.
Go ahead and let Greg explain it.
Yeah, this is Greg Atria, County Budget Director. Thank you. One of the slides showed the payroll costs as part of the piece of the pie for the overall spend. I think this is maybe what you're referring to, because we budget for obviously for payroll costs when the county adopts the budget. But one of the things that is a very important dynamic there is that most county employees' payroll costs are funded with restricted funding sources such as grants, federal and state allocations, fees, and other outside revenues. That's how we balance the budget. However, when employees get assigned to work at vaccination or testing sites or other pandemic response assignments, we cannot charge these restricted funding sources for their payroll costs. And we can only claim FEMA for a portion of it. And so at this point, that does leave a gap with unfunded costs there, despite the budget because of this use of resources. And right now, the American Rescue Plan allocation is going to be the only available funding source that we're aware of for much of these costs. And so this is part of the overall challenge and one of the reasons why there's so much effort to graphically display this.
I thought FEMA covers 100% of particularly direct vaccination costs.
This is Martha Wapensky. It covers 100%. There's no guarantee that it covers 100% after December 31st of this year. However, they may not accept our claims. They may.
Well, it doesn't.
Yeah.
Let me jump in here. FEMA does not cover costs for employees who are repurposed. So with repurposing, we actually lose revenue from special sources. So like, for example, health and hospital, social services,
Right,
other departments.
The funds aren't fungible, so we didn't receive those, so we cannot redirect them.
Right, and FEMA won't pay for them. So basically, I think to try to give you a general idea of why we need to think about paying ourselves back is because the cash that we draw down was budgeted, but previously the board had authorized that for general purposes. So if you don't pay yourself back with some amount of funding, means that future going forward, you lose services. So like, for example, we made contributions to our special fund and we're expecting to come back again in mid-year with reallocations because we spent down that our pandemic fund. So there's only one lump sum.
So if we are allocating ARPA funds to COVID expenses, which I'm still struggling with, that of course explicitly disqualifies any of those expenses from FEMA reimbursement. How do we have certainty that some of those costs that you described are not going to be reimbursable by FEMA? If there's even a chance, shouldn't we be trying that first and not risking allocating ARPA funds and then disqualifying them from even potentially getting FEMA dollars back?
Yes, that's why we're not asking you today to allocate funding. We're just giving you the opportunity to give us direction, because you're exactly right. We don't want to allocate any funds from ARPA to services that could be paid for by FEMA. So we're just giving you a sense of what the priorities, we think the priorities should be, and looking for direction from you.
Okay, with what you've set forth today, I do want to make clear that I strongly support the administration's recommendation for hazard pay for our entire workforce. I think that's absolutely the appropriate direction. So thank you for including that in the plan. The estimate recovery from FEMA, I know we don't have a number yet, but in the tables, it's still showing as 0. And I'd like for the board to get an off-agenda report that really substantiates the need to backfill expenses that appeared in the balanced budget and that makes a thoughtful estimate regarding recovery from FEMA. I think the details are really important so that the board has a clear idea really of what funds the administration wants to claim from the ARPA pot and which remain for our further consideration. I'm not sure that's broken out clearly enough, or somebody explained to me how it's already there.
We can try to make it more clear. Gave it our best shot, but we'll try again.
Thank you. I also just want to make a general statement that we must be strategic with our ARPA investments. We have an unprecedented opportunity to build back better with a focus on equity and sustainable system redesigns. I absolutely support the SVC and equity agenda and the real coalition framework for ARPA investments. And just to give this a context and why I'm thinking about this, we spend a lot of money and time trying to remediate problems or compensate for traumas that really should have been prevented in the first place. And I think currently too many of our systems aren't designed to intervene early enough to preclude those later challenges, and we end up trying to fix a bunch of undesired outcomes that maybe didn't have to happen in the first place. And we have the power to change our systems to promote equity and healing, to address the life-changing needs of our community. And I think the flip side of not doing that is that we will have to continue to invest in supporting people who are unhoused, who are struggling with mental and behavioral illnesses, who are coming in contact with the criminal legal system, and a host of other issues that by preventative early intervention, I think we can avoid. And what I would hope for, and I'll look to my colleagues here for the next step for all of us, is to share our priorities, much as we did with the budget, make clear where we are already in agreement, where we might have some differences and opportunities for conversation, and continue to engage the community so that within a couple of months from now, we truly have a well thought out participatory plan to say, this is where our dollars are going, and we are here to make a difference.
Thank you.
Thanks.
Supervisor Chavez.
Thank you. I'm going to start with item 27, and I just want to say, as it relates to the door-to-door work, that what I'm hoping that we take a look at is what we're learning from that door-to-door work, as Brian, as you pointed out, and then potentially looking at whether or not we need to expand that service. Like, I don't think we should contract it. I know we needed to because some of our partners were having a hard time maintaining at the same speed and precedent. But I am very interested in us taking a look at this particular body of work, because I think it has multiple outcomes. It's getting the public access to services. It's giving someone a good paying job. And it's also on-the-job training. And to be frank with you, I think we spend an awful lot on training that I don't know how beneficial it is and how much more beneficial it is to actually have more on-the-job work. So that's why I just took that off of consent, because I just wanted to make that comment. As it relates to item 10, the COVID recovery framework, I think one of the challenges is that it's hard for me to know from that report how proactive we are and what the actual work of the committee is relative to helping us imagine or think about kind of next steps. And so, I mentioned that because I read the report, and I don't think I left with a fulsome framework. And I went online to look at the business website, and it's a collaboration of of organizations' websites. So I still can't say I know exactly what all of that work is. And and I also really appreciate Margaret and Martha et al. That this is unprecedented for us. So we're learning while we're doing. But I want to better understand the outcomes that we expect from the recovery framework we're using so that I better understand what goes into your bucket of work and maybe what goes into other parts of the county. And then, you know, as it relates to the report, the ARPA report, you know, one thing, Dr. Smith, that I thought was kind of interesting, and I thought it was important to hear 10 and 28 together, because I was having a difficult time understanding, does 10 feed into the approach taken with 28? You know, did that help shape the what you presented? And one point I wanted to make is that as part of the item 10 and item 28, there's lists of these actions that we took that where I think we invested money or we invested in infrastructure, and it's not consistently reported out. So it's hard to know, Dr. Smith, if what you're saying is, for example, I'll use just something that I thought was really important, and that was our investment in broadband. You know, we did a Band-Aid, really. We gave kids laptops and hotspots, but now the state's doing this incredible work around, you know, they're putting money into local government so we can build out that middle mile so kids actually won't have to take their little computers to Taco Bell to go do their homework. And what I'm having a hard time understanding is how is the work that another part of the organization is doing on broadband connected to the COVID recovery work, because we, you know, from an investment perspective, we've already made a local investment, but the state's going to make some resources available to local government. So how does that get it together?
Well, I think it's a good question. I'm trying to figure out how I can frame this. Number 10 is response to compliance with our standard NIMS and SIMS emergency activation process. And part of that NIMS protocol is a recovery plan, and that's what we've been running, and that's what Martha and Margaret have been focusing on, and basically following the playbook, even though, as you say, we've never been here before, so the playbook had to be changed a little bit. But that's completely different, although related to ARPA and the board's initiatives for recovery, and the rest and the other governmental initiatives. So we try to coordinate the efforts by communicating between the different groups, and we have people who are in multiple different groups, but it's not a model where the NIMS and SIMS report process generates the ARPA funding proposals, or the ARPA funding proposals are generating the NIMS and SIMS proposals. And we're always, you know, at the whim of the state and the feds. So we try to coordinate it, but it's sort of different purposes fundamentally. I don't know if that made any sense to you at all.
It does, Dr. Smith. That was actually really helpful. And you know, one thing that I think that there may be value in us thinking a little bit about, and that is whether or not the NIMS and SIMS process could actually be not just kind of what we have to do for the state, but whether or not that's a framework for us to use, particularly as it relates to the business community. And so anyway, I'll put that out there for you to think about. And then as it relates to the ARPA funds, I think, you know, there, like I said, I want to go back and just say there's some really significant investments we've made that the state and federal government are now going to be investing in really pretty magnificent ways. And if I think about broadband just as an example, you know, broadband is it's very braided in its outcome for us locally, because it allows for people who have you know, who want to do telemedicine, for school, to be able to work from home, to get a job. I mean, it fits into our climate change goals. I mean, it's really kind of got the whole package. And so what I would like is you bring back the funding strategies, that we take a look at those elements that we invested in, that the state and federal government, and I appreciate your point that we thought the federal government would be done by now, but but once we know more, that we can marry the state and federal investments into our local programming. Because, you know, again, as I think about equity, broadband to me is so core to that. It's like water, electricity, broadband. You know, if you don't have it, it just harms, and it really harms poor families. It harms everybody, but it harms poor families pretty dramatically. So I think that we started down the path as we responded to COVID-19, actually doing what the advocates are telling us to, because we got feedback from them, what was happening on the ground. We funded that. Some of it maybe some of it we would stop funding. Others of it, we are going to need to think very critically about whether or not we keep funding it. And some of it, I'm using broadband as an example, but, you know, because we've had some board policy action around that. But, you know, if we think about period products, like we funded our partners to help us make sure we got period products out. But then we took a further action to mirror some of the state communication around making sure that there are free period products in all public bathrooms that we own and operate. That's a big policy shift. That is not big maybe, but it's important. It's an important policy shift. And I think there are lots of those threads through what we're already doing. And I think then, therefore, we could prioritize that which we should keep doing, think about those areas that maybe we shouldn't be, you know, we shouldn't continue post-COVID, and then be able to look at that in your equity framework. And I do just want to acknowledge that the public, you know, said, look, we didn't talk about race or equity in these documents. I think that's important. We need to do that. I think one of the things we also need to do is share more and more statistics, the programs that we're doing now, who and how they help. Because I think people would be stunned to know, when you look at the hospital, we talk about the hospital from a budgetary perspective, but we should look at that relative to income levels and all of that, because and race, because what we understand as a county is that health and all policy is really how we make significant change. People having access to health insurance and health care, that's game changing for most families. We are investing in that. We should be able to explain that in a way that uses that equity framework. That's just one example of many I could think of. So anyway, thank you for letting me weigh in on that. I really appreciate the work. And Margaret et al., thank you for doing something you've never probably done before, and we appreciate it.
All right, thank you all very much. With that, we're going to consider, oops, Supervisor Ellenberg, your hand is raised.
It is. Very briefly, I want to support and amplify what Supervisor Chavez said about really trying to have a sense of the whole here. With the the disaster recovery report that was given today, which I very much appreciated, really focused on the disaster recovery aspect. And Dr. Smith at FGOC, you talked about disaster recovery and community recovery and county reconstitution. And I think that it really is important for us to hear on this this cadence that we're getting the reports back, rather than one item at a time, to really have a holistic update on all three each time and how they relate to each other. And I thought broadband was a good example to bring in, but to me, it's as important, if not more so, to really understand the big picture and the high level connectivity as it is to get the detailed reports back on the particular committees. So as I think that's in line, Supervisor Chavez, with what you were asking for, and I just wanted to appreciate and agree.
Okay, we've got appreciation and agreement, which is always a good way to end. We're now going to move on, and members, the way things are lining up, it's looking like about a 7:30 close tonight with a half-hour lunch break, dinner break. So I'm guessing right now around 6 o'clock. We just completed items number 10, 27, and 28. We're now going to move to item 11. And just so you know what's in store, we've got 11, and perhaps the referrals will go faster than I think, which would be just fine. But we have 11, 13, 14, 15, 16, 17, 20, 21, 22, 23, 26, 29. We have 12 more items.
President Wasserman,
Yes.
I believe 26 was held during consent, but otherwise that's what I have.
Wonderful. 26 held during consent. Thank you very much for that, Jess. I appreciate it. And we'll see. We'll see what we do right here. All right, we move on to item 11, which is a referral by Supervisor Chavez. Take it away.
Thank you. This is a referral that came to us as part of the Unhoused Task Force based on feedback that we got from some cities that were feeling like they were doing a lot more relative to ELI housing. And so this is really a referral to staff to take a look at whether or not there are any policies or procedures we could put in place to make sure that we're sharing the ELI housing across the county.
Thank you for that motion. Do I hear a second? Second by Supervisor Simidian. Do I have any discussion?
No. I had a question, Mr. Chairman. Sorry.
Go right ahead.
We are looking at item number 11, yes?
Yes.
And I am just, the reason I asked that this item stay on the agenda, not go on consent, is I'm fine with the recommended action and happy to support it. But then the very last line of the referral says this referral recommends that the county develop a policy to avoid over concentration of its funding of and operation of shelters and of permanent supportive housing. I don't actually see that in the recommended action. So if we can be clear that the recommended action stands on its own and does not provide direction that is made as passing reference in the referral, I'll be an aye vote.
I'm with you. Thank you.
Yeah, I mean, let me read the recommendation into the record and see just to be clear about what it is. We would approve an referral to, sorry, I apologize. Approve referral to County Council to report to the board on November 2nd with options for consideration relating to supporting countywide equitable geographic distribution of emergency and transitional housing and supportive housing to address homelessness. So you're right, I am asking staff to come back with options for our consideration.
Thank you. And I'm happy to be a second on that with the explicit understanding, and I'm asking the clerk to be precise about this, that does not necessarily recommend the development of a policy as noted later in the referral.
Correct. The motion and the second is to approve the recommendation as read by Supervisor Chavez.
I'm a second.
Thank you. We have no speakers. I see no other hands. Jess, a roll call vote, please.
Supervisor Lee?
Aye.
Supervisor Chavez?
Yes.
Supervisor Simidian?
Aye.
Vice President Ellenberg?
Yes.
President Wasserman, I'm sorry, I didn't hear anything.
I'm sorry, I didn't hear you. Yes.
Oh.
Yes, I'm a yes.
Sorry, my microphone today.
All right. That takes us to item number 13, and Jess, stay on top. All right, item number 13 is a motion by Supervisor Chavez. Referral.
Yes, and this is to approve a referral to administration to come back in 45 days with options for consideration relating to the allocation of $250,000 to the School of Arts and Culture for consultant services necessary to undertake affordable housing and community development and protection from displacement and gentrification along Alum Rock Avenue or Alum Rock Corridor and King Road.
And I'm going to take that as a motion.
Yes.
Thank you. I'm looking for a second. This is item 13. A second by Supervisor Simidian? Or your
No.
hand raised?
No.
Your hand is
Sorry.
raised because you have a question again. And you want to make
No,
sure
I'll simply lower my hand. Thank you, Mr. Chairman.
your hand is lowered.
And so maybe I'll just explain to my colleagues what this is. You may recall that about 4 or 5 years ago, we made resources available to community colleges who were looking at how to utilize their own land for affordable housing. And many of them did not have the startup resources to hire the appropriate consulting services to help position them to be able to make appropriate land acquisitions, or frankly, even determine whether or not affordable housing was appropriate in the areas they were looking. So this would give the School of Arts and Culture the ability to do that work near and proximate to the property they already own. And I would like to ask for a second.
I'll second it, at least for purpose of discussion.
All right, Supervisor Lee, you've got a second. Go ahead.
Yes, thank you.
Wait.
Yeah, so I just have a few questions to go through this one, if my Supervisor Chavez. The referral states that the School of Arts and Culture is the permanent operator. Now, the school has a long-term agreement to operate a facility on behalf of the city of San Jose. Are we going to also include the city of San Jose to be involved in this community development?
Well, that would be partly why they need consulting services, because they need support working with the city and with other partners. They don't have that technical support right now. So it's that, but my assumption would be that whoever they hired would absolutely help them understand how to do that in partnership with the city of San Jose, since they would be the permitting agency.
Okay. Now, do we know whether the plaza land is within the scope of what we are asking the consultant to look at, and what agreement does the School of Arts and Culture hold with the city?
So I see them on the line too, but it's not for development of the site that they're on. It's development for sites that are contiguous to the property they're on right now. And perhaps, you raise a good point. I mean, maybe based on the discussions that they have with the city of San Jose, maybe that's a reuse of a parking lot, but really what they need is help to be able to have those discussions robustly with the city.
Okay. One also, sorry. The other question I have is regarding the consultant to do the work, and why did you just pick the School of Arts and Culture and not go through the RFP process?
Because when we have partners that have the capacity or the interest or have some resource that allows them to be able to start to do development, they often will come to the county, for example, for Measure A resources. We do NOFAs, but we also make resources available for those who have access to land or who could be making deals in the communities they operate in. The reason I was particularly interested in the approach that the School of Arts and Culture was taking is because one of their core values is to do anti-displacement work. So any development they would do wouldn't push out the businesses that are there now or the people that are there now that live there. It would actually be an opportunity to do what we were talking about earlier in terms of building wealth and resources for a particular low-income community without displacement. That's what their strategy overall is.
Right. So I guess I definitely like the concept of the referral. It's very, very well thought out. And one of the questions I have is, since we have a lot of unknowns here at this point regarding the dollar amount and how much it will cost to do this, would you accept the friendly amendment to the motion to direct administration to report back to the board in, say, 45 days with the options to undertake affordable housing and community development around the Alum Rock corridor and King Road, and also to connect with the city of San Jose before coming back to the board?
So is the discussion with the city of San Jose with our staff?
Right, yeah, so,
Yeah,
so
that's
that
totally fine. I mean, I would expect,
right.
yeah, I would expect them to do that.
And then for the time being, not to put any funding aside for now, and then when it comes back, then we could go ahead and approve all that at that time. Would that be okay?
So, yeah, so what the referral actually asked the staff to come back with a source of funds. So my expectation they would come back with a source of funds concurrent to answering your questions with the city, because then you could decide whether or not you wanted to act or not act. I wouldn't want to send,
yeah, so we're not committing anything today, right? That's what I'm saying. Yeah, okay, yeah, great, thank you.
Thank you. I'm not quite sure I understood how the motion stands right now. I thought I heard Supervisor Lee say nothing today, and I thought I heard Supervisor Chavez say how to come back with the 250.
It's a referral, yeah. So Mike, so it's a referral for staff to come back to us in 45 days either way. What I understood Supervisor Lee to be asking was to make sure that our staff talks with the city of San Jose about the viability or the partnership in this area. So we're doing this concurrent with the city of San Jose. And I was saying yes to that. Because if the staff came back and said, here's where we could get the money, but they're not collaborating with the city of San Jose and we have concerns, then we could take the action in 45 days.
Right.
Okay, I'll go to Supervisor Simidian now, and then we've got a couple of speakers.
Thank you. I'm equally unclear, Mr. Chairman, about the dollar issue here. I'm okay moving this forward if there is no commitment to funding, no direction as to funding, and a request for a report back on how best to proceed. But I don't think we have enough information today to say we want to authorize $250,000 in funding for consultants until we simply refer this to our our Office of Supportive Housing and let them come back with some notion. I would have been perfectly fine with a motion to simply refer the matter to OSH for consideration and a report back. But I feel like we've got a financial commitment here, initially explicit, now maybe implicit, but still sort of in there. So I guess my question is, can we simply remove reference to any specific dollar amount and ask staff to come back 45 days from now and tell us what they think?
You mean what they think the cost would be, Supervisor Simidian?
No, I am not yet persuaded, Supervisor, that there is that this is an appropriate or timely allocation of of funds for someone to pay a consulting fee. If we're going to go down this path, does that mean that any and every contemplation of a project from a board member should be the basis of $250,000 in consulting fees for worthy community groups who want to go pursue it? I'm just not there yet.
Okay. Do you want to hold comments now? We'll hear from the public, then come back to us. Or Supervisor, is that fine with you, Supervisor?
I guess my question is of Supervisor Lee as to what his friendly amendment consisted of. He's the friendliest amender today among us, so I want to make sure I understand what his friendly amendment was.
Certainly, Supervisor Lee.
Sure. I think the friendly amendment kind of dealt with the concern of Supervisor Simidian in the sense that number one, we're not voting for any money today at all, right? This is something that's going to come back to us from the staff report in this 45 days, at which point the dollar amount would be mentioned, and based on the investigation and the collaboration with all the different partners, including the city of San Jose. So at that point, I think we could have a more detailed discussion if the amount is too much or too little. And at that point, I think we'll know whether that funds will be expended as well. So I'm comfortable as the motion is right now, since we're not really committed to any funds at this moment. Thank you.
And through the chair, just again to understand, does that presuppose that our board is directing the payment of some consulting fees in some amount? Or is it possible that when the staff comes back, they'll say that's really not the best way to consider the development opportunities in this area?
My expectation is the staff will come back with their best professional opinion about all of that, Supervisor Simidian, whether it's the cost or the approach.
With no direction as to how to.
Right. I set out a framework in partnership with the organization, understanding what they understand today, but they haven't had a chance to work with our professional staff.
Thank you.
Okay, let's hear from our public. Jess?
Our first speaker is Gabriel Hernandez. I've unmuted you. Peggy,
Can you hear me okay?
Just a minute, Gabriel. We need to get an email off. Thank you. Yes, we can, Gabriel. Go right ahead. If Jesse.
Sorry, let's get the timer up. Peggy, that was just the wrong window.
One sec, Gabriel. No. Oh.
I can never be timed, you know. There we go. Okay, just a minute. Okay. So I just wanted to make sure, my name is Gabriel Hernandez, the director with the Si Se Puede Collective. First, I just wanted to make sure that you all are in receipt of the various letters that we sent. I think operations may have just attached them to item 15 and we wanted them attached to 13, 14, and 15. So hoping that that'll happen. And then again, the 5 organizations, because of not only the crisis, but the work that we have been doing, we are looking at every and any means of figuring out how to support the families, you know, whether it's our mobility labs, whether it's, you know, developing COPA policies, and now even, yes, we're looking at developing community land trust or other kinds of ways in which, you know, we can support the community and address not only the housing issues, but the displacement that we're facing with gentrification. And so we are going to be coming with a number of different ways of.
Our next speaker is Jessica Paz Cedillos. I've unmuted you. You'll have 1 minute to speak. Please go ahead.
You got it. My name is Jessica Pasadillos. I'm the Executive Director of the School of Arts and Culture. And if you all have additional questions, I am here. So on behalf of the Si Se Puede Collective, the proposal is to invest in consultant services in order to determine the feasibility of development projects in East San Jose, and in particular on the Alum Rock Corridor and King Road. So when you think about the economic divide in Silicon Valley, when you think about that Mayfair is in advanced stages of gentrification, when you think about the county schools as it relates to affordable housing, in addition to the city's goals as it relates to affordable housing, this is just the natural next step, right? Engaging with professionals who can equip us with the strategy and also the steps to move forward in order to take care of our families, which are being displaced in this community.
Thank you.
Our next speaker is Alex Shore. I've unmuted you. Please go ahead.
Hey, this is Alex Shore, Executive Director of Catalyze SV. It's funny, I'm toggling between the San Jose City Council and y'all today, and they have an item 8.1 that deals with some overlapping issues. And forgive me if I missed you all talking about this, but they're talking about allocating 1.25 outreach to tenants and landlords on the eviction moratorium, $1 million for the capacity building for nonprofit organizations, $500,000 for a preservation pilot program, and $250K for land trust pre-development work. So I don't know if the county's looked at that, but maybe it would be helpful to, because I think there are cross purposes here and good opportunities for collaboration. The Si Se Puede Collective is a fantastic group of folks, would be good to work on community development. It looks like where the city's structuring this kind of concept is they're putting out the money and then doing an RFP kind of process where they're then bringing in nonprofits to see who might be the right fit. So just sharing in case that's helpful to the board.
Thank you.
Our next speaker is Sparky Harlan. I've unmuted you. Please go ahead.
I wasn't going to speak to this, but this is near and dear to my heart because I think this is allowing community CBOs to really bring in the experts to help them negotiate these deals with affordable housing developers. I can't tell you how many times Bill Wilson Center was approached to do a project and was taken advantage of and kind of dumped. We were courted, and then basically as soon as the other provider got the money, they left us to the side. So I often consult with people and say, this is how you make deals so you aren't taken advantage of. So I really support this effort by the supervisor because this is a way to empower these agencies on how to negotiate to take care of their community. So I hope you will support this in the long term.
Thank you.
Next speaker is Rebecca Armendariz. You'll have 1 minute to speak. Please go ahead.
Thank you. This is Rebecca Armendariz, and today I'm calling on behalf of CARAS, the Community Agency for Resources Advocacy and Service of Gilroy. I'm calling in support of item 15. As you all know, the impact of COVID on our community in Gilroy was just as bad as Eastside San Jose. It wasn't surprising, but it was shocking to know, to those of us who live and grew up in these areas. We know that the historical and systemic inequities that we've struggled against for generations would manifest themselves as higher infection and morbidity rates, as well as lesser vaccination rates. For too long, our governments have neglected to address or adequately fund the necessary attention or resources needed by our communities. A community development corporation will be a much needed investment to begin to help level this playing field that has been out of balance for so long. Please support this referral. Thank you.
That concludes public comment.
Thank you. I appreciate that. I'll start back with Supervisor Chavez.
Yeah, I wanted to see if there are any other questions for me.
Yes, thank you. I wanted to get clarification between you and the motion maker. As I was looking at this and hearing what Supervisor Lee was saying, I was looking at that first sentence and revised it slightly to approve referral to administration to report to the board in 45 days with options for consideration relating to an allocation of some amount to the School of Arts and Culture for consultant services. And I was looking forward to administration bringing back a recommendation of a dollar amount that was appropriate and to be used how and from what source. And that's
if that would get this across the finish line, I think our staffs just need to be able to work with the group. That's fine by me. And
okay.
And yeah, that's fine. And I think that's not what Supervisor Lee was asking for, but that's certainly what Supervisor Simitian was asking for.
Okay, Supervisor Lee, are you okay with that?
Yes.
Okay. Okay, then that's what I would suggest, and that's okay to incorporate Supervisor Chavez as your motion. And
Yeah, I think
Supervisor
yes.
Lee?
Yes, and I just want to encourage the staff that this really should be 45 days because there's a lot happening on that community, which is why they're asking for urgent support relative to displacement.
Gotcha. And in my recommendation, I left that in. So
I saw that. Thank you, Supervisor Wasserman. I was really just talking to the staff there, not you.
Oh, sorry. They're all nodding. Okay. Then Jess, would you please have a roll call vote for this item number 13?
Supervisor Lee?
Aye.
Supervisor Chavez?
Yes.
Supervisor Simitian?
Abstain.
Oh my gosh, all that work.
Was that abstain?
It was.
Thank you. Vice President Ellenberg?
Yes.
Yes. Oh, there we go. Yes, to me. Yes, for me as well.
Apologies, I'm not sure what's going on with my microphone today.
No problem. No problem for us anyway. All right, item number 14, Supervisor Chavez.
Thank you. Item number 14, my colleagues may remember that we have a program that exists now. It's a pilot program that exists now that we use some state and federal funds and other funds to be able to expand access to health insurance for all people in our community. And one of the opportunities that came forward is that the Si Se Puede Collective has pulled together this very dynamic employment program that, you know, frankly, it was going on before COVID, but has really become even more clear post-COVID. And one of the opportunities was to take a look at whether or not it was possible for us to use our BHP healthcare program to be able to expand it to cover these workers, particularly those that are starting their own businesses. And so this is a request for, and I'll just read this, to consider recommendations relating to the expansion of our healthcare coverage to 100 recently employed or self-employed members of the collective and its related business ownership and our Corredos program. Those are the folks that are going door to door. possible action to approve referral to administration to report to the board through the Health and Hospital Committee in 90 days or less, with options for consideration relating to the expansion of health coverage to 100 individuals on a pilot basis through the creation of the new healthcare coverage product, or to increase the primary care access program, that's PCAP, threshold to 400% of the federal poverty level, or another percentage determined to be appropriate by administration. And B, to approve referral to county council to report to the board through the Health and Hospital Committee or through an off-agenda report, with options for consideration relating to any necessary steps for Valley Health Plan to create and implement an additional healthcare coverage product that might benefit this community. And that's my motion.
Motion by Chavez. We have a hand raised. Supervisor Smidian.
Thank you. I just want to offer a substitute motion, which is to table the matter until such time as the Health and Hospital Committee gets the report back from staff on the PCAP program and potential for expansion. And I share Supervisor Chavez's interest in expanding eligibility for the PCAP program. And I share her concern as expressed in the memo about the current income thresholds. This is an issue we have been working on in committee. We have this item agendized for our next committee meeting, which I believe is the 22nd of September. And I actually think it might be more expeditious if we simply take that report from staff at the time and see where we are then, and then get a recommendation from the committee, which Supervisor Lee and I sit on, back to the board. Nothing precludes us from having this larger set of discussions at the time, but I would prefer that we deal with PCAP and the need in a more comprehensive way. Okay. Excuse me, I think there we go, in a more comprehensive way. And it, as I say, it's coming up in committee anyway in just the next few weeks as part of our review of the pilot. So I think that's both timely. I also candidly would have concerns about any member of our board picking 100 folks associated with any nonprofit in their district doing good work as a beneficiary of a program expansion. I don't for a minute doubt the good work and the importance of the work, but I do think we have to be a little careful on that front as well. So I'm going to move to table and with a direction to the Health and Hospital Committee to report back on PCAP expansion with a recommendation following its meeting on September 22nd, if I can get a second.
Thank you. So we've got a substitute motion, I think is the appropriate word, and looking for a second.
I'll second that. It seems to make sense to me if it's already happening in committee. I'm very interested in learning and understanding more. I think setting this up as a pilot program makes a lot of sense. I don't know that, I don't understand the details enough of whether they should actually fall under county employee status or there's another product, but I'm glad that the Health and Hospital Committee is already looking at this issue. Thanks.
Thank you. So we have a second. I will express concerns I have too, and I appreciate the last couple of sentences you just stated, Vice President Ellenberg. I've gone through 11 years with IHSS and had concerns when I saw this and not knowing open-ended and what limitations. So I appreciate the committee looking at it and then coming back to the board with thoughts and recommendations. Supervisor Lee, your hand is raised.
Yes, thank you. I just want to.
Supervisor Chavez.
Yeah, I just wanted to say one thing is that I would have appreciated if this had been deferred to the committee, but I am concerned about tabling it. And you know, and just to be clear, I think every one of us brings forward initiatives and does expansions. We do it during the year and for all kinds of things. We have made direct recommendations. Supervisor Lee did that recently with a program for expanding work that we're doing for historical, you know, doing a history project with 2 specific partners. So, you know, like I said, I would have appreciated this being referred to the committee, but tabling this effort is is really impacting the staff's ability to determine whether or not there's a possible partnership here with a very specific group of people in a very specifically impacted area that we just spent a bunch of time talking about equity and how we were going to do investments in Eastside community. So, so I'm not going to support the motion, but I do, I just wanted to share with my colleagues why that feels frustrating to me and disappointing. I'm sorry, Supervisor Lee, I didn't mean to jump in there.
Supervisor Lee.
Thank you. I was actually going to ask a question on the procedure regarding referral versus tabling with our parliamentarian, the difference of that, and whether or not it makes more sense. Since we are going to deal with the PCAP issue, HXC, and if this should be referred to HXC as well, then we could deal with both. So question to James.
James.
The board can do either. So those are separate motions. The board could refer the item to committee. The board can also table the item until the committee has reported back to the board and have it come back at that meeting, which is the current motion on the floor. Those are two different actions. They may have ultimately a similar effect, but those are technically two different procedural actions. They're both available to the board.
So my question is, if it says tabled instead of referral, can HXC still hear this item, or
can what? Supervisor Lee, I missed what you said.
Sure. If as the motion currently says tabled, does it mean that HXC will not be able to hear this item? Because I certainly think it might be worthwhile to do that. So if referral will be able to accomplish that goal.
Supervisor Simidian, what directions?
I think the challenge here is that there are two different, albeit related, proposals in A and B. One deals with PCAP, and my goal is simply to have any discussion about PCAP actually happen sooner rather than later. So rather than 90 days, we'll be taking this item up in 3 weeks. And I think we would be better off if we had the conversation in a context that considered the potential for expansion of the program, which the referral seems to support, on a county-wide basis, rather than limited to 100 individuals. And as I said earlier, I'm hoping that we can get there. I raised this issue back in 2019 in my State of the County remarks that year, and we've been working on the issue ever since in the committee. We have a pilot program already in place, and so the question teed up for the committee in 3 weeks is it time now to grow from what has historically been a pilot project? And I think that's a righteous question that both Supervisor Chavez and I are trying to get to. Now, that's a little different than the question raised in B, which is, should Valley Health Plan create a healthcare product, an insurance product for folks in the CISA Collective, and that raises a different set of issues. So, and that goes to the.
Thank you. So I'm sorry, I thought you had paused there for a moment. So what is the motion that you're making?
I made a motion to table the action. There wasn't actually a second to the original motion, I believe.
Correct.
So we have only the recommended action contained in item 14, and I was simply asking that we table the item until such time as we talk about it and talk about these related issues in committee. And tabling does not mean a member cannot bring it back at some point in the future if they wish to.
Okay, so tabling possible actions A and B. Vice President Ellenberg.
My understanding is that this is going to come to HHC very rapidly, and that we're not talking about a very long delay. I would be interested when the issue is taken up in committee to have an understanding of the PCAP expansion in general, need for eligibility criteria for a pilot. I think that the equity goal is actually best achieved if we make this much broader. I'm also concerned about having this apply to just a narrow group of employees. We want to make sure that we're not creating our own exclusionary program. So again, just reiterating support for the discussion to happen in committee with hopes that we come back with some recommendations that can really provide significant coverage to this pocket of undocumented adults, which is really a critical population.
Okay, so we're going to go now to 5 public speakers, and we'll come back to our board. Jess.
Our first speaker is Victoria Partida. If you'll just allow us to get a 1-minute timer up. And Victoria, please go ahead. You'll have 1 minute.
Hi, good afternoon, supervisors. My name is Victoria Partida. I am the health coverage lead at Community Health Partnership. The proposal under consideration would make great strides in improving access to healthcare coverage to those who need coverage but simply can't afford it. This will move us closer to creating a sustainable system of care in partnership with the County of Santa Clara. Therefore, we here at Community Health Partnership strongly support expanding access to healthcare coverage and welcome the opportunity to play a role in piloting this program, whether through a new coverage product or through an expansion of the existing PCAP system. Making healthcare coverage accessible to more people makes sense. Thank you.
Thank you.
Our next speaker is Victor Vasquez. You'll have 1 minute to speak. Please go ahead.
Good evening. So I just I'm concerned a little bit about the way that it's being framed, and maybe it is because how it's written on this agenda board, but we're talking about 100 Santa Clara residents, families working in areas heavily impacted by COVID, you know that, business owners who are risking their lives every day to make sure that our community has testing, educational materials, going on the door-to-door every day to make sure that we are fighting COVID, and death rates are lower. But I want to make sure to remind that we're speaking about 100 individuals who work in an area that also was destroyed by development. Over 20 businesses closed down, even in the corridor, and that expansion of these programs create opportunities for them to have safety, have access to healthcare, and at the end of the day, continue to do the work that they're doing. Thank you so much.
Our next speaker is Gabriel. I've unmuted you. Please go ahead.
Yes, Gabriel with the Si Se Puede Collective. I think you should also check, because this morning I believe you put 14 on consent, so you might want to take it off. But in terms of the proposal, it's actually an expansion, and I think Supervisor Simidian raised that. If the intent is to expand that even beyond 100, kudos, and let's do that. I think the other proposal is, if it doesn't work in one, maybe we can work on the other through IHSS. Any which way, in terms of dealing again with the crisis that we're looking at, we have these families, these women going out, risking their lives, and we're trying to figure out any kind of way to help support them so that they can, address, the risks that they're facing on a daily basis and having some kind of access. So I'm hoping that however you decide to do this, that you expedite it and again, put it in the context of the crisis we're facing right now.
Our next speaker is Dolores Alvarado. Please go ahead.
Good afternoon, everyone. Thank you for your comments, supervisors, particularly Supervisor Chavez and Simidian. I'd like to clarify something for purpose of discussion. Number one, PCAP, you're right, Supervisor Simidian has been around for a while. We've been very active. I believe we have close to 8,000 people enrolled at this point. The pandemic and everything that's happened the last 18 months has brought forth lots of issues that I don't need to repeat. And the way that I read the proposal is that the 100 would be a pilot in the context, at least the way I understand it, of where Mr. Simidian wants to go, and we support that with PCAP. We know that sometimes people fall off PCAP because they make $1 more than $15,000 a year. So think about that. Think about, oops.
Our next speaker is Case Hill. You'll have 1 minute. Please go ahead.
Hi, good evening, Board of Supervisors. My name is Casey Hill, Executive Director of Vaccination, and I request that you support the healthcare pilot program for some of the families recently employed or self-employed members of the Si Se Puede Collective. As the pandemic began to devastate our neighborhoods, our collective has worked to create income opportunities for families that have had little access to stimulus checks, unemployment, and other government support. Through Jobs to Grow, our economic mobility program, we're working to train families to create businesses in childcare and food service. Item 14, the healthcare pilot will support our efforts to ease some of the burden of providing basic needs for these families and reduce their stress over having access to healthcare, which goes a long way to addressing our community's mental health. It will also serve as an important model for a broader future effort. Thank you for your consideration of this item.
Thank you.
Our next speaker is Maribel Montañez. Please go ahead.
Good afternoon. Gardner Health Services supports agenda item 14, the pilot health coverage program to serve 100 current employed or self-employed individuals for which health coverage has not been accessible. It's our hope that the vote against tabling the item tonight is denied and that you move forward during the roll call with the recommendation. We support expanding access to health coverage to those not currently eligible under existing programs. And we see an opportunity in our community and in our community health centers to potentially play a role in piloting this program. Again, Gardner Health Services would respectfully request that the entire board move this item forward and that it is not tabled tonight. Thank you.
That concludes public comment.
Thank you very much, Jess. And Supervisor Lee, your hand is raised.
Yes, thank you, President Wasserman. So I don't know if it's, I've been doing friendly amendment all day, so I'm wondering if I could do one more today, try to make this work, because obviously there's certainly a lot of interest of the proposal.
And Supervisor Lee, this is your friendly amendment to the motion by Supervisor Simidian that you seconded.
Correct.
Okay.
So I would like to ask.
Supervisor Ellenberg seconded it.
Okay, I had that wrong for some reason. Okay, so this is Supervisor Lee. This is your friendly amendment to the motion by Simidian, seconded by Ellenberg.
Right. So my second,
Supervisor Chavez.
So my friendly amendment would be to instead of to refer the part A, 14A, to the Health and Hospital Committee as well during this 3-week period, and so that at least we have a date certain to consider this project moving forward. I think would be if that's amenable to the maker.
Actually, through the chair, if I may respond, I think I like the direction, but I don't think that's the right way to go. What I would be prepared to do is to leave the motion to table in place for A, but have it apply only to A, so that the motion in the recommended action for B, asking County Council to work with Valley Health Plan, could stay live. And again, what I want to try and point out is, as people talk about their concerns about the community and healthcare and equity, we've got 8,000 people already in the quote pilot project. Adding 100 people maybe after 90 days does not appeal to me as much as going to 400% if we can, or 300% if that's what's necessary, countywide, and coming back to the board after our meeting in 3 weeks when this item is already agendized. So, in deference to Supervisor Chavez's desire to have essentially a fallback plan, which might or might not garner board support, I can limit the motion to table to item A, and then she can make the motion for item B if she chooses, and if there's a second support, they could go forward.
Okay, so that's your revised motion, Supervisor Simidian?
If the seconder is amenable, and I think that addresses the concerns that have been raised.
Thank you. Vice President Ellenberg.
Does that address Supervisor Lee, the friendliness that you wanted to incorporate there? If so, I'm happy to second that, to maintain my second.
Yes, yes, it was a nodding. So it's table A and go ahead with B as written, correct?
The motion is to table A.
Yes.
And that's it. And then Supervisor Chavez will lean in. I don't want to quote steal her motion on B, but on A, I simply am suggesting that we act sooner rather than later and more broadly rather than more narrowly.
Okay, so we'll do this in two different motions, if that's okay with you, Supervisor Chavez.
I'm fine with that. I would have a question on the current motion.
Okay, current motion is to table A, made by Simidian, seconded by Ellenberg.
Thank you. And this actually would be a question for Dr. Smith, and mostly just because I'm not aware of this. The discussion that's coming back to Health and Hospital is to re-examine the threshold that's available to the yeah, is that what it is? Is that to re-examine the threshold, that 400% of poverty level, or 300 as Supervisor Smidian referenced?
The proposal coming back to Health and Hospital is to evaluate the current status, give an update on how many members, how successful it is, and consider changes which could include changing the eligibility.
And Dr. Smith, were you all going to be making recommendations to change the eligibility at this meeting?
I don't think I can answer that question right now because I'm not completely up to date with what's coming back yet to Health and Hospital. So I would have to wait till I review that packet.
Thank you.
Is that Supervisor Chavez? I don't want to cut you off. You have more questions?
No, that was, I wanted to actually understand if what was being considered was what was being proposed here.
Okay, so I've got a motion and a second for A. I'm going to ask Jess to call the question, then we're coming back to Supervisor Chavez, presumably to make the motion to approve her original recommendation B. Jess?
Supervisor Lee,
Yes.
Supervisor Chavez,
No.
Supervisor Simidian,
Aye.
Vice President Ellenberg,
Yes.
President Wasserman.
Aye. Now we come back to Supervisor Chavez for a motion, I would presume, as is written in the staff report for item B as in Baker. Is that correct, Supervisor?
Yes, it's my referral, not the staff report, but yes, it would be for item B. That would
I'll
be my-
second it.
I'm
Thank
sorry, whenever I see those white pages, I just think staff report.
I don't know why.
We have a motion, we have a second. Supervisor Simidian.
Sorry, that is a lingering raised hand. My apologies.
Okay, so we've got a motion, Chavez, second, Lee. Jess, roll call vote, please.
Supervisor Lee,
Yes.
Supervisor Chavez,
Yes.
Supervisor Simidian,
Yes.
Vice President Ellenberg,
Yes.
President Wasserman.
Yes, as well. Supervisor Chavez, your next item.
Oh, I have a question, President Wilson.
Yes, Supervisor Lee.
It might just be a dumb question on my part. I just want to make sure. So in 3 weeks, the PCAB issue will be heard by HXC.
I'm sorry, what did you just say?
Yeah, the PCAP issue that we just discussed will be heard at the Health and Hospital Committee in
3 weeks.
Right. And then thereafter, certainly nothing would stop this motion being brought back again, correct?
Health and Hospital Committee will vote on that, bringing it back to the board.
And regarding the 14A, that's something that could be brought back as well.
That's up to the Health and Hospital Committee, but my guess is the odds are very good.
I think that's a different question. I think that's a question for council relative to what the implications of tabling are. But I mean, because you're asking, I don't know, Supervisor Lee, if you're asking on this particular motion or if you were asking on this particular motion, yeah.
Right, it's just a procedure that even though it got tabled, it means that anybody on the board can still bring this issue back in a future date. That's what I'm just trying to confirm.
I don't know the answer to that.
James,
so James, you could please.
James,
That-
can you please confirm that's true?
That's correct, but only after that Health and Hospital Committee meeting. But
Yes.
yes, that's fine. Yeah, thank you, James. Appreciate it.
Thank you. Supervisor Semidian, yes.
And just to be fulsome in disclosure, Mr. Williams, that would presumably require a motion to take up off the table. In other words, once a matter having been laid on the table indefinitely, then a member of the board could move to take the matter up off the table, quote unquote, as a parliamentary prerequisite to actually moving forward. Yes?
That is correct. And in order to comply with the Brown Act, obviously an item will need to be submitted for the agenda. So it's back on an agenda for that motion to be Brown Act compliant.
Thank you, Mr. Chair. Thank you, Mr. Williams.
Thank you, that was helpful.
All right.
All right.
Supervisor Lee, your hand is still raised?
My bad. Sorry.
No
Thank you.
Supervisor Chavez, 45 minutes ago, I mentioned 6 o'clock as a dinner break. We can go with this item now if you wish, or we can hear briefly from Dr. Smith and James Williams and handle their two reports, and then we can adjourn and then come back in 30 minutes. What would you like to do?
What I would like to do is just take 15, and because that's only because it's the same group of people who are engaged in that issue.
Okay, go right ahead.
Thank you. This referral requests administration to return to the board at the second meeting in October with options for consideration relating to the issuance of RFPs for community development corporations for the east side of San Jose and Gilroy, and with the process by which organizations can apply to the county to form community development corporations with step-by-step assistance from the county. CDCs have had a long history of providing benefits to communities in which they reside. My intention with this referral is to assist the east side of San Jose and Gilroy and other high-need communities build community wealth themselves, primarily through affordable housing development. I'm excited for this opportunity these community development corporations can bring to these high-need areas of the county. And with that, I would like to request a second for a motion to ask staff to do this research and bring back options for consideration.
I'll second.
Motion by Chavez, second by Lee. Jess, may we please hear from the speakers or speaker?
Thank you. Our first speaker is B. Beekman. I've unmuted you. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. This item sounds interesting. There's some important work going on in Gilroy right now about the future of affordable housing that also offers as a transit center area. And so this is involving the BTA. And we're kind of at a confusion point in where to go with the future of this project. Do we build the future of this project for single occupancy vehicles? Or do we start to more consider the return of mass transit? And exactly how could we talk about good mass transit practices, maybe not in the next year or two, but within the next decade and into the 2030s, I think we can be talking more hopefully about mass transit ideas again. So that's what this Gilroy affordable housing transit project needs. Good luck how you can talk about all these subjects with the public. And don't forget mixed income ideas, how great they are and how much it offers. Thank you.
Next speaker is Marty Estrada. I've unmuted you. Please go ahead.
Hello, thank you. I support Agenda 15, supporting affordable housing development. My name is Marty Estrada from Caras. I also support Destination Homes letter as well as Rebecca Armendariz from the Gilroy City Council's office regarding affordable housing. We hope that it passes because we desperately need it back in Gilroy. There's a shortage of housing. It's been a shortage of housing for quite some time. And I appreciate the board members to consider passing this resolution. Thank you.
Thank you, Marty.
That concludes public speakers.
Thank you. We're back to Supervisor Chavez. We have a motion. Supervisor Lee is a second. Vice President Ellenberg, looking at you as well. Your hand is raised.
It is.
Yes, go right ahead.
It is, thanks. I really appreciate Supervisor Chavez bringing forward another referral that supports the development of affordable housing in our community. And I want to highlight that this recommendation for a community development corporation is, in my view, exactly the type of reimagining and redesign of the most significant social systems that address the intersectional issues for which our community continually fights. I also believe that this is exactly the type of proposal that should be part of our considerations for one-time ARPA funding. So I'd like to suggest that we include this item in any ARPA funding discussion the board has. This is in order to not preempt the allocation of dollars before we have a comprehensive understanding of how we can maximize the value of every ARPA dollar by strategically investing in our communities, particularly those that have been most dramatically impacted by the pandemic. My other goal here is not only to support the work, but to ensure that our administration has sufficient time to dig into what is really, a brand new body of complicated work and ultimately make the very best decisions moving forward. So I'm wondering if there's some flexibility there on the timing back and on incorporating this with the bigger ARPA discussion.
So definitely, from my perspective, definitely on the timing. Like that's I don't know how long it will take the staff to research that. And they may also come back with options for CDCs that we haven't thought about. So sure. I don't have I don't have a dog in that fight. I do think that as it relates to whether or not it's ARPA or general fund, one of the reasons that I have been nervous about us focusing on ARPA is I think the call, Supervisor Ellenberg, that you've been raising with us is that we should be changing wholesale our overall approaches. Mm-hmm. And ARPA is this big, the county's budget is this big. So I would like to give the staff the flexibility, because the other thing I don't know is what revenue we may want. Frankly, do we want to challenge community foundations to match us? I mean, there's just a lot of pieces to it, but I agree the timing should absolutely be flexible.
Then I'm happy with that response and very glad to support it.
Thank you.
Thank you. And Dr. Smith, I'm going to direct this comment to you from me. It's simply a heads up. Supervisor Supervisor Chavez, it has nothing to do with your referral. It just has to do with, I think, this being the last referral on the agenda for tonight. Dr. Smith, I'm going to be bringing forward a referral that ties into 11 years ago when I came here. And I walked down the aisle and saw all those tax refunds, property tax refunds waiting to be processed. And when I brought that up, the end result was bringing in extra personnel on a part-time basis to clear the calendar, if you will, and get all the taxpayers their money back in a reasonable amount of time. To my knowledge, we have 150 plus referrals on the docket. I think we added 6 or 8 more to that tonight. The referral I'm going to bring back to you is some sort of looking into some sort of way to prioritize referrals and perhaps, if necessary, hire additional personnel to do the research to bring back the referrals. We've given you a half a dozen more referrals today, all with dates that we'd like them brought back on. There's 150 other referrals that have dates that are supposed to be brought back in the next 3 to 4 months. I don't know what gets pushed back. I don't know that we consider these referrals more important than referrals from 2 weeks ago or from 2 months ago. But I just wanted to give you a heads up that I'm going to come back and say, we can't just have this backlog keep growing. We can't just presume any new referral is more important than any old referral. That's just my heads up to you. I'll be supporting this motion as well. We've heard from the public. We have a motion. We have a second. I do have Supervisor Ellenberg and Chavez's hands still raised.
Oh, sorry. Thank you.
Okay, so those are down. And Jess, I've got Victor's hand raised on my screen. If you can handle that.
I'm sorry.
Okay. And Jess, if you can please call for the question.
Supervisor Lee? I'm sorry, I didn't hear anything. I'm not
Oh,
sure if that was
aye,
my mic.
I'm sorry.
He said aye.
Supervisor Chavez,
Yes.
Supervisor Semidion,
Aye.
Vice President Ellenberg,
Yes.
President Wasserman.
Yes. And Dr. Smith and James, am I accurate that you could each give your report in a minute each?
Yeah, mine's less than a minute. I have nothing to say that hasn't been discussed already.
Thank you. That concludes item number 20. James?
And likewise, there were no reportable actions taken at the closed session meeting of August 30th, 2021, and that concludes my report.
Thank you. Jess, if you'll just confirm with me, we're going to break for dinner now for 30, but we have items 16, 17, 22, 23, and 29.
That's what I have.
Okay, thank you all very much. Board, without no objection, I don't see any. Let's break for dinner. Let's get back here at 6:30 and get on this thing. Thank you very much.
Recording stopped. Recording in progress.
Thank you very much. We need Supervisor Chavez, that'll make 5. There's our district attorney, there's Supervisor Chavez. And I'll tell you, that was the dinner of champions, raviolis and M&M chasers. All right.
You know how to live.
Absolutely.
The breakfast of champions.
Dinner
Oh,
of
that's Dinner
champions.
of champions, sorry.
Exactly. Exactly. We hit 6:30, not quite yet. And when we do, Jess will ask you to take a roll call vote. $6:30 to me. Jess, go right ahead.
Supervisor Lee,
Yes, present.
Supervisor Chavez,
Here.
Supervisor Semidian,
Here.
Vice President Ellenberg,
I'm here.
President Wasserman.
Here as well. Thank you very much, Jess. We move on to item 16. Supervisor Chavez.
Thank you.
You bet.
Colleagues, this item 16 is a 2-part referral from me asking for, 1, immediate provision of trauma-related services to the VTA employees and their families recovering from the May 26, 2021 mass shooting and a subsequent suicide. 2 recommendations relating to the establishment, 2, the other recommendations relating to the establishment of a Santa Clara County Trauma Recovery Center for survivors of violent crimes and other traumatic events. As it relates to the immediate provision of support to VTA, I'm asking for your support in directing administration to assign appropriate county staff to assist VTA employees and families. And I recommend some skill set along the lines of a medical social worker and a victim advocate to ensure the provision of clinical services to VTA employees and their families, such as individual and group counseling. And I recommend the Center for Living with Dying as a partner to procure expert assistance to assist VTA in the provision of trauma recovery services. I would recommend that we continue our work with Dr. McCoy, who's been working with VTA and is an expert in working with survivors of trauma and mass violence. For provision of these services, VTA should reimburse the county and staff should report to us with a proposal for a cost reimbursement model. While the county reassigns staff to assist VTA, I want to make sure that victims of other crimes continue to receive services. And to that end, this referral is asking for a report on staffing needs at the Office of the District Attorney's Victim Witness Service Unit, as well as for recommendations relating to the need to conduct a study, a classification study for that body of work. The second part of my referral, though, asks for the county to establish a trauma recovery center for survivors of violent crimes and other traumatic events such as wildfires, COVID-19, and floods. We know that trauma, if left untreated, can contribute to long-term health risks, substance abuse, financial and housing instability, loss of employment, and other challenges that increase the risk of victimizing or being of becoming a victim or victimizing others. The county's Trauma Recovery Center would really be the first of its kind. I'm not aware of any other centers in the country that would offer trauma recovery services to survivors of violent crimes, natural disasters, or public health crises. For this endeavor, the county should procure expert assistance and engage a thorough stakeholder process. And colleagues, I do just want to share that this idea really came from conversations that many of you and I have been having with our own departments about how we respond to the multiplicity of crises that we've been dealing with over the last few years. And I really want to just acknowledge the District Attorney, Jeff Rosen, Casey Halcon, the Director of Victim Services, and also Senator Dave Cortese. You know, really these were ideas that were bouncing back and forth as we were trying to figure out how to respond to these crises. So that would be, that is my motion. I know it's big and clunky, but I gave you a report so you could read that. And I would like to ask for a second.
I'll second.
Thank you. I appreciate that, Supervisor Chavez and Supervisor Lee. I too want to give a shout out to DA Rosen, James Gibbons Shapiro, certainly Casey, Victim Services Unit, This all became near and dear to my heart with the Garlic Festival shooting and the way the DA's office stepped in that day. I saw the same that day effort from the DA's office. When I was there, Supervisor Chavez, you were there as well with the VTA shooting. And the response initially with the Garlic Festival, I don't quite think the DA knew what he and his office were getting into at the time, but they got in and they championed. And I've heard 100 times from people in South County about the service, Casey, that you're championing and providing, and continue to provide to this day. I hope to God none of us ever experience this with those that lost family, their experience. And I don't know how many years process it is. You never get over something like that. But the DA's office stepped in. When I read your referral here, Supervisor Chavez, I immediately thought of our DA's office and providing that service. And I'm looking forward to hearing. I think I'll go to Vice President Ellenberg, and then I want to go to the DA, and as he wishes with Casey and James Gibbons Shapiro. So Supervisor Ellenberg.
I'm happy to hear from the district attorney and James first.
Okay, thank you. Mr. DA.
Thank you so much for giving me the opportunity to speak. For what it's worth, I'm having takeout later. So just in terms of the dinner options. I strongly support Supervisor Chavez's referral to create a Santa Clara County Trauma Recovery Center. Her referral focuses on two needs as she's articulated them. First and most immediate, the establishment of a center to serve all of the victims of the terrible VTA shooting on May 26th, the family of those killed, their coworkers, and really the entire VTA community. I'm joined in this meeting with Casey Halcone, the director of our Victim Services unit. Her leadership team has been amazing during this process. James Gibbons Shapiro, who oversees a lot of these efforts as well, has joined us. And we've just had great success working with County Behavioral Health, the Red Cross, the Center for Living with Dying, VTA, EAP, and many more organizations to provide immediate and ongoing service to the VTA community. But we know more is needed. We're designating a dedicated advocate to work full-time with the VTA community to augment our broader work. We also know from experience opening the Gilroy Strong Resiliency Center 6 months after the Garlic Festival shooting, that it is vital to open a center for expanded coordinated services for the VTA community. So I fully support Supervisor Chavez's recommended actions to quickly establish a center to serve VTA. The second need that Supervisor Chavez articulates is creating a permanent trauma recovery center. Sadly, we have too much experience in America and in our own county with mass casualty events, and they're not going away. That experience teaches us important things we need to do now and going forward to address the trauma that accompanies these and other events that victimize large numbers of people. A permanent trauma recovery center will be there to provide ongoing and long-term support for those affected by these events and to be ready to respond with lessons learned from this and past events to do even better. I'm proud and at the same time saddened about the fact that our expertise in mass casualty events is now recognized across the country. The Trauma Recovery Center will allow us to further that work to develop long-term ways to restore victims, so many of whom come from underserved communities. This work is innovative and it's vital. To realize that goal, we appreciate the elements of Supervisor Chavez's referral regarding adequate staffing and a classification study for victim advocates. If the board adopts these recommendations today, we'll work with the county executive and ESA to analyze the needs and make specific recommendations. At this point, I expect that we'll need a program manager and probably 3 victim advocates to properly staff the Trauma Recovery Center and ensure that our vital work to serve domestic violence victims, sexual assault victims, child abuse victims, and all victims of violent crime will continue. We recognize that a classification study is an extensive process, but it's important to undertake this. We're asking so much of our victim advocates, and their salaries and benefits should be commensurate with other county workers who work closely with people suffering from immediate and long-term trauma. It's just simply what's fair. And of course, it will help to retain the great people that we have working as victim advocates. Now, I understand that all this costs money. We will, as we always have, seek grant funding where we can. Because of our success in that area of seeking grant funding, the general fund, the county general fund, pays less than 10% of the salary and other costs for victim advocates, at the same time that we've dramatically increased our staff and services because of the grant funding we've received. This proposal will require a slightly larger general fund commitment, and you'll see exactly how much in the September 14th response to the referral if it's adopted by the board today. So thank you very much for the opportunity to speak in support of Supervisor Chavez's recommendations. Thank you to the board for your ongoing support for victims of violent crime and those who have suffered in a mass casualty event and those who suffer in all ways that violence can cause trauma. Thank you.
So we've got a second. Let's hear from our three speakers, Jess. I don't know why I'm echoing. There we go.
Thank you. With 1 minute, our first speaker is President ATU. When you begin speaking.
Good evening, everyone. My name is John Courtney, President, Business Agent for ATU Local 265. Unfortunately, I was involved in the shooting. I was in the room. And, you know, I just wanted to let everybody know that there's no playbook for this, for what we all have gone through. But I can tell you, there have been some major players who have stepped up. And we at ATU Local 265 support item 16. And I want to thank Senator Cortese, Assembly Member Ash Clara, Council Member Perales, Supervisor Chavez, the District Attorney's Office for the support that we have received so far. We buried a brother yesterday, Henry Gonzalez, and Henry's injury was not a limp, it was not a bruise, it was not a Band-Aid. It was a mental injury that he had suffered. And we unfortunately weren't able to see it in time. That's why it's imperative that we get these services in play ASAP. And again, I thank you all for this from the bottom of my heart.
Thank you.
Our next speaker is John Popashek. I've unmuted you. You'll have 1 minute to speak. Timer will start when you begin speaking.
Hello, my name is John Pospashek. I'm Vice President of ATU Local 265. I'm just going to piggyback on what John was saying. You know, I was there from day one. Once this happened, I went to the Red Cross with those families, and this is a process that we learned so much about, you know, mental health and everything. I just want you to approve this going forward. It's a much needed, the critical support for mental health. I wanted to thank Casey and Dr. McCoy. Casey from Victims Witness, she's been awesome. Sue Cronin from Bill Wilson Center for Living and Dying, she has supported me. I had to go, I called Sue and I said, I need you, Sue, to went to notify Henry's family. And I just, you know, she was right there with me. Just so many members have called me directly, and I've been able to refer them directly to the services they need. And without these services that you guys have provided, I don't know what we would be doing.
Our next speaker is Sparky Harlan. I've unmuted you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Sparky Harlan, CEO of Bill Wilson Center. And I reached out to Jeff Rosen and Cindy Chavez recently and said, look, the one thing I want to do before I retire is get the Center for Living with Dying at least some public money so it can survive long after I leave. You may not know, we have zero public dollars. We rely totally on donations. But every time a disaster happens, they think of the Center for Living with Dying. We've been doing this work for 45 years. We're always there, and we hope that with this added funding, we can become an integral part to dealing with these disasters, whether they're natural disasters or horrible crimes where we have victims shot. And looking at Gilroy and both the VTA, we hope to be your partners in this for a long, long time. Thank you for your support.
Thank you, Sparky.
That concludes public comment.
Thank you. I appreciate that. I appreciate this item being brought forth by Supervisor Chavez for the DA's involvement as well. Supervisor Ellenberg, you're seconding the motion. I'm certainly in support.
No, Supervisor Lee seconded the motion.
Supervisor Lee seconded the motion. I'm still in support. All right. Do Supervisor Lee or Ellenberg, your hands are raised. Do you wish to make additional comments before we take a vote?
Yes, I do, and for some additional consideration to come in the report back.
Sure.
As well, please. I honestly can't imagine the magnitude of trauma that the VTA organization has been undergoing for months now. Certainly VTA itself bears significant responsibility for responding to the trauma and should be contracting with trained, skilled providers to offer whatever services are needed, including with county resources for as long as they are needed. Our county can and should assist the VTA in getting access to the appropriate services. Just want to be clear, this was in the referral, but the referral mentioned VTA reimbursing the county. Just as a detail here, I think that VTA should cover the costs with a contract up front. They have the resources. In the FY 21-22 state budget, VTA received $20 million for recovery and grief assistance purposes, among other things. I hope that these funds will position them well to provide the services that their employees very, very much need. I am strongly in favor of us working and partnering to get whatever services are needed up and running immediately. With regard to the larger concept of a trauma recovery center, it really is an interesting one, but not necessarily one that I would like to see run by the district attorney's office. In so many conversations around reimagining safety and justice, the desire is to move away from law enforcement directly providing services that may be better offered directly by local, trusted, culturally specific community organizations. And I'm thinking that if the district attorney's office has funds available for victim services, I would be interested in seeing those funds go into community organizations rather than further staffing up the district attorney's office to directly provide more services. And I also want to note that while the creation of a trauma recovery center is really an interesting prospect, I'm not yet convinced that this needs to be a brand new centralized institution, or whether we currently have, or whether we can make use of our current, again, trusted local, culturally specific community organizations to address trauma. So what I would like to ask for in the report back is that there's a consideration of a variety of models for a trauma center as alternatives to the one presented here today, so that the board can really have a full discussion of options and a variety of ways in which we might provide these services, which unfortunately do arise and are critical when they do and need very quick responses. So if that addition is acceptable to the motioner and the seconder, then I'll be glad to support it as well.
Let me just make a comment, and I think you're right that we want to have the right partners at the table, but I just want to make an observation that the reason, I'm coming to all of you saying that I want a more direct connection between us and VTA is that the backbone of the response has been the skill sets that sit in the DA's office with the victim witness program itself. And that's just something we have to kind of grapple with. And I think the other point is one that Sparky raised, which is that there is a a level of expertise that's required for this very specific kind of response. And if you take the pool of all therapy in the world and you narrow it down from marriage family therapists to those that have an expertise in trauma and those that have an expertise in specific kinds of trauma, that dot on the map gets so tiny. So I think that, and I think the point you're raising about making sure that what we do is culturally competent and reflective of the community, I think is right. But I just want to caution that my experience thus far has been that the pool of services is so small that part of the reason I want the center is because I think that's the only way to get trained up to have more capacity to be able to respond in times of emergency.
I'll definitely be interested to learn more and thinking about who, if it turns out that, that our experts are telling us that a centralized model does make more sense, there's still opportunities to talk about who in fact would be staffing that. So I just want to make clear that for me to support the referral, I am absolutely in support of immediate contracting and services to VTA as needed. But not in support of the specific direction to add particular positions or classification studies. I would rather have our staff come back first with a broader analysis of different models for a recovery trauma center. And if the one you're proposing is the best one, I will be excited to learn that.
I guess what I want to just make sure, Supervisor Ellenberg, is that I'm being clear about one thing, which is that there aren't a lot of these. And so in terms of finding the model, it's going to be, frankly, I think it's going to be a lot more, we're going to start somewhere and then we're going to get somewhere, because I just think there aren't a lot of them. I think if the point that you're raising is that as it relates to, the long-term, placement and partnerships, I do think that perhaps when the staff comes back, that they can give, they'll be able to respond to a number of the issues you raise. I just don't want to set an expectation because I haven't been involved in this that long, but I will tell you that we've been looking far and wide for resources, and we keep looking to the same small group of people. So,
sure. And if that's how it turns out, that's fine, but I don't want to preclude other options by having this referral come back with specific recommendations about classification studies and increase in number of personnel in the district attorney's office. I think that that skips a very necessary step for me.
Understood. Can I go to Supervisor Lee or Supervisor?
Yes, please. Yeah, thank you. I'll think about what you just said, Supervisor.
Thank you, Supervisor Lee.
Thank you. I just want to, first of all, I want to thank John Corey and John Pospashek for speaking today on this very important topic and what the president of ATU has gone through himself. The Trauma Recovery Center is certainly something that has been long overdue for our county, and I'm glad that we are finally making a motion, make it happen. Thank you for Supervisor Chavez for your leadership of bringing this forward. Having served in the military myself, the idea of PTSD, post-traumatic stress disorder, is something that I have faced with so many people I have encountered. It's not something that could be taken care of in a few weeks, a few months. As a matter of fact, it actually has taken years and sometimes decades, if not a lifetime, to recover. Therefore, I will be a strong supporter of this program, and I certainly will want to make sure that my colleagues understand the importance, all the work that we have seen, for example, is regarding mental health. The issues we're having now in our custodial services regarding mental health. And right here, what we see is also mental health. In this case, it's mental health in the workplace. The tragic passing of Henry Gonzalez shows that we really need to do more to provide supporting the victims of traumatic events within our Santa Clara County. This is only the first step the right direction, but there's certainly many more that we need. One last question I actually have with the maker is to make sure that I know we're covering many of the family members. I just want to make sure that the children of those victims are also going to be covered by this referral regarding their dealing with their trauma, because kids also react very differently than adults.
Absolutely, Supervisor Lee, and I'm really pleased that you raised that, because one of the points that you're raising that's so powerful is that we saw that right away. And again, I'll just emphasize that the specialties of folks who handle trauma versus grief versus marriage and family counseling it's very specialized. And I really appreciate the point that you raised there.
Okay, thank you.
Thank you. I certainly support the idea of a collaboration between entities to provide a trauma center. Casey and James, did either of you have things that you wanted to add in? No? No?
I'll just add in one short thing, which is that, Jeff mentioned that we have experience, sadly, in our county with mass victimization events. And we've actually had 5 mass casualty events in the last 2 years. We had the Ford store shooting. We had the Grace Baptist Church attack. We had a family murdered in San Jose. We had the Garlic Festival shooting, and we had the VTA shooting. And these are 5 mass casualty events all within the last 5 years. And the DA's office's Victim Services Unit provides victim services to all victims of violent crime, whether we file charges or not. And in all 5 of these instances, it was Casey and her team that everyone in the community were relying on right away to make sure that the right services were provided and that the right connections to other CBO and other partners were being made for further services. So I think that something that's important to remember is that the experience that we've had over the last 2 years shows how vital it is that we build a structure for ongoing support, not just for the victims from these 5 events, but for the next 5 events that we know are coming, because that's the reality of where we are right now. Thank you.
I do want to just add one other thing, because there are some folks listening who are texting me saying, don't people understand that we need to move fast, fast, fast. So don't just move your fannies. And so I just want to say to the public that we're really talking about two different things. One is we're going to lickety split work with VTA quickly. And I want to turn to Dr. Smith just to ask a question about that. And then the other is this process of building out this center, because we want to make sure that, frankly, that we've learned so much. We want to capitalize on that and make sure that we have the resources for the community in the future. So I don't want anybody to be confused about speed. We understand we need to move, and frankly, it's been a little over 3 months since the shooting, and it's still people. I just talked to somebody yesterday who worked at the facility, who has their first visit with a psychiatrist in October through their health insurance. I mean, that's and that's with us yelling at them, asking them to move. So anyway, I just want to assure the public that we're going to move really quickly on the immediate services in partnership, I hope, with behavioral health and our other partners. And Dr. Smith, one question I want to ask you is, do you need anything to be able to move quickly on the immediate needs of our partnership with VTA that I need to include in this motion? So I don't want you to have to come back to the board for resources on that front, because we know there's going to be a reimbursement process and all that, but and I recognize that the center is a much more structured approach, but do you need anything from any directive that I can embed in here that gives you the flexibility you need to be able to respond?
And Dr. Smith, excuse me, 1 minute, Dr. Smith. Supervisor Chavez, are you saying and I hope I'm misunderstanding you, I'm sure I am, that the victims of the families and the friends and the employees have not been receiving mental health services from the VTA since week 1?
No, what I'm saying is that I'm illustrating that the systems that we have in place don't respond to trauma or urgency. And so for many, many people, the services they've received have been through either Casey, our own behavioral health folks. We've worked with the medical providers to ensure that. My point is just that systems don't understand trauma. They just don't. And that's actually one of the reasons the trauma center is so necessary. And I also just want to acknowledge that how fast we're moving is not how fast our partners are moving. And that's something that, we're really working with VTA and our partners at the DA's office and others to, frankly, to move people up on the list, but
Okay.
it's a problem.
Dr. Smith, please respond, and I've got a follow-up.
I think if we're talking about splitting the referral into 2 parts, meaning one part is responding to the emergency at VTA, providing support and getting whatever outside or internal services are needed. That part, I don't think, Supervisor, we need anything more than what's in the referral. With regard to the creation of the trauma center or trauma response center, that we'll have to come back after we've sat down with the DA and see what he has on paper. But for now, with responding to the VA needs, I don't think we'll need anything else.
Thank you. I just want to make sure you're resourced enough if there are contracts or anything else we need to move on.
Well, we have authority from the board for numerous behavioral health contracts. So I think it's more a matter of redirecting resources and talking with VTA about whether they need some additional outside resources, which I think we could deal with within the context of the current budget.
Thank you, Jeff.
Thank you. Casey, could you please respond to what services the VTA has been providing, or either directly or financially, since the first week of the shooting?
Absolutely. So very similarly to our response in Gilroy, in the hours and days following, there were immediate crisis services provided, mostly with a focus on our victims' families of the 9 who lost their lives that day. And services have continued to be made available to them as needed. And I do think VTA is doing their best to outfit mental health services. We've been very lucky to contract with a clinical forensic psychologist who's a specialist in trauma services, who's responded to mass victimization events throughout California and even broader. And she's contracted with VTA to provide services to their management on psychoeducation to help the management work with the staff, but also to do psychoeducation for the staff onboarding and one-on-one counseling services. But she's one person. So the Center for Living with Dying, I cannot say enough wonderful things about the services that they provide, both in VTA and also in the wake of Gilroy. So they've been doing a lot of crisis counseling and grief counseling work. We have not turned anyone away. So anybody who's called us and requested help, who's needed emergency services, we have met with them. We have directed them to resources as best we can. We were with Henry's family the day of the suicide. I was there with Sue that day, providing services to his widow and his 4 children. I know the Center for Living with Dying is continuing to do that. And so what we're running into is, which I'm sure is not a surprise to any of you, is that in the wake of a pandemic, the demand on mental health services in our county and beyond is substantial, and our resources are stretched thin. And so the challenge that we have, myself as Victim Services, Center for Living with Dying, Dr. McCoy, and hopefully it's a challenge that all of you will join us in meeting, is outfitting VTA with the services they need to respond to the need of their employees. They have about 2,100 employees. We had 9 victims who were killed that day, plus Henry Gonzalez, our 10th. We've also had 100 people who were in the building that day. We have a couple dozen direct witnesses. Plus, as Supervisor Lee mentioned, the families of the VTA employees, their children. you're looking at a service group of several thousand. And when you add their families and their children who are also impacted by this trauma is a stone thrown in the water. There are significant ripples, and we want to address all those ripples. I think Henry's loss, it brought that home for many of us, and I know it deeply wounded our VTA family. And so we are providing all the services as best we can with the resources that we have. And VTA, to Supervisor Ellenberg's point, is working hard on identifying clinicians. We've given them some parameters for trauma specialists, people who specialize in certain very specific treatments for PTSD, because that's what we're seeing in the VTA community. And they're identifying them now through their procurement. I've given them some standards about how many hours per week we would like them to be able to see our clients, what the expected need is. And we're having regular leadership group meetings several times a week with VTA and with our union and with Center for Living with Dying, Behavioral Health, and my team to structure the program out. So we're making sure every week that we have services as needed. And certainly when Henry died, we mobilized additional resources as needed. And I did have my hand up before you called on me, and I just want to make one comment. I appreciate Supervisor Ellenberg's comments about the need for culturally responsive services and for CBO engagement and involvement. And, you know, I work very well with our CBO partners. I hope to continue to do that. And the Gilroy Center was a really great model of that. So we pursued a grant to help fund that center, and we have 4 nonprofit partners. And I don't know the direction that the Trauma Recovery Center will take. I hope I can play and my team can play a role in whatever needs you best see fit. But I do anticipate looking for grant funds to help support the TRC, whether that's through the DA's Office and Victim Services or augmenting additional CBOs as needed, working collaboratively. It's something that I value. I know the DA's office values, and we've done it before successfully, I think. And I also, this is the first time we've asked for additional positions with Victim Services, and I am cognizant of the impact that has on the budget. And so I will absolutely continue to seek grant funds wherever possible to continue to support the services to victims of crime.
Thank you, Casey. Supervisor Chavez, this being your motion, and Supervisor Ellenberg had brought up a point before, and I certainly think organizations like VTA, or if something, God forbid, happen like this to Apple or Google or other large corporations, you know, they participate financially. It's bringing the services, as Casey said, you know, the current PhD is only one person. It's bringing the services, it's bringing the whoever calls, nobody's turned away, and it lasts for years, as I've seen in Gilroy already. Are you okay, or what part are you? Supervisor Ellenberg made a proposal, a suggestion to you. You said you needed some more time to think about it.
Yeah, I think have some follow-up that I wanted to
Supervisor Ellenberg.
ask Casey about. Casey, thank you so much for that. And I am aware of what a tremendous positive and dramatic impact you have had on so many victims of crime and violence in our community. Your description was very helpful to me of the number of different roles, the mental health providers. Clearly, we have a shortage in every possible area there. The local partnerships, all of which I think is really critical. So again, in the report that comes back to us, I want there to be some fluidity and discussion of options with positions. This referral was very prescriptive and specific in what positions in the district attorney's office should be expanded. And I'm concerned that might be too narrow. If the positions that we need are in mental health, in community clinics, in liaisons, in whatever they are, I think that's a much broader lens here than presuming that they will be assistant district attorneys. That didn't sit well with me, but what you're describing, Casey, that is much more integrative, it feels like something I could support. So the ask remains the same, that this referral not include the very prescriptive descriptions for particular positions to come back.
Supervisor Chavez?
Yeah, what I would say is that I think that what I would be comfortable with, Supervisor Ellenberg, is the and, because perhaps I wasn't explicit enough about the integration of the partners, and that I apologize for, because that the intent is that there as an and. The specificity on a couple of the positions is frankly based on the last 90-day experience or 100-day experience I've had with BTA, and recognizing the gaps in knowledge that any institution would have when something happens like this. So for example, the reason I was looking at a medical social worker is there are so many benefits that accrue to a person at, when something like this happens with a family. But BTA had to learn all of that. And thank goodness for Casey, or we would have been learning forever. And so that's what made me think medical social work, because that's been my observation. But the staff may come back and say, this is actually the type of position you need. The second thing that I would just add is that there's counseling, and then there's frankly, there is a lot of legal processes around an incident like this that the DA's office was uniquely situated to help BTA and the families understand. So what I would like to do is leave what's in place, but add, if we needed to add another letter to it, just to add that we want the staff to come back with an integrated approach that really is community-based. And I think that's would do that way we would get all the information that you're requesting.
If it's information, that's fine. If it's approving positions, then I want to abstain from that piece and we can pull it out.
Supervisor, all of this is referral to come back. None of it is us saying it's all referred to administration to report to the board, refer to administration to report to the board. There's no
options that may include.
Yeah, they include
the district attorney's office.
Yeah, they include some direction for staff to work together, but they don't. Not all of this is to come back to us. None of it gives direction. It gives direction to do the research, but it doesn't cement us into anything.
If that's the clarity, then I will be glad to support it today and look further and talk more when we see what comes back from staff.
Thank you. I do have to say that our words are very important and often are considered to give direction. So I'm glad the two of you could work out something. Supervisor Lee, you seconded this already. You still have your hand up. Did you have additional comment? Otherwise, we'll take a vote.
We're ready for a vote. Thank you.
You betcha. All right, Jess.
Just stepped away for a moment, so I'm going to do this vote. Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Smidian.
Aye.
Vice President Ellenberg.
Yes.
President Wasserman.
I'm going to say C. I've never said C, so I'm going to say C.
And thank you. Thank you, colleagues. I really appreciate this. And I know VTA, the folks who are listening today are just saying hallelujah. So thank you.
Good. I look forward to us working with VTA and making our county better. Item 17, Supervisor Lee.
Thank you. First of all, good afternoon, good evening now, colleagues. Just try to keep my comment relatively brief. Ever since my days back in the Sunnyvale City Council, I've been a strong proponent of environmental causes, and one of those is being efficient in energy usage. The importance of energy efficiency measures often goes understated, but it's quite important to understand, of course. Increased energy efficiency can lower greenhouse gas emissions, other pollutants, as well as water usage. Improving energy efficiency can also result in lower utility bills, creating jobs for our county, and of course help stabilize our electricity prices and volatility. It also provides long-term benefits by lowering overall electricity demands, thus reducing the need to invest in any electricity generation and transmission infrastructure. And finally, the efficiency will help diversify our utility resources portfolios and can be hedged against any uncertainty associated with fluctuating fuel prices. So our county's facilities and fleet department has provided a report to FGOC relating to the status of energy saving project at VMC back in June. In that report, staff has noted that due to ongoing construction activities, they recommend not to pursue these until the construction projects are complete. However, the report also indicated that there may be some opportunities for energy efficiency measures to be implemented at the O'Connor, the Paul, and St. Louis campus, along with other associated medical office buildings that the county has acquired. So this referral is essentially just asking the administration to provide 2 follow-up reports and work plans to the FGOC in October concerning these energy efficiency measures, O'Connor, DePaul, St. Louis, and at the VMC once the construction activities are complete. And that's my quick intro on this. Thank you.
Thank you for your motion. Who would like to second that?
I'll second it, and I just have one comment. So first of all, I'm thank you for bringing this forward. It feels like every generation comes back and says, do more on energy efficiency. So thank you so much for that. My question, Supervisor Lee, is that does this referral assume that these bodies of work will be done with the ESCOs that were identified originally to work on each of the campuses, the energy service companies?
No, currently the proposal is open so that certainly the county could work with whichever the most appropriate. ESCO certainly has the most experience since they've been working on this in the Clara BMC before, so they certainly will be a good candidate for it. But my referral does not specifically state a organization for that.
So the oh, I see. So I'm going to just say this out loud. I'm looking at the background. I'm so sorry I missed this. So the energy service companies. So okay. So is it a brand new RFP you want them to come back with then?
Yeah, it's really for the for our staff to get back to us regarding what to go out, and certainly I think it would be good to make sure that I'm just more concerned about getting the projects done and certainly done in a fairly efficient manner. Correct.
So part of the reason I'm pressing on this, Supervisor Lee, is that if we have people who are already ready to go, it addresses speed. But if there's another issue that you're trying to address, I want to make sure I understand it.
No, that's
So
all.
it's speed.
Speed. Correct.
Okay. Thank you.
Thank you, Supervisor Smitty.
Thank you. And my thoughts may be related to the issue that Supervisor Chavez just raised. I smiled when Supervisor Chavez said every new generation of supervisors raises these issues, because this was an area where I raised similar concerns and aspirations literally my first year back on the board in 2013. And while progress has been made, I have to say it took far longer than I hoped or expected it would. And to the point that Supervisor Chavez raises, let me be, more direct, which is, if it's going to take another 8 years to go through the exercise by reaching out anew, that would be a disappointing outcome. So I'm not going to. Not only that, Supervisor Wasserman, it would be regrettable. But I'm not going to offer an amendment. I respect the fact Supervisor Lee has his language in place, but I am going to say to staff, if you've got people who have already been engaged and who have familiarity and expertise, starting all over again, I think would require some justification. So Supervisor Chavez, I don't know if we're on that same path. I think maybe we were, but Supervisor Lee, I'm happy to support your motion. But I do want to say to staff, let's not go back to the beginning and start all over again. That it took too long and it was too painful the first time around. Thank you.
Thank you, and I would agree as well. A bird in the hand is valuable and go, and I hope that all of our properties can always be as energy efficient as possible. Sometimes returns take more years, but I'm very proud of the energy saving capabilities of Santa Clara County. Perhaps Supervisor Lee's the only one not aware of it, but there was a study done about 5 years ago on which organizations produced the most renewable energy. And we were like 5th in the nation. And #1 was Walmart, which doesn't, in my book, doesn't count because they have 500 stores with 500 solar arrays. And we only have one Santa Clara County. But we're darn good, and we're getting better all the time. So I'll be happy to support it as well. Did I see more hands? Supervisor Ellenberg and Chavez, did you leave your hand up or put your hand up anew?
I put my hand up anew just to echo support for using the already chosen ESCO. Even I've been here long enough to have been part of a generation that has tried to push on this work before. So Supervisor Lee, if you would, I don't know if we need a formal incorporation of using the already chosen ESCO. That would be strongly my preference.
So that's a friendly amendment?
Let's call it that.
Okay, Supervisor Lee, is that acceptable?
Yeah, sure. Yeah, I'll accept that.
Thank you.
There's some projects we have approved people for and we want to go with them, and some we choose to do it again. All right, if that's it, we have 2 speakers that wish to speak. So please let them in, Jess.
Our first speaker is Kevin Ma. I've unmuted you. You'll have 1 minute to speak. Timer will start when you begin speaking.
Good evening, supervisors. My name is Kevin Ma. I live at D5 and I'm with Silicon Valley Youth Climate Action, and I'm in support of this referral. As we know, climate change is upon us, and it takes all actors in every space, both private and public, to make the necessary changes to address the issues we see. That means using less energy. That means using less water in addressing the drought problems. And that means that I understand this is a very long process that's going to go through with the climate, the 2030 roadmap that the Office of Sustainability is working on. So I am in support of this, and I'm in support for future county projects to be as focused on efficiency and reducing our effects on the climate. Thank you.
We had one hand up and it went down again.
Okay, then we will call for the vote, please, Jess.
Supervisor Lee?
Aye.
Supervisor Chavez?
Yes.
Supervisor Semidian?
Aye.
Vice President Ellenberg?
Yes.
President Wasserman?
Yes.
Thank you.
Thank you. With that 17, Jess, I'm jumping to 22. Are you okay with that?
Absolutely.
All righty. 22.
Good evening, President Wasserman. My name is Celine Ho. I'm the Health Center Manager for the Valley Homeless Healthcare Program. In your board packet, we provided some updates about SB 1152, some additional grant funding that we received from the American Rescue Plan, and then some of our quarterly grant expenditures. Just in the interest of time, I'm happy to answer any questions you may have on this item.
Celine, one of the best staff reports tonight. Thank you very much.
Thank you.
Supervisor Vice President Ellenberg, your motion?
I'm happy to move, but I know that it is also important, particularly coming right off of an audit, that we make sure that we are deeply engaged with the issues here. So I am going to make a couple of comments and ask for some information. And first, Celine and team, I want to congratulate you all on the very successful site visit at the last report. Have all of the follow-up items from the site visit been resolved and submitted to HRSA, or is there anything remaining?
Yes, first I want to thank the board for participating in the site visit in June. During that site visit, the auditors had identified 4 non-compliant elements. We were able to make the corrections within that 14-day timeframe that HRSA required us to do. And so as the result, the final site visit report shows that we're 100% compliant with all the requirements. So there's no further action needed.
Bless you.
My dogs are done with this meeting. Regarding SB 1152, thank you so much for resuming the quarterly reports. I know that discharge practices continue to be a priority for VMC neighbors whom I represent. And I want to make sure that we're providing and recording that all patient needs are being met prior to discharge. And I appreciate the steps that have been taken to build reporting into the HealthLink workflow. But it looks like the reporting is thus far incomplete. For example, more than 6,000 unhoused patients were served at VMC during this reporting period, but fewer than half of them are reported as having a, quote, meal offered. So I'm wondering what else you think needs to be done so that we can see in these quarterly reports a more clear breakout of when a service is provided, when it's not indicated, or when it's refused by a patient in each of the categories reported.
Yeah, so we haven't been capturing the when it's not indicated or when there's a declination of, for example, if we feel like they do have appropriate clothing, and so that obviously is not being offered to them, and so what's reflected here is what was actually being offered and as needed. We can take a look at the data collection HealthLink to see if we can add those additional status that you just mentioned.
Yeah, thank you so much. I really would like to get a commitment that in the next quarterly report, we can get that refined breakout of if services are offered or indicated. And if not that, a plan and a timeline to address the workflow or the health record system so that we can implement changes. Is that possible?
Yes.
Cool, thanks. And also in the next report, I'd also appreciate if data from prior reports be provided in a table so that we can see trends across reporting periods rather than just the single point in time for SB 1152 compliance.
Will do.
Thank you so much. Again, congratulations on the site visit. I really appreciate your work, Celine.
Thank you.
Thank you. Would any other attorney or non-attorney like to grill Celine? Yes, Supervisor Chavez.
Thank you. Very quickly, no grilling. But one of the things that I'd really be interested in getting more information on is how many people left our hospitals and then went to medical respite, because I really want to know what that delta is. And I've seen on one of our long-term capital improvement plans or capital plans, there's actually a respite center on the list, but I don't know how big that respite center should be based on any research yet. And I don't know if that's something you know now or if that's something that you could bring back in your next report.
Yeah, I don't have that data now, but I can certainly take a look at it and see if we can include it in the next report.
Yeah, I think that would be really important because it's hard to know anyway, it's hard to know how big that other location should be. And I'm not sure how you're weighing in on it if we don't know that number.
We'll look into it and then provide you with that information.
Thank you very much, Celine.
Sure.
Thank you. We don't have any speakers on this item. We have 1, 2, 3, 4, 5 actions being asked of us, which can be handled in a single motion. Do I have such a motion?
So moved.
Supervisor Lee made the motion, seconded by Supervisor Chavez. Again, no members of the public. Any further discussion on this item 22? Seeing none. Jess, please roll call vote.
Supervisor Lee?
Aye.
Supervisor Chavez?
Yes.
Supervisor Simidian?
Aye.
Vice President Ellenberg?
Yes.
President Wasserman?
Yes. Thank you very much. With that, I'm going to item number 23. I believe we're going to hear from Sherry.
Yes, good evening, President Wasserman, members of the Board of Supervisors. Good evening, Sherry Terrell with Behavioral Health Services Department. You have our report on assisted outpatient treatment, and this was held over from August 17th with the specific request from both Supervisor Lee and Supervisor Simidian to add some additional information. The report has been updated to include information specifically around Judge Manley and his involvement in AOT, as well as Supervisor Simidian's request with respect to information related to contract providers and their provision of services in AOT. With that, we'd be happy to answer any questions you may have.
Very well done. I'll turn to Supervisor Lee if you wish to make, Supervisor Chavez got her hand up first.
Thank you. I wanted to ask Sherry a question. I have been really, actually it kind of speaks to the last issue. I've been really focused on knowing what our waiting lists look like because I'm trying to understand where we have capacity problems and how we address them. And I'm befuddled by this comment that on the report, and this is on packet page 181, there is a statement that we don't maintain waiting lists because the state won't let us. Not that we don't have people waiting for treatment. And I'm just wondering why the state wouldn't let us have, I don't understand that. Explain the state, Sherry, translate.
Sure. So as a Medi-Cal managed care plan, we are required to provide services and provide timely access to those services. And therefore we don't report nor do we discuss per se a wait list because we are required within certain periods of time to be able to ensure that services are available for our beneficiaries. So for example, a beneficiary receiving outpatient services, for example, should be able to receive those services within 10 days. And so that would be a period of time in which we would be, providing a screening or ensuring that an appointment is made available. And we don't consider that per se a wait time because we are responsible for ensuring that beneficiaries receive services in a timely way. I'm hoping that answers your question.
Sherry, at a local level, irrespective of whether or not the state wants the data, we still track that because we would have to know whether or not we met that 10-day for responsiveness. So do we know what the waiting lists are? Do we, and I understand the point you're raising about how to describe it, because I think those are two different issues, right? Which is how long it takes someone to get a service. So are we, because I do know we're tracking that in some areas, but we're not tracking that across the board.
Let me jump in on that a little bit.
Please.
I think the distinction is between a wait list and a wait time. We're not allowed to keep a list that, is sort of a queue in the sense that the person who bumps up to the quote top of the list gets the next bed. But there is data on wait times, how long since between the time that the need is evaluated to the need is satisfied. So that we definitely keep.
Got it. And so perhaps as we have these future conversations, in whatever appropriate, thank you, Dr. Smith, for the distinction, whatever the appropriate framework is, I do think it's really important that we understand that issue because I think it does help us understand capacity. And I would just want to encourage us to include that, even if, and I understand the technical point you raise. I think that's very helpful. But I would like to understand how long it takes people to get services. Thank you.
Thank you, Supervisor. Is that the end of your questions at this time?
Yes, thank you.
Supervisor Lee.
Yeah, thank you, President Wasserman. I just want to thank you, staff, too, particularly Sherry and our Behavioral Health Services Department for this very quick work since we have made that motion of moving this forward. I certainly believe the AOT will benefit the county by prioritizing a small population of our most vulnerable mentally ill residents who have great needs. And I feel that beginning the implementation plans put us one step closer to the right direction. During the last board meeting when the item was held, I have requested the BHSD to collaborate with the court and Judge Manley for the AOT planning implementation. Could Sherry maybe update us how the collaboration worked out?
Sure, I'm actually going to turn that piece over to our team members. We have several behavioral health department staff, so either Margaret or Moretta can actually share an update on that, Supervisor Lee.
Thank you.
Thanks.
Good evening, Supervisor Lee.
Good evening.
Yes, we have been collaborating with the court. We met with Judge Manley last week, Tuesday, and talked a lot about implementation strategies some of the plans that we have for implementation. He also provided us a lot of feedback in terms of our plan. And we do plan to continue to meet with him on a bi-weekly basis. He did ask us to include a few other folks like the public defender and the county council. And so we'll be moving forward with that.
Great. Thank you very much. Well, thank you, Margaret, for the update.
Thank you, Supervisor.
Okay, thank you.
Thank you. Vice President Ellenberg.
Thanks so much. Just as jail should be the last resort for residents that come into contact with the criminal legal system, compulsory treatment through AOT should, of course, be the last option among a range of behavioral health system supports that are available to residents. When we discuss AOT implementation, we also must consider the broader system. And I appreciate the inclusion of Supervisor Chavez's questions, on wait lists. As I continue as well to have concerns in two primary areas. First, our current outreach and connection to care across the behavioral health system. And two, bottlenecks, including for inpatient, outpatient, and substance use treatment beds that impede the flow of patients both up and down the levels of care as their acuity changes. And these issues, of course, have implications for our behavioral health system, our criminal legal system, and our housing system. They're quite literally all connected. So given these issues, I'm particularly concerned with how our board provides oversight of the implementation of AOT issues, including issues of equity, patients' rights, and coordination across the system of care. When we adopted AOT in May, I requested a strong mechanism for oversight with an AOT board that would advise the Board of Supervisors. The ledge file and implementation plan suggest that the oversight body would actually be an informal advisory board to the department rather than to the Board of Supervisors, and without supervisor appointments or management through the clerk of the board. I had assumed that we would see the creation of something more formal through board resolution. Presuming we go just for a moment in the proposed direction of a less formal body to advise the behavioral health department, I have a couple of questions. I don't know if they're best for Sherry or someone else, but first, how would an AOT advisory board intersect with or be supplemental to the work of the behavioral health board? It's my first question. And the second, let's stop with the first.
Let me try to start and then turn it over to Sherry.
Great, thanks.
The reason we came back with a proposal for an advisory board that's a staff level advisory board is so that the staff or committee could actually participate in making decisions and giving advice on an ongoing, timely basis. If the Board of Supervisors appoints a committee, an advisory committee, which you certainly could do, obviously, that means that it has to be subject to the Brown Act, which means it can only contribute input on a very periodic basis. So if the board would like to have more contact with the committee, I might suggest that we set up a administrative committee as is recommended, but have that administrative committee report back to a subcommittee of the board on a regular basis, presumably either health and hospital or public safety and justice, so that the board could have the opportunity to participate also.
So I appreciate that. And that may make sense, but I want to just go back to my question of how it intersects with the work of the Behavioral Health Board. That's the first piece that I want to understand.
Barry, why don't you take that one? I think it's to be determined, but go ahead.
Sure. So on a monthly basis, we provide updates at the department level to the Behavioral Health Board. And so presumably we could continue to provide updates there on a monthly basis and of course gather input and feedback from the Behavioral Health Board. To Dr. Smith's point, I do think if we are able to set up an administrative committee, it would probably make most sense for that committee to report up through the Health and Hospital Committee, because generally our behavioral health work is reported that way. However, we could also consider the monthly opportunity through the Behavioral Health Board. So I think, you know, we would be able to gather input, also report out to the Behavioral Health Board, but then take that on a monthly basis through my report directly to the Health and Hospital Committee, which would then have the adjacency to the full board.
And Sherry, I don't really want to ask for extra meetings, but because AOT is ultimately integrated with the legal system, I would want the reports to come to the Public Safety and Justice meeting because of that overlap. And maybe that's a better fit than looking at the Behavioral Health Board and whether we would need changes to the charter to the Behavioral Health Board so that they could address the needs in AOT implementation and monitoring. I don't know if this is fully answered, but let me just think through what we've already said about options that the Board of Supervisors would have to maintain a connection, and of course to the public. And I don't know if James wants to weigh in here, and if not, that's fine. I understand the nimbleness and the preference for a staff level advisory committee. You're certainly right that access is a lot easier and quicker. But because this issue received so much public attention and so many people are interested in the implementation, I think that having a public report out piece is important. And if we can achieve that without nominating committee members, then I think that can work. James, do you want to add anything?
I mean, I think it can be structured however way the board prefers. If it's structured as a Brown Act body, of course, all the meetings have to be Brown Act compliant. If it's structured as a non-Brown Act body, there's no prohibition on having meetings that are public. So
are they accountable? I want to make sure still that they will, that we can expect them to present reports to the one or two policy committees.
Oh, absolutely. I mean, that doesn't turn on whether it's a Brown Act body or not.
Okay, then I'd like to make a motion for 2 items to come back in September. I believe that a strong AOT board should be established, and if we're going advisory, that's fine, but it needs to be established as soon as possible so that it can inform the development of the AOT program. The current plan shows that the board really wouldn't be seated until the program is intended to launch. So the first motion I'd like to make is to direct administration to accelerate the formation of this board and bring an update to the Board of Supervisors in September with a proposed membership and structure, including, if recommended, coordination with the Behavioral Health Board and or reporting to the Board of Supervisors. And in particular, I'd like consideration in the formation of the board on 1, prioritizing membership of the board by people who have lived experience with receiving and giving mental health treatment, including clinicians within both in and out of custody environments, community advocates, and people who have experienced mental health illnesses, both within and outside of the criminal legal system. If we should contract with an outside group, and I don't think we're going this way, as we do with OCLAM or TAP Harvey Rose to provide, I'm going to skip that idea. And I want the charge of the advisory board explicitly to include review of disproportionality in referrals or outcomes for BIPOC communities in the implementation of AOT. And second, this report indicates that AOT policies and procedures are to be developed by September, which seems ambitious. I'd like these to also come to the Board of Supervisors for discussion prior to their being finalized to demonstrate to us how the AOT workflows will support connection to the range of behavioral health services in the system.
Supervisor, I'm going to ask for a little clarification. Our next board meeting is in 2 weeks. September is tomorrow. What are you asking of staff exactly to bring
Well,
back?
staff had actually already said that they would bring back a plan in September.
To the second meeting or to the first meeting?
I don't remember which they said. I'm guessing it's the second meeting. But
okay. Sherry, is that you or Jeff? Who can respond to that?
We can bring it back to the second meeting.
Second meeting in September. Okay. I just want a clarification here because there's a lot of moving parts. We're doing a lot of designing from here now. Please continue, Supervisor.
Indeed, we are. I am finished if that was clear to Sherry and team.
I got it.
You got it? All right. Thanks, Jeff. Then that is my motion, and I don't think there was a previous motion, so I'll ask for a second.
I'll second for purpose discussion.
A discussion, thank you. Supervisor Lee, go ahead.
Yes, thank you, Supervisor Ellenberg, for this motion. I just want to get a clarification on currently, right now, there's A, B, and C as recommended action on item 23. I just want to make sure how much of that is covered in your current motion.
Yes, C is not an action.
In addition to.
Is in addition to, okay, thank you. All right, just to make sure. So ABC is already there. In addition to, you have that. Okay, good. Yeah, I have no issues. Thank you.
Okay, we don't have any public speakers on this. I'm just going to toss in the AOT journey over the last 5 years has been an interesting one. I know we took the step a few meetings ago to approve it, go down that road, dedicate the millions of dollars, and we're going to look back. I expect, reports every 6 months or so to see how we're doing, how the project is going, what we can improve on. I just want to make sure that we have open, I guess I'll direct this to Sherry through Jeff, but I just want to make sure that staff feels totally empowered and able to report back to us at any time with what's working well, what's not working so well, what you think should be tweaked, anything at all. You are the experts in this area. You're the director of behavioral health. We are not. We are the voting, direction giving elected board members. And so I, for one, I'm sure my fellow supervisors feel the same way. We look forward to your report back, your detail, your findings, your observations, your recommendations. Is all of that clear, Sherry?
Yes, it is, Supervisor. We will be sure to come back with that feedback as we're learning and implementing over time, and we will be sure to share that with the board as we learn about what potential changes or adjustments may need to be made along the way. So thank you for your comments.
Sure. I mean, at the end of the day, I just want us to provide the best mental health services we can for the people in need. And it might be going down this fork in the road or another fork in the road, or it may be a hybrid, Sherry, that you and your team come forward with. And it's the Santa Clara County model that works best. So I'm looking forward to the report backs in the future. So we have the motion by Vice President Ellenberg, the second by Supervisor Lee. I think I got this one right for the first time. And Supervisor Lee, your hand is still raised. Did
Yes.
you have additional comments to add to your motion?
I actually do. I apologize. To make a motion, I do have a couple of things to add if you would entertain these requests.
Yeah.
I would like to approve the request to administration and the BHSD to provide a report to the Health and Hospital Committee at the October 21st meeting with the following information. The departments plan to merge the Mental Health Treatment Call Center and the Gateway Call Center, including the timeline staffing needs, and funding, and requesting the administration and the BHSD to provide a report to the HXC at its October meeting with information on addressing the shortage of beds in the community-based setting for inmates deemed incompetent to stand trial. And also the following, which talks about the number of inmates deemed incompetent to stand trial and awaiting community-based treatment placements, the length of stay, waiting for community-based treatment placements, and the plan for the placements. The number of inmates deemed incompetent to stand trial who are ineligible for track 2 diversion and awaiting transfer to a Department of State hospital, that average length of stay for these inmates in custody, costs associated with housing these inmates, and whether the county is reimbursed, and the type of behavioral health services provided to them while they await for this transfer, and to approve request administration and BHSD to provide a report to HXC at this October meeting with information establishing temporary residential treatment options in order for incompetent stand trial inmates to become compliant with prescribed medical treatment while the court case proceeds.
Thank you.
Thank you.
It looks, before I comment on that, it looks like Dr. Smith wants to weigh in. Is that on Supervisor Lee's addition?
Yes, I would just advise the board, those issues are separate from AOT, so maybe you should vote on the item before you under consideration, and then we certainly can take a referral from the board regarding the issues that Supervisor Lee brought up.
Thank you. So Supervisor Lee will keep that separate if that's all right.
Okay, yeah, that's fine. Yeah, thank you.
Yep.
Thank you.
Thank you for that clarification. Supervisor Chavez?
Thank you. I don't know now that you just said that about Otto's thoughts. One thing I also, that's striking about this and the questions that you're asking is we in the budget, I think we put aside money for about 40 IMD beds, if I'm recalling that correctly. Am I accurate about that, Sherry?
Roughly speaking, yes.
Yes.
Okay, for 40, it was about 40 beds. And so what I was going to recommend is that when the report, Supervisor Lee, that you're requesting comes back, I do think the IMD bed issue is both aligned with what you're asking about, but also Supervisor Ellenberg, what you're asking about. So wherever staff thinks it's more appropriate, I'd like to get the timeline for the IMD beds aligned with one of the report packs. And I'll let the staff choose the right one, because I think whatever you think it's more aligned with.
Sure, we can do that.
Thank you. And Sherry, is there a preference to which, would it be to Supervisor Ellenberg's motion or to Supervisor Lee's pending motion?
I think probably more to Supervisor Lee's pending motion.
Okay, thank you.
Mm-hmm.
All right, so where, Supervisor Chavez, your hand's still up? I'm trying to figure out where this leaves us now. We have the pending motion. Yes.
I think the pending motion is from
Supervisor Lee.
Approval from Supervisor Ellenberg regarding the AOT proposal with her modifications.
Thank you.
Once the board votes on that. Right. Once the board votes on that, then they should consider the referrals from Supervisor Lee and Supervisor Chavez.
Yes, which will be for items A and B. Okay, good enough. Jess, could you please call the vote?
Supervisor Lee?
Aye.
Supervisor Chavez?
Yes.
Supervisor Semidian?
Aye.
Vice President Ellenberg?
Yes.
President Wasserman?
Yes. And now the second one. We've got, oops, Jess.
I'm sorry, is there a motion and a second for the other?
Yes, I made that motion.
And I'm glad to second it.
Okay, so we have Lee and Ellenberg as the motion and the second. No further discussion. And that goes back with A and B, correct? Supervisor Lee?
Yes.
And we can add the report back if you're okay with it on the IMD beds as part of your motion, Supervisor Lee?
Yes, that's
Thank you.
Yes, that's complete. Thank you, Supervisor Chavez. All right, Jess, once again.
Supervisor Lee,
Aye.
Supervisor Chavez,
Yes.
Supervisor Simitian.
Aye.
Vice President Wasserman, I'm sorry, Ellenberg,
Yes.
President Wasserman.
Yes. Thank you, Jess. And that brings us to 29, which I show as the final one, Jess. Do you concur?
I do. I do
Okay.
concur.
Supervisor, let's see, we're gonna go Keeley reporting out on this one.
Thank you, Supervisor Wasserman. Good evening. I and sort of representatives from various departments are here to answer any questions that you may have regarding this item, which is an update on the 15 policing and use of force reforms and are consistent with the report that you received from OCLEM on May 25th.
Thank you, Key. And I don't believe you had a goatee when this meeting started 11 hours ago. All right. Yes, please report out. I see Heather, Jack, go right ahead.
Well, Supervisor, we'll
just take questions.
Just taking questions, fine. I'm sorry, I thought you were referring it over with Heather and Jackie. Good enough. We have no members of the public to speak on this item. Supervisors, I see Supervisor Simitian first.
Thank you, Mr. Chairman. I believe Mr. Janako is part of the team, yes?
Yes, he is.
Thank you. I wonder if Mr. Janako and or other staff could simply comment on what I would describe as outstanding issues or issues where there continues to be a difference of opinion.
Thank you. And Michael, my apologies, my panelist box was covering up your square on my Hollywood squares here. Welcome. Please.
Thank you, Mr. President. Yes, Supervisor Simitian, to respond to your questions, I think we have completed 12 of the 15 recommendations. The one relating to accessing military equipment is a bit on hold depending on what happens in Sacramento. The one relating to less lethal and restrictions on less lethal in crowd control context, Sheriff Smith has declined to adopt the recommendations we made with regard to changes in policies. She may revisit it as a result of the resolution that was adopted by this board this morning as a result of Supervisor Lee's suggestion that perhaps she revisit it. And then the final recommendation that will take a lot more work because it is a weighty recommendation is to reconsider or reimagining policing in the county and providing alternative ways to respond to, for example, individuals in mental health crises. And while, as I indicated in the May report, and I believe Mr. Lay indicates in the group report for this evening, a lot of progress has been made, but this is going to be a heavy lift that's going to take quite a while to accomplish. And that would be how I would sum up the 15 recommendations, Supervisor.
Thank you. It sounds like the one where there's just a continuing difference of opinion is around the issue of less lethal force in crowd control situations. Is that a fair summary?
I think that's fair, Supervisor, yes.
Thank you. And turning to Key Lee, I believe the only requirement or request rather under recommended action tonight is simply that we receive the report. Is that also the case?
Yes.
Yes.
Thank you. And either for Keeley or Mr. Janako, Mike Janako, we were looking at these status reports on a 3-month, 6-month, year basis, and then is it semi-annually thereafter? Is that the understanding? I'm just trying to get a handle on when we're going to hear from you next.
I can take that question. I believe it's a semi-annual status, or at least it has been up to now. We are on that schedule.
Thank you. Let me just ask, Keely, is that under your understanding as well and agreeable to staff?
That was our understanding, Supervisor. And as you can see from our report, we sort of had proposed some sort of modification to that, especially for the various items that had been completed.
Yeah, I don't feel a need to revisit the work that's already been done. I do, however, want to make sure that these issues don't just disappear from our agenda. I think the history of work in this field is that there are moments of crisis and tragedy that capture the public interest and attention. And then regrettably, with the passage of time, folks move on. So I guess what I would like to do, Mr. Chairman, is move the recommended action, which is to simply receive the report, ask that we hear back semi-annually on what I will call outstanding or unresolved issues, and we'll leave it to staff and the consultant to parse what outstanding or unresolved issues might be. And then if there's a second, I have just one more question and a comment I'd like to put down. Thank you, Supervisor Lee. My one more question is perhaps for County Council, Mr. Williams, if you or a member of your team can respond. The outstanding issue where there is a difference of opinion that's been articulated is with respect to the use of less lethal force in crowd control situations. Mr. Giannacco has indicated a desire to continue that conversation with the sheriff. But as that conversation continues, I just want to be clear, presumably the determination about policy in that area continues to rest with the sheriff. Is that correct? Or am I misremembering that?
Yes, that's right.
Thank you. And then, Mr. Chairman and colleagues, forgive me, but I do want to just correct the record as to one matter, because it was incorrectly asserted both at our last Health and Hospital Committee meeting in June and then earlier today that I had made a proposal in this area. Again, that is the less than lethal use of force in crowd control situations that was specific and in contrast to the position of the Sheriff's Department. And just so it doesn't happen a third time, as a matter of correcting the record, I am looking at the June 23rd, 2020 referral under my signature here on this issue. And I'm looking at page 2 of 4 in the memo, where the motion which I offered and which was supported by the board was simply to direct the administration, county council, and the Office of Correction and Law Enforcement Monitoring, OCLEM, in collaboration with the Sheriff's Office, the District Attorney's Office, and the Public Defender's Office, to report to the Board of Supervisors on August 11, 2020, relating to the following potential policy reforms. And then one of them is banning or limiting the use of tear gas and rubber bullets as a crowd control technique. Now, I don't know how much more qualified or tentative you can possibly be than to ask the staff to work in collaboration with the Sheriff's Office to report to the board. Forgive me, the lights have just gone out here in my office. There's an energy saving effort, thank you, to report to the board relating to potential policy reforms. which might or might not include banning or simply limiting the use. And so, Mr. Janako, I just want to make sure you understand that was the direction from our board and on my motion, and that is not consistent with what was said earlier today or at the meeting back in June.
That was my understanding, Supervisor Simidian, and as you know, the recommendation that we made was not to ban. So
Right.
we considered the recommendation as a consideration, and we attempted and did work with the sheriff to try to come to a consensus. We made it on about 12 of them. We didn't make it on this one.
And just to be clear, the recommendation you made is your recommendation and not one that came from the board.
That is absolutely correct, sir.
Thank you. Then the motion stands. Supervisor Wasserman, I appreciate the second from Supervisor Lee. I appreciate the opportunity to correct the record, and I ask for an aye vote.
Thank you very much. And I see no other hands raised. Jess, take it away.
Supervisor Lee,
Aye.
Supervisor Chavez,
Yes.
Supervisor Simidian,
Aye.
Vice President Ellenberg,
Yes.
President Wasserman.
Yes, as well. Thank you. Supervisor Ellenberg, you had pulled 47 and then unfolded. So I believe, Jess, that concludes all of our items that we needed to hear tonight. Supervisors, I pride myself in meeting management. I don't pride myself in a 10.5-hour meeting. I apologize to all of you for that. I'll do a better job reviewing the agenda prior. I want to thank all of you that help keep your comments short, that put things on consent whenever appropriate, and have things heard out whenever appropriate. I'm by no means looking to stifle any conversations, either between us or with the public. But I will continue to look for ways, because it's just not fair to the staff or to the public when you get out around 10.5 hours. Most of the public doesn't stick with us for 10.5 hours. I see we're down to 50 participants now. We started the day with 200, but I know those 50 are mostly staff members. So I want to thank staff for sticking with us, and I wish all of you a good night. Thank you.
Thanks, President Wasserman. Thanks all.
Thank you. Good night.
Good night.
Recording stopped.
And with that, this room will be closed. Thank you and have a great evening.